Okay.
All righty. So good afternoon, everybody. It's a pleasure to see all of you today. We have a very busy night and in theory, a very long public hearing. And so we're going to jump right into it. Does either Senator Minor or Representative Brantz have anything? Seeing not right now. I know that Representative Walker will be joining us in a little bit. So the first one up is Spencer Hutchins, and I remind everybody it's 3 minutes. Spencer? Oh my. Do we have anybody over yet?
Thank you. I just got promoted to panelist. Can you all hear me?
Okay, yes, we can, sir.
Great. Thank you all for this opportunity. My name is Spencer Hutchins, and I'm the Chief Executive Officer of Concert Health, a behavioral health medical group providing treatment in Connecticut and across the country. Thank you for the opportunity today to testify in support of providing Medicaid coverage for collaborative care to increase access to high-quality behavioral health services in Connecticut. In 2021, the number of Connecticut residents struggling with depression or anxiety increased from 11 to almost 28%. Many of them will present or seek treatment from their primary care or women's health provider. More prescriptions for depression and anxiety medications are already written by those clinicians than psychiatrists. And the only way to allow for access and treatment for Connecticut residents in need is to expand access to behavioral health care through primary care and women's health providers. Collaborative care rests on a team-based approach where a licensed behavioral health clinician and psychiatric provider collaborate directly with that primary physician to support ongoing care, measure symptoms, provide interventions like goal setting and therapy, and have a psychiatric provider accessible to consult and make recommendations on medication and treatment. Collaborative care outperforms standard of care in both primary and outpatient behavioral health settings. More than 80 high-quality randomized control studies demonstrate collaborative care delivers better access, better outcomes, lower health disparities, and lower medical spending versus alternative care models. We built Concert Health's medical group to be a partner to physicians that want collaborative care for their patients, but don't want to build the program alone. In the last 4 years, we provided care to 25,000 patients, and for the last 2.5 years have been working hand in hand with Women's Health Connecticut to support over 1,000 women in this model. With our recent expansions with Trinity Health and their clinically integrated network Zone, we're excited to bring more access to high quality behavioral health services throughout the state. While over 35% of our national patient volume has been Medicaid beneficiaries, unfortunately, we have yet to be able to serve that population in Connecticut. In fact, the only outlier in the coverage of this benefit in Connecticut is the Medicaid program. 20 states, including Rhode Island, Massachusetts, and New York, currently provide Medicaid coverage for collaborative care. Connecticut's Medicaid program should adopt and provide coverage for collaborative care to help address the state's mental health crisis. If there was Medicaid coverage today, tomorrow we'd be immediately able to treat hundreds and eventually thousands of people with high quality care alongside the provider they know and trust most. To ensure adequate uptake, we have 3 recommendations. 1, pay collaborative care at or above Medicare rates. 2, don't impose any hard utilization limits. And 3, provide pay parity for all provider types instead of a lower rate for nurse practitioners or physician assistants. Thank you all for your time and consideration of this important matter. I've included a copy of a 1-pager on collaborative care with 14 local provider organizations endorsing and a support story document for Connecticut patients enrolled in care. Please do not hesitate to contact me at spencer@concerthealth.io if you have any questions or need additional information.
Thank you, Spencer. Appreciate your testimony. Up next is Lisa Tepper-Bates. Lisa.
Hi, Senator Austin and members of the committee. I am Lisa Tepper-Bates, and I'm President and CEO of the United Way of Connecticut. I'm here to speak in favor of HB 5037's measure, providing the additional funding needed to make DCF's emergency mobile psychiatric services for youth available across the state 24 hours a day, and providing funding to develop a special EMPS team to work specifically with schools and law enforcement. Working in close partnership with DCF, United Way of Connecticut 211's highly trained team of crisis contact specialists and after-hours clinicians provides statewide crisis intervention service over the phone for youth in crisis, at risk of suicide, threatening, or at risk of violence. 211 works with each caller, whether the youth in question, a parent, a guardian, or another concerned adult, to respond and to link the caller to the services required. When needed, 211 can dispatch DCF-funded emergency mobile psychiatric services, which, as you know, are a trained team of mental health professionals who can respond immediately to any place where the child is located. In 2021, 211 handled nearly 14,000 youth mobile crisis calls. 93% were referred to mobile crisis response teams. Mobile crisis support makes available where and when needed the right support, the right people with the right skill sets to de-escalate conflict, to address a mental health crisis, to get the young person to the right ongoing support quickly. Until now, funding has meant that EMPS services were available only from 6 to 10, Monday through Friday, and only from 1 p.m. to 10 p.m. on weekends and holidays. When this assistance does not exist, please understand there is no good alternative other than 911 when an in-person response is required. 211 Connecticut works closely with local and state law enforcement every day, and we're proud to do that. But I will tell you, our partners in policing agree heartily that when law enforcement is not the issue, as is almost always the case when a young person is experiencing a mental health crisis, 911 response may not be the right resource, and mobile crisis almost certainly is the response needed. The proposed commitment of $26.4 million to expand emergency mobile psychiatric services for youth will ensure that this important resource is available 24 hours a day, and the additional provision of $17.2 million to enable an EMPS response team to work specifically with schools and law enforcement is also very important. United Way of Connecticut strongly endorses these items as needed and smart investments in our youth and families. Thank you for your time and attention. I'd be happy to answer any questions.
Thank you very much, Lisa. Appreciate you coming in to talk about this issue, which all of us consider equally as important. Up next is Sarah Lemaster.
Hi, good afternoon, chairs and distinguished members of the Appropriations Committee. I wanted to thank you for the opportunity to speak on the Department of Social Services portion of the state budget. I'm here today to testify on behalf of the Community Health Center Association of Connecticut. As you know, we collectively serve over 380,000 residents every year and specialize in providing care for traditionally underserved communities. I'm immensely proud of the work that our health centers have done in fighting against the virus. Throughout the course of the COVID-19 pandemic, our health centers have been working diligently to protect our communities and support our public health infrastructure. Connecticut's community health centers have provided over 930,000 COVID tests and fully vaccinated over 386,000 residents since August of 2020. This pandemic has highlighted the need for a greater focus on health equity in developing our primary care workforce. Among the many policy changes that took place last year and the proposals submitted this year focusing on enhancing access to care, especially behavioral health care, I would like to take this opportunity to respectfully ask you to make a change to the DSS statutes that's currently in my it will be in my written testimony. Essentially, this asks that we change section 17B-245D from the first line from a may to a shall, which would require the Department of Social Services to make adjustments to health center rates based on changes in the scope of service. Our health centers have added many changes to their scope of work since this statute went into effect and have only had rates adjusted in limited circumstances because of the way the statute is written. They have expanded their scope of work because they identified unmet needs in the communities that they serve. Updating the statute will modernize the cost structure for our health centers and enhance their ability to promote health equity. Additionally, this will address issues in primary care workforce development by enhancing health centers' ability to offer competitive salaries to providers. Under the current structure, health centers have been losing staff due to larger healthcare providers offering higher salaries and better benefits packages. A change in health center rates is a necessary component of enhancing the growth of our primary care workforce, which includes the mental, dental, and behavioral healthcare providers. Thank you for the opportunity to testify on this important issue.
Thank you very much, Sarah. Appreciate you coming in to testify. Up next is Annalee Reed.
Yes, hello, can you hear me?
We can.
Perfect, thank you. To the chairs, vice chairs, ranking members, and distinguished members of the Appropriations Committee, my name is Annalee Reed, Administrator of Allpoint Home Care. Allpoint Home Care offers a variety of home care services, including intermittent skilled care for medication management of adults and pediatric patients. Mental illnesses are significantly increasing, and so is the prevalence of chronic psychiatric patients. As a result of this increase, chronic psychiatric disorders impose a significant burden to patients and their families. Home health care services for medication management can significantly reduce these burdens on the patients, their families, and the healthcare system. Adding the impact of mental health illnesses have often resulted in patients having trouble managing their medications, which may lead to non-adherence, resulting in emergency department visits and hospitalizations. Home health care can significantly reduce the cost of managing these patients at home while improving their quality of life. In addition, home health care minimizes the burden on outpatient services and supports a more independent life for the patient and the family. Medication management can also benefit children with medical conditions such as diabetes. Allpoint Home Care has a specialty program addressing the needs of diabetic children that are not adhering to their medication regimen. We work closely with the Connecticut Children's Center to establish a plan that involves strict diabetes and medication management. Psychosocial considerations have to be made for these clients, as there are often barriers that limit the abilities of the patient to achieve success in their diabetic management. By providing daily home health skilled care, the client is able to manage their disease consistently, which helps them gain control of their blood sugars and A1Cs and prevent hospitalizations. Another cost savings as we help to keep patients out of the hospital. In order to deliver these services to our behavioral medical health clients, we need qualified skilled nursing professionals. The role of the nurses that provide these services is very complex. The clinician must have a strong knowledge base of caring for the behavioral health client, as well as the action, side effects, and potential interactions of medications. During each skilled nursing visit, the nurse evaluates the patient's mental health status and the efficacy of the medications being administered. However, our resources are limited due to low reimbursement rates for these services. Our agency currently has a higher percentage of patients needing services than the availability of staff. We cannot compete with other care providers who can pay more and offer better benefits. In 2016, the home health medication administration rate was cut by 15%. The recent ARPA funding has invested 4.5 back to the providers, leaving a 10.5% shortage. Given the rise in mental health illnesses and the inability to hire qualified nursing staff with the inability to compete for salaries, we are here before you respectfully asking you to consider increasing the medication administration reimbursement rate by 10.5%. This increase will be invested directly to the workforce by increasing wages, offering competitive benefits, providing extensive training, oversight, and retention. Thank you for the opportunity to provide testimony. Feel free to contact me with any questions.
Thank you very much, Annalee. Up next is Carol O'Dwyer. Kara? Go ahead, Kara, you're muted. There you go.
Here I am. All right. Good afternoon, Senator Austin, Representative Walker, if she's on here yet, and members of the Appropriations Committee. My name is Kara O'Dwyer, and I'm a personal care attendant, or PCA, living in West Haven. I'm here today to ask that you invest in home care services so PCAs like me can make a living wage and receive the benefits that we deserve. I have been a PCA for 7 years now under various direct care waiver programs administered by the Department of Social Services and Department of Developmental Services. I have cared for 5 different consumers, people of various ages and disabilities. While I've loved caring for these individuals, I have struggled with the poverty wages I make. I'm a single mother working 4 jobs, living with my own mother who works 2 jobs, also as a PCA. And even with a half a dozen jobs between us, we still struggle to make ends meet. My son's in a technical high school and I just had to spend over $1,000 on uniforms. Despite my dedication, I'm still drowning in student loan debt, and I go without the benefits of having access to health insurance or paid time off. One of my consumers got COVID around Christmas, and I couldn't go to my other higher paying job due to quarantine. Lost over $600 in wages, and I had to use my credit card to catch up on payments due, and I couldn't make high enough payments to avoid having my credit score drop again. I get by on the grace of God and caffeine, but it shouldn't be this way. What we actually need to avoid living in poverty is at least $20 an hour, health insurance, paid time off, and retirement. These are the basics of our ability to care for ourselves, our consumers, and our families with dignity. Thank you for your time.
Thank you very much, Kara. Up next is David Marcus. David Marcus here. If not, we'll move on to Gabrielle Tillis. Number 7, Gabrielle. There you are, sir. You're muted. There you go.
Hello.
There you go. The floor is yours.
Right. Good afternoon, Chair and members of the Senate. My name is Gabriel Talles. I am employed by one of the 5 independent living centers. I am a person with disabilities. I have been receiving vocational services from the Bureau of Rehabilitation. One of them is the job training, which is at the Center of Disability Rights, an independent living center servicing New Haven County. The Bureau of Rehabilitation Services and the Independent Living Center have been working together to develop my skills, making me a productive citizen. I'm testifying today to increase funding for the Independent Living Centers, Bill 5037, so they can help citizens like me to be independent and productive. The collaboration of BRS and the Independent Living Centers give me the real experience. I do the DSS program, Money Follows the Person, and I am a transition coordinator. I transition people from nursing homes into the community. We have saved Connecticut millions of dollars per year by doing that. The independent living centers are unique. They provide services that other agencies cannot provide. It helps people to live independent in the community, prevents them from returning to nursing home. It helps them develop living skills and self-advocacy. I believe that adjusting the budget to high amount will be a great benefit to Connecticut and the residents that live in it. Thank you for your time and consideration. And that's it.
Thank you very much, Gabrielle. Appreciate it.
You're welcome.
Up next, Scott Kaczynski.
Hello, can you hear me?
We can.
Okay, great. I'm Jessica Kaczynski, and first of all, I would like to thank all the members of the Appropriations Subcommittee for giving me this opportunity to make a testimony. I am the administrator at the Fitchville Home, a residential care home in Bosworth, Connecticut. And we are definitely advocating for more residential care home funding. Right now, Fitchville is a 25-bed residential care home that serves individuals that are unable to live independently in the community, many times because of a combination of mental health and medical diagnoses. We're a center that offers recreational activities. We celebrate residents' birthdays. We do holidays. We actively seek out different agencies as well as churches and other entities to come in and do activities with the residents to enhance their lives. My staff work very hard, tirelessly, and they deserve to be paid decent wages. The pandemic continues to have a deep impact on both staff and residents at our facility. In August of 2021, we had an outbreak of the coronavirus at our facility where 90% of the residents and 50% of the staff contracted the virus. One staff member ended up on a ventilator for more than a week. And unfortunately, one of our residents passed away due to the virus. Those that remained at the facility while the staff had to be quarantined, I was one of them, were amazing. Many of them had to work double shifts. It just took a whole stress on people that remained because we were very, very short staffed. And obviously nobody wanted to come into our facility to help because, you know, Corona was everywhere. So it just took a big toll. You know, staff had to work in the middle of summer, wearing full PPE gowns, you know, and they had to conduct all their duties while remaining patient and calm, placating the anxieties and fears of the residents, and helping to facilitate communication with the residents, with their family members. Last year's budget included a transfer of some residential care home spending to Medicaid. This shift was done to save the state money and provide residential care homes with much needed resources. The plan is for residential care homes to become Medicaid billers starting April 1st, 2022. Despite our association meeting with the Department of Social Services several times to discuss this, there's been no operational plan for residential care homes to become Medicaid billers. These funds are critically important to our homes and employees who have been counting on the increased revenue to deal with the impact of the pandemic. We would urge the Appropriations Committee to ensure these dollars go to increasing residential care home rates. We value our employees who deserve so much more for the work they do for a challenging but rewarding population. They have to de-escalate moments of conflict with individuals who have mental health diagnoses that can sometimes be very challenging. They have to deal with the police coming sometimes, the ambulance, interacting with emergency responders. Mandated vaccinations and booster shots during this pandemic has definitely affected our staffing. Many of our staff have had adverse effects to the vaccination and booster shots, causing us to become low staffed while they are out. One of my staff members during her second vaccine ended up in the hospital with an embolism. She asked her doctor for medical exemption from the booster, but was told that the risk of the booster was less than the risk if she got the virus. So she felt forced to take the booster or fearing loss of her employment. Or having our facility fined by the state because she didn't get the booster. This is a valued staff member who has worked at our facility for over a decade. When she received the booster, her blood sugar levels became dangerously high and she almost had to be hospitalized. We have lost staff who feel that they are not paid enough, considering they have to become med certified. And with that role of administering medications comes with it a lot of responsibility and accountability. They argue that there are easier jobs in the community that have higher wages. We've had applicants apply for positions that have great credentials and would be wonderful assets here, but don't consider us when they hear the wage that's being offered. The inconsistent funding also challenges our business operations. We are constantly having to make repairs that are subject to state inspections and yet have virtually no margins to do so. Unlike other providers during the pandemic, we did not see any federal funding to support our work or our employees. The governor's proposal to enable residential care homes to bill Medicaid acknowledges the need for higher rates. We provide a critical service for the state and care for some of the most vulnerable people. We do this for a low cost. My home and other residential care homes throughout the state have had to get by with rates failing to keep up with costs, and yet we serve as a safety net for many people with mental health diagnoses and substance abuse issues. Unlike other providers, our residents are almost all state funded, limiting our ability to cost shift and make up for low rates. Please support residential care home funding so that we can keep our great employees and pay them fair wages while they care for some of the most vulnerable in the state. Thank you very much for your time.
Thank you, Jessica. We appreciate that. Up next is Parisa Chomchi Goodwin. And I have no idea if I said your name right, so.
You said it perfectly. Thank you so much. Thank you, Senator Austin, and all the members of the Appropriations Committee. My name is Parisa Chomchi Goodwin, and I'm testifying on behalf of the Connecticut Oral Health Initiative in my role as the Executive Director. Kohai is a statewide nonprofit that advocates for access to quality oral health services for all Connecticut residents. We strongly support the governor's proposed 25% increase in the adult dental reimbursement rates and the additional increase in the endodontic rates for adults that are very, very sorely needed. We also do respectfully ask for you to consider a larger increase in the adult dental rates to bring them with parity with the child rates. In my organization, we hear from adults on Medicaid about the difficulties accessing dental care. Access to root canals is a particular challenge. There's only one endodontist in the state of Connecticut who currently accepts Medicaid, which causes the wait time to be on average about 4 months, which means that people are living in pain for a very long time. And at that point, a root canal might not even be successful because there might be too much damage. Dentists are reluctant to accept Husky due to the low reimbursement rates, particularly for the adult patients. Many note the large disparity between the child and the adult rates. The adult rates are almost half the child rates, and the care is usually more complex for an adult. The rates have not been increased in 14 years. Costs have gone up over time, and the pandemic has also caused a surge in the price of personal protective equipment. They're spending about $15 or $16 per patient per visit just for the PPE. Our Husky Dental program has a really strong reputation nationally for having relatively high utilization for children. And that's really following the significant dental rate increase in 2009. It passed in 2008 and took effect in 2009. Adults enrolled in Husky have a very different experience. It's imperative that adults have access in order to prevent the worst of oral health outcomes: severe pain, infection, and tooth loss. The need for a dental safety net that's strong is also growing. There's an estimated 39,000 people that will be eligible for the Covered Connecticut program. That program includes Husky Dental, and I am very supportive and excited for more people in Connecticut to have access to dental coverage, but I also want to recognize the strain that this puts on that network. Expanding coverage is an amazing feat and certainly something to celebrate, but it's going to mean that more people are going to be on that network and need more appointments. Coverage is not enough. It's important that people can use that coverage to get the services that they need. This is fundamentally a supply and demand issue. There's not enough providers accepting Husky to meet the need. Dentists have been very clear that the low reimbursement is the main reason that they don't accept Medicaid. So appropriate financing is critical to access. Again, we do support the 25% increase in the rates. I want to thank the governor and the Department of Social Services for their leadership on this, but a larger increase will have a larger impact on the access to care problem. So we are asking the legislature to consider a larger increase if possible. Thank you so much for your time. I welcome the opportunity to further discuss this if anyone would like. Thank you so much.
Very much. I appreciate you coming today. Up next is Karen Carty.
Honorable Chairman, ranking and distinguished members of the Appropriations Committee, my name is Karen Carty. I'm from Rocky Hill, Connecticut. I'm a volunteer advocate and congressional ambassador to the Alzheimer's Association Connecticut chapter. Thank you for the opportunity to comment on House Bill number 5037, an act adjusting the state budget for the biennium ending June 30th, 2023, regarding the Alzheimer's State Respite Program. I know that you have my written testimony, so I'd like to just share some information about my loved ones and that supports increasing funding for the respite program. When my mother and I became caregivers for my grandmother, we quickly realized that we didn't have the necessary skills or time to keep her calm, occupied, and prevent her from leaving our house. Since we both worked full-time, after only a few months, we had to make the devastating choice of putting her in a nursing home where she passed 6 years later. There was no types of services during the day that we could rely on to give us some time and have her get the care for a few hours a day, which would have helped us greatly and possibly would have helped us keep her home. My cousin Irene was in the middle stage of Alzheimer's when the first experimental treatments became available. A mixture of the drugs allowed her to attend an adult daycare center for about a year. My aunt was lucky to have the savings to afford the out-of-pocket costs for the medications and the daycare center. Her time at the center was priceless because it allowed her 82-year-old husband to get food, prescriptions, and then rest for a half an hour before picking her up and starting all over again. Caregivers of people with dementia are twice as likely to report substantial emotional, financial, and physical difficulties versus caregivers of people without dementia. For example, my aunt shattered her ankle after wandering outside and taking a bad fall. To heal her ankle, my uncle had to barricade her into her bed every night to keep her from getting up because she didn't remember that she had surgery on her ankle and that she was in a cast. He didn't sleep more than a few hours a night for months, which led to a dramatic and unhealthy weight loss, isolation from others, and increased anxiety about how he could keep her safe. The statistics in my testimony show the expected rise of Alzheimer's diagnosis in Connecticut from 80,000 to 91,000 people in just 3 years. Respite services like adult day centers provide temporary substitute care that give caregivers a break from constant caregiving, many times on top of a full-time job or other family responsibilities. With the diagnosis rate growing so rapidly, especially in younger people in their 40s and 50s, funding for affordable respite programs is now critically needed to meet the growing numbers of people who are taken care of by their family. Increasing funding for the Alzheimer's respite program is actually less expensive for the state, so it's fiscally responsible as well. Thank you for allowing me the opportunity to provide you my comments, and I'm happy to take any questions.
Thank you very much, Karen. We really appreciate you coming on. Up next would be the in the queue. So we'll go to number 12, Prodon.
Good afternoon, Senator Weston, Representative Walker, and member of the committee. My name is Prodon. I am a PCA living in Norwich. I came before you today to ask you that you invest the funding required to pay PCAs as a livable wage and provide us quality benefit. While I have only been officially working as a PCA for 6 months, I have provided this type of care for my father for over 10 years. Caring for my father is something that I am honored to do. I love helping him to be more active and to live more fulfilled life. While it is nice to be paid for care for him, I would do it either way because it is my responsibility. My sister is a PCA as well. It is in my family's culture to care for one another. However, just because we love our father and love caring for him does not mean that does not come with its challenges. I had to quit my other job in order to care for my father. So now my primary source of income is through my working as a PCA. I would maybe get a second job, but I also am going to school because I need to make more money than what I'm making as a PCA. I want a family of my own soon. And So I must find a career that will allow me to afford this. Working as a PCA opened my eyes to struggles of living in poverty. One event away from a crisis. Last year, my dad got sick with COVID and I could not work. I did the COVID test on Saturday when it came out negative, and I became sick following Monday. I did not do the test, another test, just I felt like it was COVID. I went to DOL and they gave me problems getting paid unemployment. They give me $107 for the week while I was making over $500 a week as a PCA. Then they sent me a paper to fill out, and the lady I spoke in the DOL told me I do not have to fill out. If I want to fill out, then it's fine. Then I got a letter saying that I did not show up for hearing. I don't remember getting any hearing date and details. Now they're saying I owe the money back, which is difficult as I don't make very much to begin with. I filed an appeal and writing for a response. This story is merely an example how unstable life can be as a PCA. Your employment is tied to your consumer and without livable wage, paid time off, and other benefits, you become very vulnerable. You begin to feel as through the one accident or negative life event is all it will take to send me spiraling into financial crisis. This is unacceptable for any worker, let alone a PCA. Let alone a professional caregiver such a PCA. We need to do better as a state, and that is why I have came before you today. Please properly find home care service so PCA can earn livable wage and receive the benefit we deserve. Thank you for your time.
Thank you very much, Fasel. Bree, you'll be up next. Bree Sanka, but wait 1 second. Taylor, you have 2 numbers to identify.
Yes, I actually have 3 now. So I'm going to start with the first one with the phone number for 860-236-2901. If you could just identify yourself, you can press *6 to unmute. One more time, 860-236-2901. If you could just tell us who you are. All right, I'll move on to the other number. I have 860-858-5000. If you could let us know who you are. *6 will allow you to unmute. 860-858-50000. I think I said one too many zeros.
I was trying to figure that out if you said.
All right. Last number here, 860-964-4630. If you could press *6 to unmute and just let us know who you are. 860-964-4630.
Well, we're batting 0 for 3.
I see the 5000 number is unmuted. Can you hear us?
Hi, can you hear me?
Yes. Can you just let us know who you are?
I can. This is Christy Doherty from Vernon Manor Healthcare Center.
All right. I'm going to rename you and I'll get you on the list. Thank you.
Thank you.
So up next is Bree Sanka.
Good afternoon.
Good afternoon.
Senator Austin, Representative Walker, Senator Moore, Representative Abercrombie, and distinguished members of the Appropriations Committee. My name is Bree Sanka. I'm the Regional Vice President for Behavioral Health at Alara Caring. And I'm an RN with over 20 years experience, most of which has been dedicated to home health. I also serve as the board chair for Connecticut Healthcare at Home, the state association representing licensed and certified home health agencies throughout Connecticut. Alar Caring, formerly New England Home Care, has been the largest provider of behavioral health home health services in Connecticut, serving nearly 3,500 Medicaid beneficiaries in their homes and communities. The public health emergency that continues to impact our state only intensifies the need for home and community-based services for Connecticut's most vulnerable population. While many community support services have retreated during the pandemic, home health continues to provide valuable and necessary services to those with behavioral health conditions. Throughout most of the pandemic, a behavioral health nurse may have been the only human contact that many of these patients had, illustrating just how vital a role home health has played in the continuum of care. This has not been the exception over the last 2 years, but the rule. Despite the ongoing commitment to maintain patients in their homes, behavioral health home services remain grossly underfunded. In fact, medication administration rates were cut by 15% in 2016, forcing many agencies to discontinue serving Medicaid beneficiaries altogether. This drastic cut in reimbursement negatively competes with the state's ongoing initiative to maintain the behavioral health population in their homes rather than in expensive institutional settings. The rate cut was predicated on the assumption that medication administration in the community was simply that, ensuring a patient remains compliant with their medications. There's an overwhelming simplification of all that our nurses do to safely manage the behavioral health population in their homes, coordinating their care with community physicians and other mental health providers, conducting assessments, ensuring adherence to outpatient appointments, case management, and medication reconciliation are all necessary and important elements of a routine medication administration visit. Inclusion of home health as part of the ARPA funding was appreciated and recognized. However, delays of the much needed one-time 5% FMAP payment continue with no definitive timeline for distribution. This payment would provide some much needed relief to those agencies that continue to provide services to the Medicaid community. Underfunding coupled with a public health crisis that simply exacerbated an already strained system is a true threat to the Medicaid system as we know it. Restoring rates for behavioral health focused services delivered in a patient's home would be a major step towards ensuring that the infrastructure built to support one of the state's most vulnerable populations remains intact and viable. Failure to do so could threaten access to care that all the stakeholders have fought so hard to improve for decades. Please consider restoring the 10.5% to the medication administration rate so that we can continue to improve the lives and outcomes of Connecticut's behavioral health population. Thank you so much.
Thank you, Bree. We appreciate your story and comments. Up next is Darnell Ford.
Good afternoon, Senator Austin, Representative Walker, if she's there, and members of the committee. My name is Darnell Ford, and I work at the Solnit South Children's Psychiatric Center. I've been a lead children's services worker there for the past 24 years. We work with children who need support services for their mental health issues when they're at their most vulnerable point in their lives, which means, again, that could be the possibility of the community services not being available, or they've reached a critical point in their treatment care plan that they need our level of care. So today I'm here to ask that you truly understand why we need to fund all 100 staffing vacancies and another potential 97 up-and-coming vacancies due to retirement to restore the capacity at our DCF facility and expand the mental health services for our children and families. At DCF, Solnit Psychiatric Center, we have the capacity to care for more than 80 children, but due to short staffing, we only provide care for less than half. We've heard and seen the supports of children languishing in emergency rooms, yet those unused capacities of offline units at Solnit South lead us to ask the question, could we have been helping more children? Should we be helping more children to change the lifetime of trauma that they're going to experience with those units being open and functioning? Instead, our conversations wind up being the shifting and shuffling of money from one sector to the next. there's an entire infrastructure already in place that simply needs the funding. So we continually have the same conversations repeatedly while our children suffer, our families suffer. And we have to try and decide when are we going to act, and act in a way that changes those outcomes. The infrastructure that's in place is underutilized because of short staffing. It hurts our families. It leaves them in life and death decisions. And unfortunately, to the capacity of no returning from the level of trauma that they experience. We're not asking for you to reinvent the wheel. The infrastructure is there. We need it fully supported. There's an interdisciplinary and interagency teams that can provide the responsible services for the children. When DCF looks at the children in all settings and touch points of their lives are considered, we wind up being able to get them stabilized in our facility and out to the mentoring or the in-home services that they need. We have a chain. There are weak points in our chain because of lack of staffing and resources. So we need to be able to change that. We can applaud some of the efforts that the state legislator has committed to, more towards the social workers in school and expanding preventative care. But we need to fully understand the continuum of care at every touch point of our children in crisis. And to meet those needs of our state, we need to expand all wraparound services, which include school counselors or preventative care, home-based supports, or inpatient stabilization, for which our kids can lead and have a better chance of leading a full, fulfilling life. To significantly alleviate this crisis and mitigate it, we must at minimum stabilize the public infrastructure. The public sector simply cannot and does not have the capacity to do it all on their own. DCF public sector works to provide interagency and interdisciplinary structure that all children need. A fragmented system creates fragmented and less care. If we chop it up, then we only have chopped up services. I can assure you we will be back here again having the same conversations. It's just not something that, going into work and knowing that we're not going to be able to provide the level of care outside of our facility that would
Mr. Ford,
give the children. Absolutely. So expanding the safety net that we have is critical right now. DCF healthcare workers know the kinds of the need for our communities. We need early intervention training, mental health care in schools in our communities. That takes all resources we have as the wealthiest state in the country. We need to encourage these direct care resources towards expanding the services that our community need. I thank you very much for your time and listening.
Thank you very much, Mr. Ford. Up next is Mark Derosier. Mr. Derosier, 3 minutes.
Thank you. Good afternoon, Senator Austin, Representative Walker, and members of the Appropriations Committee. My name is Mark Derosier, and I reside in Columbia, Connecticut, and I've practiced dentistry in Connecticut since 1988. I'm an endodontist specializing in root canals. Now, I know many of you on this Zoom call probably just recoiled at the thought of a root canal. Well, I want to stress how important prevention is in dentistry in general, and especially when it comes to root canals, because we help prevent the loss of teeth. And when done in a timely manner, they can be very comfortable. I am asking you to increase the fees paid to Medicaid providers that provide adult dental care, and especially endodontic care. Medicaid requires our state to provide for a proper and adequate provider network. We are at risk when that network is not adequate. Sadly, it comes down to compensating providers adequately. Years ago, our state did not have an adequate network. The state was sued successfully and then was forced to increase fees. Interestingly, that worked. Once the fees were increased, we had an adequate level of providers because the providers stepped up and participated in the program. Although Medicaid only forces states to have an adequate network for children, my point here is if you have an adequate fee compensation, you will have an adequate provider network. Sadly, adult fees are not anywhere near the fees paid for children, and fees have not increased since 2008. How many citizens of our state would still be working the same job if their salary was not increased since 2008? For me personally, I used to participate but can no longer afford to. Current Medicaid fees for adult molar root canals are $455. I spend an average of an hour and a half doing this procedure. I can guarantee you that my overhead far exceeds this fee. How then could I be expected to accept it? Our expenses have increased since 2008 and have especially increased since the COVID pandemic. Personal protective equipment has increased greatly due to supply demand issues, and now we see the cost of all goods increasing significantly due to supply chain issues and inflation. And yet, the adult Medicaid root canal molar fee is still at a low level and one that has not increased since 2008. Contrast the $455 adult fee with the molar root canal fee for a child at $857, and you begin to see the discrimination shown against adult care. Our children take their cue and learn from our actions as parents. If our children do not see their parents practicing good dental health care, are they as likely to grow up practicing it themselves? I think not. Pardon the cliches, but this is money well spent. A stitch in time does save 9, and an ounce of prevention does save a pound of cure. There are scientific studies showing that when there is not an adequate network of caregivers with proper coverage, more patients defer care or go to hospital emergency rooms for their care. Either way, we know that this ends up costing more and yielding inferior healthcare results. In the case of root canals, there are so few providers that patients are forced to wait weeks to months for an appointment. This is not an acceptable situation when our citizens are suffering with a toothache. As a result, they incur emergency room bills or give up and get the tooth removed. Please include appropriate money in House Bill 5037 to adequately cover adult dental care and specifically endodontic care in the state budget. Thank you, and I'm happy to answer any questions.
Thank you very much, Mr. Derosier. We really appreciate your testimony. Up next is Eva Santiago with Miguel Guevara. Eva? Number 17, Eva.
Eva,
Santiago.
¿estás conectado? Hola, Eva. I don't see Eva in the gallery.
I don't either. Go ahead, sir.
She's the one speaking. I'm just translating for her. I can try to communicate with her to get her on.
All right.
She's in, she's just not allowing me to promote her, and I've given her the permission to talk as well. If you could just explain to allow me to do that.
I got you guys. Thank you. Give me 1 second.
So why don't we go on to, while he's doing that, we'll go on to Bruno DeFera for Raj, number 18.
Hello. I'm
Go
here.
ahead. 3 minutes, please.
Okay. Good afternoon, Senator Austin, Representative Walker, Senator Minor, Representative France, and members of the Appropriations Committee. Thank you for the opportunity to testify on the Human Services section of the budget. I'm Bruno DeFera, Vice President of Programs and Operations for the Alliance, which is the statewide organization representing the nonprofit sector. As you're aware, the children's mental health crisis continues to worsen as providers report seeing an unprecedented high volume of children and families with more acute illness. The crisis is best illustrated through the immense and ongoing increase in the emergency room department used by children in need of mental health services. I'm here today to ask you to honor the long-term plan to address underfunding of community nonprofits and fund services by $461 million over 5 years, or an additional 8% in fiscal year 23. This would build on the 4% COLA that you included in last year's budget, for which we are appreciative. We've been really encouraged to see that the legislature's focus on the children's mental health crisis this year, but to be clear, there's no way to address the gaps in the children's mental health crisis and mental health system without addressing the chronic underfunding of the existing array of services provided by nonprofits. The governor's budget includes new children's services such as expanding mobile crisis and establishing short-term urgent crisis services and subacute crisis stabilization units. We support these proposals, but we're concerned that the budget does nothing to support the existing infrastructure and foundation upon which children's services are built on. We are particularly interested in the reasoning behind the proposal to create new residential programs in these crisis units when the current year's budget closed therapeutic group homes and DCF is slated to close SFIP programs next month. It seems as if demand exists for these residential services, but we're concerned that the justification for closure of existing programs is low utilization. If the demand exists for subacute crisis stabilization residential units, why was utilization low enough to close the therapeutic group homes and SFIP programs? Earlier this morning, the department said that they had discovered some residential programs were operating outside of their scope. In speaking with providers, we hear that oftentimes children were staying longer than the programs were originally designed for because there weren't appropriate placements readily available and waiting for them after they had reached their design length of stay. We don't see any proposal in the governor's budget to address this issue. We urge you to please fight for funding for children's services by implementing the Alliance's plan for $461 million. Our ask comes at a time when nonprofits are experiencing a severe workforce shortage. Nonprofit staff, many of whom have stayed for years because they believe in the important work they do, can no longer make ends meet with low salaries that state contracts currently fund. They're taking jobs at fast food restaurants, Amazon, or in big box stores, which can pay up to 30% more in wages, require no specialized training, and are offering more hiring incentives. Even clinical staff are being lured away by lucrative offers from school districts and telehealth companies. In a recent report the Alliance published, we found that across the state, nearly 18% or 1 in 5 nonprofit jobs are vacant right now. More than ever, providers desperately need funding and a commitment that their work is and the children and families they serve will continue to be a priority. We need you, the General Assembly, to continue your work to increase funding. Thank you for your time and consideration.
Thank you. Mr. Rivera, did you get Eva on?
Yes, Eva, Eva, puedes empezar cuando quieras, ¿ok?
Okay.
Ya estamos listos.
Ok. Buenas tardes, senador Austin, representante Walker y miembros del comité. Mi nombre es Eva Santiago y soy asistente del cuidado personal PCA de New Britain. Me presento ante ustedes hoy para pedirles que asignen fondos para que los trabajadores del cuidado doméstico puedan recibir salarios dignos y mejores beneficios.
Good evening, Senator Austin, Representative Walker, and members of the committee. My name is Eva Santiago, and I'm a personal care attendant, PCA, from New Britain. I come before you today to ask you to allocate funding so home care workers can be paid living wages and receive better benefits.
Empecé a trabajar como PCA hace 15 años cuando vivía en Nueva York. Estaba interesada en el trabajo de brindar cuidado a gente con discapacidad y descubrí que necesitaban un certificado para hacerlo. Por suerte ofrecían un certificado y clase en español, así que decidí tomarlo. Eventualmente me llevo a cuidar de mi propia madre.
I began working as a PCA 15 years ago when I was living in New York. I was interested in companion and homemaker work and discovered I needed a certificate to do so. Luckily, they offered a certificate and classes in Spanish, so I decided to take them. It eventually led me to taking care of my own mother.
En general, este trabajo se hace desde el corazón. No entra en este trabajo para ganar dinero. Cuidar de los demás es un trabajo duro, pero para mí es una vocación.
Lo puedes leer en todo, si quieres.
Ok. Amo a mis consumidores y trato de cuidarlos como si fuera mi familia, porque solo se puede cuidar a las personas en esta línea de trabajo con amor. Con PCS ayudo a mis consumidores a vivir su vida más independientes y dignos. Ayudo a bañarlos, a cocinar y alimentarlos y recordarles de sus citas médicas. Lo llevo al médico constantemente. A cualquier cosa que pueda tener mi consumidor, lleno formularios para sus citas médicas, de seguimiento a la atención, al tratamiento y a la recuperación. En última instancia, soy una línea de vida para mi consumidor. Nuestro cuidado es la diferencia entre simplemente sobrevivir y vivir.
Overall, this job is done from the heart. You don't go into this work to make money. Taking care of others is hard work, but for me, it's a calling, it's a vocation. I love my consumers and I try to take care for them like they are my family, because you can only care for people in this line of work with love. As a PCA, I help my consumers live their most independent and dignified life. I help bathe them, I cook and feed them. I remind them of doctor's appointments and take them to the doctor. I document every injury or anything that my consumer may have. I fill out forms for the doctor to follow up on care, treatment, and recovery. Ultimately, I am a lifeline for my consumer. Our care is the difference between just surviving and living.
Aunque amo mi trabajo, puede ser un trabajo muy difícil. A menudo estoy agotado física y mental al final de un turno. Mi trabajo se requiere que haga mucho trabajo pesado, lo que afecta a ti. Puede ser muy frustrante trabajar muy duro y sentirse infravalorado porque le pagan muy poco y no le dan ningún seguro médico ni tiempo libre pagado. Es agotador, es insostenible trabajar tan duro y luchar para llegar al fin de mes y no poder tomarse un día libre cuando esté enfermo, porque no lo puedo permitir.
Although I love my job, it can be very difficult work. Oftentimes, I'm exhausted physically and mentally at the end of a shift. My job requires me to do a lot of heavy lifting, which takes a toll on you. It can be very frustrating to work this hard and to feel undervalued because you're paid so little and not giving any health insurance or paid time off. It's draining and unsustainable to work this hard and this struggle to make ends meet or to be able to take a day off when you're sick because you can't afford it.
Ella, you almost done here because she's got to wrap it up.
Awesome.
3 minutes, so-
Eva, si puedes con el último párrafo y terminamos.
Ok. Salarios y beneficios y dignos significantes que nosotros como consumidores podemos llevar una vida digna e ir a trabajar enfocado únicamente en nuestro cliente en lugar del millón de cosas que pasan por su cabeza como una persona que vive en la pobreza tratando de sobrevivir. Eso es todo lo que estamos pidiendo. Hagan lo correcto y asignen este fondo para que finalmente podamos ganar los salarios y recibir los beneficios que merecemos. Gracias por su tiempo.
Livable wages and benefits means that we as caretakers can live a dignified life and go to work solely focused on our client rather than the 1 million things that run through your head as a person living in poverty trying to survive. That is all we are asking for. Please do the right thing and allocate this funding so we can finally make the wages and receive the benefits we deserve. Thank you for your time.
Thank you very much, Miguel. Thank you very much, Eva. And I'm turning this over to Representative Abercrombie at number 19.
Thank you, Madam Chair. Barbara Ocasio?
Yes.
Hi, welcome.
Welcome. Thank you. Good afternoon, Senator Austin, Representative Walker, and members of the committee. My name is Barbara Ocasio, and I am a CNA at Avery Heights in Hartford. I have been a CNA for over 18 years at my facility. Over the years, my coworkers and myself have seen so many changes in the types of residents that we care for and the staffing ratios. Today's residents is much more complex than years prior. There are much more complex medical cases coming from the hospital, behavior patients, and residents suffering from substance abuse. These residents need much more time for care than traditional or elderly residents. I find myself having to do double the work in the same amount of allotted hours, which makes it very difficult to give quality care. I treat my residents like they are family because they are my extended family. It is a horrible feeling when you cannot care for the residents the way you know they should be cared for. Staff have been working very hard and many of us are tired. Our residents' acuity has risen. We have less staff, more workers are being hurt on the job, and we care for more residents than we did years prior. It has been a hard road, but doesn't seem to be getting any better. The staff that have stayed since COVID are now working double shifts to ensure the residents receive care. I do not know how much longer we will be able to continue working the way we are. We need hope. Hope that staffing issues will change, hope that facilities will have to change the staffing levels at long-term care facilities, hope that we can give quality care, and hope that we can ensure more staff. Hope that employees will want to work in the healthcare. Since the start of COVID, many employees were and are fearful of entering the healthcare field. Many were fearful of continuing their careers in the healthcare and they resigned. The facility continued to take admissions. The community has a need for service at long-term facilities. However, we need workers. We need to be able to work a normal week. We need to take care of our residents and provide quality care. We need to be able to not worry about becoming injured on the job because of the heavy workloads. Please help us and the most vulnerable residents in the state of Connecticut. We need change. Thank you for your time.
Thank you, Barbara. Thank you for your service. We appreciate it. Up next, Kathleen Garrity. Kathleen, you're on mute.
Thank you for that. You'd think after 2 years I'd have this down. I apologize. Senator Austin, Representative Walker, Representative Abercrombie, and members of the committee, I welcome this opportunity to meet with you. I am Kathleen Garrity, Executive Director of the Connecticut State Dental Association. CSDA's 1,800 member dentists provide a wide range of preventative and restorative oral health care to Connecticut's diverse population. As general practitioners, pediatric dentists, endodontists, periodontists, oral surgeons, prosthodontists, and orthodontists. CSDA is proud that our 155-year history includes a sustained, robust effort to care for everyone, including community-based care for those with limited financial means. Many citizens of Connecticut rely upon our members for dental services through the Husky Dental Medicaid program. We urge you to increase the adult dental Medicaid provider rates at this time. This increase is necessary to maintain the precarious balance of non-emergency care in communities with lower income levels. Dentist participation in the state program is an important aspect of the CareNet, and as Dr. Derosier previously mentioned, the lawsuit that settled in 2008 enacted sweeping dental Medicaid reform. Prior to that settlement, only 125 dentists in Connecticut were providing any significant amount of care to those enrolled in the Husky program. Because there were so few dentists accepting Medicaid, children and adults on Husky were unable to receive dental care and utilization was low. No one wants to return to that scenario. Upon the settlement of that lawsuit, dental Medicaid reimbursements were increased and more dentists enrolled as Medicaid providers. Today, I'm happy to say that more than 2,300 dentists are active participants in the program. However, it's been more than 13 years without an increase in reimbursement, and in order to retain a strong dental care safety net, dental Medicaid rates need to be increased. Dental practices face the same inflationary increases as other small businesses and the same pressures to increase compensation to maintain quality staff. In addition, PPE costs have quadrupled during the pandemic, and extra equipment that's necessary to protect patients and staff from COVID-19 have further increased overhead costs. Even when a dentist is able to donate their professional services, the costs of care have increased dramatically and the reimbursements have not. For adults, the situation is even more stark. Dental care for adults enrolled in the Adult Dental Medicaid program is not well funded, and Connecticut is the only state in the country that has a differential in fee schedules for adults and children. According to the latest data from the Health Policy Institute, Connecticut has a Medicaid reimbursement rate of 67.2% of the private insurance reimbursement rate for child dental services, but only 37.5% the rate for adult services. In addition, many dentists do not even see new adult members at all. For the drop-off rate between people that receive Medicaid care as children. Yes.
Kathleen, can you wrap up, please? Your 3 minutes are up.
I will, absolutely. Now is not the time for the state to break its promise to the poorest citizens of our state or to the dental providers whom these citizens rely upon for needed oral health care. I ask you to please follow the lead of others. They have asked you as our allies in dental health care to continue to review the cases of the reimbursement rates and endorse this movement and this bill. Thank you very much for your time.
Thank you. Have a great day. Up next, number 21, Stephen Gorelli. Stephen.
Good afternoon, Madam Chair and members of the committee. My name is Stephen Girelli, and I'm the president and CEO of Klingberg Family Centers, where I've been an administrator for over 30 years. Klingberg serves children and families from central Connecticut through an array of over 20 programs, including special education, foster care, parent visitation, and outpatient and school-based therapy services. Klingberg, like all of the other nonprofit human service providers, is at a crisis point. We have struggled for nearly half of my tenure here with increasingly inadequate funding. That inadequacy has compounded year over year, making it increasingly difficult to provide high-quality care to the children and families that we serve. And like many others who will testify before you, we are very nearly at a breaking point. Plain and simple, we're not funded adequately. Yet somehow we've managed. We've managed by appealing to our employees' commitment and passion for the work, by emphasizing the value of belonging to a close-knit team, by raising up our mission to a higher purpose, and by stoking the very legitimate pride that our staff take in their work and in the accomplishments of our clients. But with the added pressures created by the pandemic, that ability to just barely squeak by is now in very real jeopardy. We are facing unprecedented staffing crises that threaten our ability to provide adequate, let alone excellent services. Klingberg currently has 45 vacant positions out of a normal contingency of 320 employees. That's a vacancy rate of nearly 15%, and many of those positions have been open for months. These shortages dramatically reduce the services we can provide at a time when the need for services is growing exponentially. To give a historical perspective, in fiscal year 2020, we served roughly 2,000 kids and families. That number went down by 12% in fiscal year 2021, and at the current rate will be down another 15 to 20% in this fiscal year. To put that into human terms, we are currently serving 75 fewer families in our outpatient clinic. Our trauma specialty service has a 2-month waiting list. 15 youth are awaiting slots in our special education school, and we are providing 30% fewer opportunities for parents and their children placed out of home to visit each other. Moreover, when clients leaving our services need aftercare, they encounter untenable wait lists, 1 to 2 months for clients awaiting outpatient therapy, escalating to 6 to 8 months for those in need of intermediate levels of care. You began the process of addressing the crisis with last year's COLA. Please do not let the opportunity pass to further address these dire needs by again supporting increased funding to Connecticut's nonprofit human service providers. Thank you for your time and attention, and I'd be happy to answer any questions.
Thank you, Stephen, and thank you for your work. Have a great day.
Thank you, you too.
Up next, Charles Herrick. Charles? Number 22. Okay, we'll move on to number 23, Suzanne Lagarde. Hi, Suzanne.
Hi, Representative Abercrombie. So thank you so much for the opportunity to speak today. My name is Dr. Suzanne Lagarde. I serve as the CEO at Fairhaven Community Healthcare, a federally qualified health center which has served the residents of Southern Connecticut for over 50 years, and which in the past year provided broad services to over 31,000 primarily minority low-income individuals. First and foremost, I want to applaud the sweeping social justice initiatives in this budget. The budget rightfully acknowledges significant challenges currently facing our communities, and I'm thrilled that the legislature is tackling many of these challenges head on. I want to single out 2 elements of this legislation. The first is the issue of LARCs, or long-acting reversible contraception. The proposal to cover the cost of IUDs for Husky women is not only a good health decision, it's extremely cost-effective. I've never understood the rationale behind the current policy of not providing easy, free access to these effective contraceptives. Stories abound of women becoming pregnant while trying to get coverage for IUDs. Instead of paying as little as $100 for an IUD, the state ends up taking on the cost of a delivery, and in many instances, the cost of covering the child for the next 18 years. By partnering with health centers like mine, we can take advantage of the 340B program, which reduces the cost of LOCs by 50% or more. So please keep this relatively small budgetary item in place. The ROI, I promise you, will be substantial. Secondly, and lastly, I need to address the issue of equity. A lot has been stated and written about the administration's and the legislature's commitment to equity. While I applaud the efforts to date, I need to make it clear that true equity will never be achieved until we recognize the more than 100,000 Connecticut residents who are not eligible for any of the legislation currently being proposed. I refer to immigrants who are not eligible for Medicaid. Our responsibility to our neighbors and friends in the immigrant community is being ignored. We have spent the past 2 years enduring a pandemic of unprecedented proportions. During the pandemic, we spoke of how we are, quote, all in this together. However, we are not responding as if we are all in this together. During the pandemic, many of the frontline workers who kept us fed, kept our streets clean and our garbage hauled away, and in many instances who cared for our children, are not eligible for most of the proposals included in this budget. At our health center, when COVID vaccines became available, we mounted a massive door-to-door campaign that knocked on over 5,000 doors and successfully got thousands of people vaccinated. This campaign was carried out in large part by over 400 volunteers, many of whom are undocumented. Their actions literally saved lives. Despite our lack of commitment to them, they stepped up. Yet we continue to turn our back.
Suzanne?
Yes.
Can you summarize, please?
I am. I have 2 sentences. Yes. We continue to turn our backs on these neighbors, people who pay taxes, and many of whom have been a part of our communities for decades. This is morally wrong. It is morally offensive. I urge the legislature to do the right thing and ensure true equity for everyone. Thank you. Thank you, Representative Abercrombie.
Thank you, Suzanne, and thank you for your work. I'm going to go back to number 22. Charles Herrick, I think, is here. Charles?
Yes, thank you. Thank you, members of the Appropriations Committee, for allowing me to speak. My name's Dr. Charles Herrick. I'm the network chair for New Vance Health, which includes a number of hospitals in Connecticut, Danbury, New Milford, Norwalk, and Sharon Hospital. And I want to take this time to express our support for House Bill 5001. As many people have spoken today, including Mr. Ford and Mr. Girelli, behavioral health has faced an unprecedented demand since the COVID-19 pandemic, and at the same time have also experienced a huge drop with staff departures. And this together has created a tremendous problem for all of us to provide the services that are so needed in our community across the state. And so this bill, I think, allows us the beginning of trying to correct this difference between the increased demand and the decreased staffing. In particular, we think, in fact, the collaborative care management model in sections 57 and 66 are going to be very beneficial to our patients. This model has proven to be beneficial in states such as Rhode Island, Massachusetts, New Hampshire, and New York. We use it in our New York hospitals. It has been very, very successful in helping to support the primary care physicians as well as the patients who they see who are struggling with mental health issues. We also support the Section 46 in trying to improve grants to employers who need child psychiatrists to be able to provide the services so necessary for the population. We also approve and support the telehealth extensions that are being called for. Telehealth has been instrumental in meeting the needs of our community during this pandemic, and it is here to stay, and we need to continue to support it. We also think that in order to improve the staffing, you need to expedite licensure of behavioral health clinicians. You need to increase access to community services for behavioral health, both in primary care and in Section 9 in the school-based health clinics. We also urge you, particularly dramatically, to support an improvement in access to inpatient psychiatric beds, particularly in the youth and adolescent population, which have found an incredible surge in patients waiting for inpatient psychiatric beds. There have been some model programs in Massachusetts to support funding, and we urge the Appropriations Committee and the legislatures will look at those programs that have provided grant supports for increasing beds in
Charles,
those
can you
areas.
summarize, please? Your 3 minutes is up.
Okay, well, in the end, thank you for this bill, and thank you for supporting behavioral health needs in our community.
Thank you, sir. We appreciate you taking the time to testify. I'm just going to ask people that are testifying to please really try to adhere to the 3 minutes. It's not for us as policymakers that are sitting here. It's for the people that are like a number 180 or the person that's 197 that doesn't get to testify until 11 o'clock, 12 o'clock tonight. So please, I'm going to cut you off if you go over the 3 minutes. Thank you. Next up is Richard Wu. Richard? I don't see Richard. If he comes on, we'll go back to him. Moving on to Catherine Riley. Catherine, hi, Catherine.
Good afternoon, Senator Representative Abercrombie and members of the Appropriations Committee. I'm Kathy Riley, and I am the Director of Healthcare Advocacy and Legislative Liaison here at Gaylord Hospital. And thank you for the opportunity to testify in support of a Medicaid rate increase for the hospital. Gaylord is a 137-bed long-term acute care hospital. We're nonprofit and we're freestanding. We discharge about 1,500 patients every year. The patients are admitted from acute care. They're the sickest of the sick, and they really need the oversight of a physician with multiple medical modalities and extensive rehab therapy. Our current Medicaid rate has not changed since 2008 until the current fiscal year when we received the 2% increase. Cost of care has significantly increased over the past several years and has accelerated due to the pandemic. In addition to supply chain issues, labor has increased significantly as well. Workforce is difficult because of the acute shortage of qualified personnel, and therefore we have an increase in recruitment and retention costs. We currently admit as many Medicaid patients that we can care for within the parameters of the resources available. There's a deficit between the average cost to treat Medicaid patients and the level of Medicaid reimbursement, and that's somewhere between $400 and $500 per day. We're asking for a 20% increase in our Medicaid rate so we can treat more individuals who are on Medicaid. We recently had a temporary additional $500 a day rate increase from DSS to treat patients who are on ventilators. That would help free up ICU beds in the hospital. This will expire with the public health emergency. There's still a significant number of patients with medical complexities and care needs that often mirror the cost of ventilator patients for whom there's not an additional payment. It really pains us to deny admission for any patient whose care needs we cannot meet. The 20% requested Medicaid rate increase will never meet the deficit in cost of care, but will allow us to accept more Medicaid patients without significantly affecting our ability to remain fiscally viable. We'll be able to continue to provide quality care to all patients, provide adequate staffing, invest in infrastructure and new technology, and continue to be good support to the acute care hospitals. Gaylord has been a key resource to our acute care partners during the public health emergency, helping them meet the increased demands on their census. We've discharged nearly 300 COVID patients ourselves. Most have been able to walk out of the hospital and continue to recuperate at home, even though they came to us often on ventilators.
Catherine?
Thank you very much for your time and consideration in this important matter.
Thank you. Have a great day.
Thank you,
Kristen
Representative Abercrombie.
Thank you, Representative Abercrombie, and good afternoon to the rest of the committee members. My name is Kristen Mabrook. I'm the Executive Director at Naugatuck Youth Services, the nonprofit organization that serves as the designated youth services bureau for the borough of Naugatuck. I also serve as the treasurer of the Connecticut Youth Services Association, or CYSA, the professional association that works to support and strengthen the network of 103 youth service bureaus throughout our state. So I'm very familiar with the variety of services that are offered by YSBs in communities across Connecticut. My organization does prevention, diversion, and life skills work, including coordinating the Juvenile Review Board and Prevention Coalition for Naugatuck, with a focus on youth leadership development and mentoring, as well as local service coordination and advocacy. We receive funding from the YSB and YSB Enhancement Grant in the Department of Children and Families budget, as well as Juvenile Review Board funding. We consider ourselves the prevention organization for our community, focusing on the strengths, assets, and relationships of young people in Naugatuck so that we can prevent risky behaviors and bigger problems like substance abuse, violence, and suicide. One thing I would like to remind you is that diversion is prevention. YSBs around Connecticut are working on the front end of the justice court and child welfare systems, doing everything that they can to keep young people healthy, safe, and productive in their own communities. Funding for YSBs and JRBs, which continue to receive your support, and the community-based diversion system, which was codified in state statute in 2018, but has not yet been funded, are long-term investments in the future, healthier outcomes for our young people, and money saved for our state. As we enter junior year of the COVID-19 pandemic, YSBs will continue to play a critical role in working with youth and their families to adjust, to recover, and to move forward in a healthy manner. We need opportunities for positive youth development, mental health promotion, and service coordination to be available for all of our young people in all of our communities. Families in towns like Naugatuck need YSBs to continue to be resourced in ways that allow them to be flexible, adaptive, and responsive to changing local needs and challenges, to help coordinate access to services when service areas and referral processes for regional providers can be difficult or confusing to navigate, and to be a supportive member of their village. I'd like to thank the governor for adding additional funds to support a plan for expansion, infrastructure, and data collection needs for youth service bureaus to be developed in partnership with DCF. Our partnership with DCF has been strong, and some of these efforts are already underway. I look forward to sharing the results of these efforts with you in the future, although more importantly, I look forward to the positive impact these efforts and continued YSB and JRB funding will have on the young people and families we work with, especially at a time when it is more important than ever that we all feel connected to our local community. Thank you for your time today.
Thank you, Kristen. Thank you for all your work. Have a great day. Up next, number 27, Yvette Young. Hi, Yvette.
Hello. Good afternoon, distinguished chairs and members of the Appropriations Committee. My name is Yvette Young, and I work for the Village for Families and Children as an Associate Vice President and previously as the Human Anti-Trafficking Response Team Coordinator. Representative Walker, I heard your question earlier about human trafficking. If you have any additional questions, please feel free to reach out to me. I am here to advocate for increase in funding to nonprofits by $461 million over the next 5 years to ensure the well-being of those most vulnerable in our communities. In the governor's budget, there are funds being allocated to DCF to support crisis and emergency services, which are needed services in our continuum of care. But at a time when we are facing a children's mental health crisis, it is concerning that $8 million is being cut from DCF's general fund. What the current budget failed to do is recognize the needs of our community beyond the crisis. Children and families will need to be connected to community-based services, outpatient and intermediate level of care provided by their local nonprofits. Our children are dying from suicides and overdoses. They are depressed, anxious, and disconnected. They're being parented by individuals who are depressed and anxious. They need immediate support, and they should not have to wait for their symptoms to elevate to a crisis level before they gain access to the support they need. The DCF budget is also being cut by over $15 million for caseload-driven expenditures for out-of-home care such as adoption, subsidized guardianship, foster care, residential services, and individualized payments. This cut will impact the BIPOC community and deepen the disparity within our system. People of color are disproportionately represented in every part of the child welfare system. Cutting resources from DCF, an underfunded nonprofit organization who provide intermediate and outpatient level of care, will have a tremendous impact on the BIPOC community, which will continue to widen the equity gap. Insufficient funding to support these communities turns this funding discussion into a racial justice conversation. Dismantling systemic racism requires the utilization of a racial justice lens when budgets are being developed and decisions are being made how to allocate funding. It is imperative that funding is allocated to community-based organizations working to eradicate systemic racism by providing access to needed resources for the BIPOC community. We must not underestimate the impact of community-based programs in prevention and healing. Without adequate funding, we will not be able to meet the mental health needs of our communities, especially the BIPOC community. We will not be able to reduce our wait lists. We will not be able to prevent children from getting stuck in higher levels of care due to community-based programs not having the staffing to provide them with the care they need. We will not be able to prevent the burnout we are experiencing our essential workers because of the turnover in staffing and the limited resources available to fill those positions. We will not be able to
summarize, please.
Yep. We will not be able to provide quality care for our children, adults, and families, and the current mental health crisis we're experiencing will intensify. I appeal to you to think of those among us who are most vulnerable, and when you vote, please vote to increase funding, which will support them at all levels of care in our continuum.
Thank you very much. Thank you for your testimony. Have a great day.
Madam Chair, before
Madam.
we continue, I just would like to alert people who are in the attendees waiting room that if you do not accept our invitation to promote you to a panelist, you will not be able to speak. In order to be able to speak, you have to accept the promotion to panelist. If you reject that, then we cannot move you over into the panelist section when it's your turn to speak. So I hope folks are listening, those who are in the attendees section. And when you receive a message from Zoom to please accept, please do so if you want to speak. Thank you, Madam Chair.
Thank you, Madam Administrator. Up next is number 28, Lynn Zimmer. Lynn? Okay, we'll come back if she gets on. Number 29, Chin. Chin, are you here?
I'm here. This is Lynn Zimmer.
Oh, okay. Hi, Lynn. Welcome.
Hi. I have aphasia, so please bear with me. My name is Lynn Zimmer, and I'm a consumer employer living in New Haven. I'm here to ask you to do the right thing by PCAs and consumers like me. Connecticut can do better. I'm from Washington State, but moved to Connecticut after having a stroke and being diagnosed with heart failure in 2017. I was a psychotherapist before I had my stroke. I have two grown children who are unable. They have their own lives and are unable to care for me. They're in Philadelphia. So I need to have a home care provider. It was much harder for me to get a home care. Sorry. It was much harder to get home care services here than in my home state of Washington. But with my kids' help, I finally qualified for the waiver program. The best thing about my home Care Waiver Program is my PCA, Anthony. He can see my needs before I ask, and he reminds me of my children. However, the worst thing about this program are the poverty wages the PCAs earn, and the fact that the PCAs have no benefits. PCAs like Anthony make wages that keep them in poverty. They can barely afford to pay for food, utilities, and rent, let alone save for their futures. To make things worse, PCAs don't get time off. They must constantly choose to earn money to take time off when they're sick. If they had sick time, if Anthony or PCAs get sick, they come here to me, I get sick, and I have to go to hospital because I'm that compromised. They can lose more wages when I'm sick and hospitalized. It's a vicious cycle. In Washington, things are different. It was easier to get services. My caseworker did a lot more to support me there. My PCAs have health insurance and paid time off. Connecticut needs to do better by PCAs and consumers. All
Lynn?
working, yes, and
Lynn,
almost
thank-
done. All working people should earn a living wage, health insurance, and pay sick time, retirement benefits. They work selflessly to take care of consumers like me. Thank you.
Thank you, Lynn. Thank you for taking the time to testify. Up next, number 29, Chin.
Okay. Good evening, members of the committee. My name is Chen Will. I am a PCA from Brantford. I have been in this field for 14 years. I have been paid for 2 years as a PCA. I love my job because I love my daughter, who is my consumer. She is very friendly, adorable, great kid. I enjoy taking care of her. I shower her, feed her, help her walk and get her out of bed. I help her go to the bathroom, change her diapers, address her, give her medication, talk to her daughter, her doctor for her. She needs 24-hour supervision. Without these services, she would not have any independence. She would push herself. We taught her how to walk and go up and down the stairs, but she needs someone with her all the time and does not talk. Being a PCA means I get low wages and zero benefits. DSS and Allied frustrate me because they don't care about us. I don't have health insurance and I don't have paid sick days. I hear a lot from other PCAs, the same worries. I still can't pay my medical bills. I have no health care. I am on Medicare spend down, or I don't qualify for Husky. These are things nobody should have to worry about. For example, I have a dental bill that I can't pay. they are threatening to sue me because for example, I have a dental bill that I can't pay. They are trying to sue me because I can't pay, but I don't know what to do. They keep asking me to pay the dental bill, but I don't have the money for it. I feel very bad and angry that we don't get help. Also, another medical bill for medication cost me $213. I have to borrow money from my father sometimes when I can't pay the bills. My wife doesn't have money. I can't afford to pay car insurance without borrowing money sometimes. I have to have insurance or I will get arrested if I drive. I worry about my daughter who has asthma and gets sick very easily. I am worried that if I get sick and can't get medical help, what will happen to her?
Chen?
Yes.
Chen, can you summarize, please, sir?
Sure. Okay, with health insurance, I will have less stress and the medical bills will get paid. I will have more money to live on and can take care of my daughter without stress. Please help PCAs like me. Thank you for your time.
Thank you, sir. Thank you for taking the time to testify. We do appreciate it.
Okay.
Up next, number 30, Jordan Fairchild.
Thank you, Representative Abercrombie. And good afternoon, Senator Austin, Representative Walker, and distinguished members of the Appropriations Committee. My name is Jordan Fairchild. I'm a resident of New Fairfield, Connecticut, and I'm the coordinator and community organizer for Keep the Promise Coalition, a grassroots statewide coalition of advocates with lived experience of mental health, addiction, and co-occurring conditions. I'm glad to see an expansion in the DCF budget for mobile crisis intervention services for children to make them operate 24/7. Crises don't occur on a set schedule, and having teams available 24/7 will help ensure a more humane and appropriate response to crisis. I'm also encouraged by the 25% increase in the DSS budget to adult dental provider reimbursement rates for Husky. However, I believe that bringing the adult reimbursement rates to parity with the children's rates would also improve participation to a much greater degree. I'm also glad that the legislature has rightly chosen to acknowledge the current mental health crisis. However, I'm concerned that this committee's actions and priorities regarding the crisis could be affected by two proposals coming out of the Office of Health Strategy, partially codified by two of the governor's bills, which would cap total healthcare spending and increase primary care spending, likely forcing cuts in the final budget to other areas of healthcare, including behavioral health, dental, at-home care, and specialist care, areas which I believe require much needed rate increases. The legislature could also improve healthcare coverage and access for many Connecticut residents by expanding Husky to all immigrants in our community and expanding Husky C eligibility to far more disabled residents. Funding increases to accommodate raising the income and asset limits for Husky C, which currently fall below the federal poverty level, would remove a significant barrier to many in need of the coverage which Husky C offers. These limits force otherwise eligible people to either lose their coverage or spend down to qualify for the program, trapping many in poverty. California recently raised the income limits for their equivalent Medicaid program to 138% of the federal poverty level, and it's possible for us to do so here in Connecticut as well. Likewise, the governor's budget doesn't accommodate the removal of the income and asset limits for MedConnect, which also make it difficult for some to enroll in the program and discourage many from even applying. Individuals on Husky C and MedConnect often have complex medical conditions, which require regular and frequent care. Expanding Husky eligibility would be wise from a public health perspective, as it would help prevent devastating health outcomes and avoid significant costs of worsening untreated medical complications resulting from this lack of care. Thank you for hearing my testimony and working to increase access to healthcare in our state.
Thank you, Jordan. Thank you very much for your testimony. We appreciate it. Up next is number 31, Nicole Bongiovanni. Hi, Nicole.
Hi, good afternoon, Senator Austin and Representative Walker and member of the Appropriation Committee. My name is Nicole Bonjovan and I live in Madison. I come before you today to ask you to better fund home care so we can be paid living wage and receive quality benefits. In 2004, a friend of mine became sick with cancer and she needed a caregiver. I quit my job to take care of her, and even after she passed away, I've been a PCA ever since. If you told me 20 years ago I'd be calling in PCA work, don't believe you. But that's totally how I feel, that I am called for this work. It's a hard job, believe me. I have 3 customers and I work 73 hours a week. 2 of my customers are total care. They do not move at all. The third is nonverbal. I have to battle them, feed them, dress them, and toilet them. It takes a lot of energy and takes a toll on me. For my nonverbal customer, I must find other way to communicate with her. But they are like family to me. The job is very intimate. My customers are vulnerable but don't want to lose their integrity, so I must care for them with love, respect, and mutual trust. They deserve to have their personhood respected, and it is my calling to help them to do that. Since I became a PCA in 2004, I have rarely been sick, and I have never had health insurance. I make too much to qualify for healthcare, but I can afford to purchase it and exchange it. Last time I priced it out is $700 a month, which is almost as much as my rent. We also don't have any paid time off, or all this means can afford to get sick. A year and a half ago, I was at work when I began to have a hard time breathing. I thought maybe I have contracted COVID. I was taken to the hospital in an ambulance where I was diagnosed with a minor heart attack. I stayed in the hospital for 3 days and I lost 5 days of pay. I should have taken off longer, but I couldn't afford it. So I went back to work almost immediately. Today, I still have $23,000 bill that I can pay. That is half of my annual salary. Last year, I went to work and one of my customers was not feeling well. She later tested positive with COVID. So next day, I want to get tested and discover I have COVID too. I was out of work for 14 days. And the entire time I was mortified that my condition will worsen and I'd be stuck with even more medical debt. Please hear our story. I am not the only one facing this struggle. We need affordable health care. We need basic day and we need retirement. I am 66 years old. I have been in the workforce for over 16 years, but I don't know how we'll be able to retire. This is not fair, and this is not right.
Oh, can you summarize, please? Your 3 minutes is up.
Okay. We care for the most vulnerable, and what we're asking for is to be able to care for ourselves too. Thank you for your time.
Thank you very much, and have a great day.
You too, thank you.
Up next, number 32, Jane Adamic. Hi, Jane.
Hi. Good afternoon, Senator Austin, Representative Walker. Can you hear me?
What I did.
Sorry. Nicole, can you put yourself on mute, please?
Yeah. Okay, let me do that. I have to close it.
Go ahead, Jane. Sorry.
Okay. Good afternoon, Senator Austin, Representative Walker, Senator Kushner, Representative Abercrombie, and members of the committee. The Umbrella Center for Domestic Violence Services, along with CCADV, is requesting $1,440,000 in annual state funding to cover the cost of 18 full-time child and family advocates at each state's 18 domestic violence service organizations. That's 1 full-time employee per site. Currently, I serve as the child and family advocate for Umbrella Center for Domestic Violence Services, which serves 2 of the 18 catchment areas. So I work at the domestic violence shelters and in the communities for both areas, essentially serving each half-time. As a child and family advocate, I assist families who leave abusive homes and come to reside or domestic violence shelters, and I offer support to families in the community programs. I meet these families when they are most vulnerable and in crisis. Parents and children often tell me they do not get enough time with me. If each program is given enough funding to have a full-time and child family advocate, then each family will have the opportunity to move from crisis support to actual supportive programming, which can have more of an impact. For example, having planned age-appropriate children's groups and activities, actual planned support groups for parents to learn how to safety plan, monitor their children, follow up with services, and speak to their children and the adults in their lives in a meaningful way. This is what will bring change to the families, not quick fixes or putting Band-Aids on the problems. The children and parents are oriented to the safe house by being shown safe aspects of shelter living, such as confidentiality of the shelter location, cameras to monitor the safety of the building, staff presence, and the availability of child-friendly spaces. They are shown that they have immediate access to food and clothing. I meet the children and have supportive conversations about what happens in shelter and what some kids might feel and think, and what it means to feel responsible for what happens in their family. We learn safe ways to express feelings and do fun supportive activities together so the children do not feel so isolated and stressed. For example, we make power bead bracelets so they know what their power word is and to use it to build their confidence and become more resilient. They might draw pictures of what happened in their families or write stories or poems for their parent. We make maybe safety shields together using positive and assertive traits that they have learned about themselves through our conversation and supportive activities. I have safety conversations with parents regarding safety of their children at shelter. We talk about safety, school enrollment, and technology that they bring into the shelter. We work together to make those devices safer for their family. We talk about whether the family's medical records are at risk and work together to change those usernames and passwords. I have conversations with children about how and when and why to call 911. We identify people and places that are safe to talk to about what's going on at home. I assist parents with finding answers to their questions. We work together, obtaining vital documents needed for intakes for medical and mental health services for children. We gather information needed for daycare and school enrollment, like children's updated physical forms and updated protective orders. I go to schools and collect homework that was missed by children who were out of school during transitioning to the domestic violence shelter, and go with families.
I'm going to ask you to summarize, please.
Okay.
Your 3 minutes is up.
If what I described sounds like too much for one part-time child and family advocate to accomplish, that's because it is. The full-time needs of our parents and children are too great to meet with part-time support and care. Children are the most vulnerable victims of domestic violence and deserve to have a full-time child and family advocate that's been trained to work with their specific developmental needs and support them during their time in our program. Thank you.
Thank you. Have a great day.
You too. Thank you.
Number 33, Wynn. Hi, Wynn.
Hello, Representative Abercrombie and other esteemed committee members. My name is Wynn Everts, and I live with my wife and 31-year-old son in Norwalk, Connecticut. Our son, Nick, has an intellectual disability and an intractable seizure condition. I'm also the executive director of the ARC Connecticut. Despite last year's historic investment in the safety net is still under a lot of stress as a result of long-term underfunding and the pandemic. It needs additional investment to stabilize the workforce and address wage compression. Connecticut's health and human services providers have tried to support individuals needing services throughout the pandemic, but they can't continue to be responsive to present needs, never mind future needs, without well-trained and experienced staff, of which they are now critically short. The same is true for families and individuals that self-direct their services in programs like Community First Choice. It's very, very hard to hire and or keep support staff with skills and experience in many parts of the state at $16 and change an hour, when large retailers and distribution companies will pay $20 an hour or higher for people with minimal skills. The pandemic also brought increased isolation to individuals living in group homes and family homes, as the fear of contagion resulted in significantly lower social contact. For our family, our son's expressive language and meaningful community involvement has diminished due to declines in community programming due to being short-staffed. Without the ability for his provider or ourselves to hire staff, Nick's path to working, contributing to, and being embraced by his community will be delayed. Finally, addressing wage compression is really important. Without doing so, experienced and supervising staff will continue to feel devalued, and turnover in human services will remain really high. Please support additional funding for Connecticut Safety Net in line with the $461 million plan. Thank you for the opportunity to participate in our democracy, and I hope your evening is not too long.
Thank you, Lynn. Just be happy you were at the beginning of the list. Have a great day.
Thank you.
Up next, Alex Fago. Alex? Good afternoon.
Good afternoon, Representative Abercrombie and members of the committee. By background, I'm the CEO of Dr. Dental, and we manage a group of dental offices, own and manage a group of dental offices here in Connecticut. I want to thank the committee for a 25% increase in adult dental rates, or the recommendation in doing so, and I'd like to advocate to bring the adult dental rates to parity with the children's rates. The challenges that we face in Connecticut are challenges of significantly increasing costs. Many have left the healthcare sector, and in the dental field, COVID has proved to make dental less desirable as a place to work than pre-COVID. And many hygienists, many support staff have left for those reasons. That's caused significant challenges in hiring, and subsequently has driven up wages really dramatically, upwards of 40 to 50% for some of our support staff. We also have difficulty in recruiting dentists to work in our offices who do not want to accept the lower fee schedules. PPE costs, personal protective equipment, have significantly increased in price during COVID, and have remained much higher than in the past. And these increases in cost, both on PPE and in labor, have really driven a challenge with the current reimbursement rates. We thank you for the increases, and we'd like to ask respectfully to bring those increases up to the current children's levels, which are also lower than alternatives, as we all know, and for PPOs and other private insurances, where dentists and other support staff have the option of working when they make their choices of where they want to work. It's imperative to deliver quality care and access to all patients. And with costs up and no end in sight, we'd like to respectfully request and encourage the committee to increase reimbursement rates. Thank you.
Thank you, Alex. Thank you for what you do. We appreciate it. Up next, number 36, Aaron Mahoney. And after Aaron, I'm turning it over to my Madam Chair, Representative Walker. Aaron, are you here? I don't see Aaron, so we'll come back if she enters. Next up is number 37, Diane Manning. Diane? Not seeing Diane, so we'll move on to number 38, Angela Perry. Angela? Hi, Angela. And then I'll turn it over to Rep. Walker.
Good afternoon, Madam Chair and members of the committee. I am Diane Manning, President and CEO of United Services. United Services is the community behavioral health center for 21 towns in northeastern Connecticut. We are a nonprofit organization providing more than 30 programs in our community, including outpatient mental health, substance abuse treatment, family programs, and crisis services. Thank you for the opportunity to provide testimony on the state budget. I want to thank you for the 4% cost of living adjustment for community nonprofits that you fought to include in last year's budget. But I'm here to tell you that the funding proposed in this budget is not sufficient to meet the need we see in our communities. There is new funding proposed for new high-end services that will take months, if not years, to roll out. Meanwhile, our child guidance clinic, which is an enhanced care clinic, is facing an increase of more than 130% over prior years, and the calls for treatment increase every day. Our staffing levels are decimated because we cannot pay enough to entice staff to work with large, complicated caseloads. We are no longer able to see children and families within 2 weeks of when they request care because we just cannot hire or keep staff. While I appreciate the proposed investment in these new levels of care, please remember that they are needed because we have not invested over the years in the outpatient and home-based services that could keep children and families out of emergency departments and inpatient beds. I implore you to fund the $461 million that is necessary to bring the service system back to the level it was more than 10 years ago, before we recognize the crisis in our families of the last few years. For this budget year, we need at least an 8% increase in the value of our state contracts to begin to respond to community need. Demand for United Services programs has never been higher. Our staff have now been working for 2 years with a community in crisis. The impacts of the pandemic on mental health cannot be overstated. I urge the Appropriations Committee to fight for funding for these programs by implementing the 8% funding increase. Please help us to help the children and families who need services now. Thank you.
Thank you. Thank you, Diane. Thank you for your testimony. And thank you, Representative Abercrombie, for filling in for the last hour. And I'm sure you're going to be around for a few more hours. With that, I'll go right next to Angela Perry. Angela, go right ahead, ma'am. You're for some reason you're muted. For volume. Try it again. No, your audio is not connecting. Okay, now try. No.
How about now?
Yep, there you go. Okay.
Perfect. My apologies. So again, good afternoon, Representative Walker, sorry, Senator, and to the members of the Appropriations Committee. My name is Angela Perry. I'm presently the administrator at Parkfield Care Center in Hartford. I am proud to be a representative of a community nursing home.
And Angela, is somebody else in the room with you and they have their, because you're reverbing and we can't really hear what you're saying. Try it again. Go ahead.
Oh, my apologies, everyone.
Try it one more time.
One more time. How about now?
Yes.
Perfect. My apologies. Just to start over, my name is Angela Perry. I'm the administrator at Parkfield Care Center in Hartford. I am proud to be a representative of a community nursing home that has served the Parkfield neighborhood for 53 years. We are licensed for 150 beds with a current workforce of 130 staff, and we are members of the Connecticut Association of Healthcare Facilities. We are now approaching 2 years into an unprecedented period of history battling the COVID-19 pandemic and public health emergency. I can personally attest that our residents we serve within our community and our employees continue to be challenged like no other time in our history of providing clinical and medical services in Connecticut. I can also say that our nursing home is hopeful and determined to move forward and beyond this pandemic with a stronger sense of resilience embedded into our everyday culture. Our resident staff have endured nearly every aspect of the pandemic when we were initially mandated to close our doors to visitors in March 2020, which led to an overwhelming sense of uncertainty and eventually resulting in pandemic fatigue. Most recently, our experience battling another wave due to the most recent Omicron outbreak at Parkfield forced us to reimagine our environment, battling another wave due to the pandemic. For nearly a year, we saw firsthand the consequences of lack of COVID-19 testing capacity, the egregious shortages of PPE, and the relentless changes of regulatory guidance and policies that eventually evolved as we learned more about the virus and its spread. We experienced the severe emotional traumatic visitor restrictions imposed early in the pandemic that separated residents from their families and friends. And we have experienced the optimism of what the COVID-19 vaccine and most recently the booster means to our community. While the trauma of our residents caretakers faced were unpredictable, I can say that the resilience and determination continues to be extraordinary. The severe staffing shortages of our nursing home has been inflicted, which continues to be the most challenging in my tenure as an administrator in an already compromised industry compared to pre-pandemic times. For example, there has been studies identified in national articles that reported certified nursing assistants and licensed nursing staff turnover rates well over 90%, despite our ongoing efforts to retain staff and enhance our retention programs, not to mention the price gouging from staffing agencies that place an additional financial burden to an already starved environment. At times, the staffing challenges consequently impacted admissions from hospitals and our ability to provide continuity of care to those who seek our services who reside within the Parkville community. Furthermore, the staffing challenges has resulted in a 26-bed unit to be unoccupied throughout the pandemic, which again has impacted our ability to serve the community that we have so much pride in caring for. Parkville Care Center has been very negatively impacted by the staffing shortages in various ways, resulting in contracting with nursing staffing agencies who are unfamiliar with the specific person-centered care needs of our residents. Using staffing agencies has a direct negative correlation that has altered our consistent staff assignments and comfortability for our residents who are familiar with holistic practices. The financial consequences have also been tremendous and have also lent a hand to further compromising the available resources to better care for our residents. Although I am pleased to learn that Connecticut, yes, ma'am. Although I'm pleased to learn that Connecticut Attorney General is reviewing these price practices of staffing agency, I'm hopeful Connecticut will pass legislation to those caps. To close, I must share my gratitude to the state legislature for the tremendous support we have received that has provided additional support for employees and stability during this period. Parkville Care Center implemented the 4.5% employee wage enhancement that was made available last session and appreciated by our caretakers.
Thank you.
Again, thank you for allowing me this opportunity, and I'm always willing to speak on behalf of our nursing home industry in Connecticut. Thank you.
Thank you. Thank you. Thank you for your testimony. Next, we will hear from Yvonne Foster.
Yes.
Good afternoon. Go right ahead, ma'am.
Good afternoon, Senator Osteen, Representative Walker, and members of the committee. My name is Yvonne Foster. I'm a CNA at Windsor Health and Rehab. Working with the elderly is a field that was very easy for me to adapt to, as in my country, this is our way of giving back to our elders. I have to work 70 to 80 hours a week, not because I want to, but because I have to. I've been at Windsor Health and Rehab for 20 years and only making $17 an hour. I have coworkers who have been there for 40 years and do not make $20 an hour. They'll soon be retiring with their last paycheck. There's no room for growth and advancement. The wages at Windsor Health and Rehab are lower than most nursing homes, which makes staffing more challenging. This worries me. I am tired of seeing my coworkers leave to go work to other facilities or leave the industry altogether to go work in other fields. The benefit and wages of the nursing home should be equal across the board. The benefit and wages of our nursing home should be equal across the board. This would help create consistency for residents. During the first wave of the pandemic, I remember being separated from my families. It was extremely difficult for me to be separated from my 13-year-old daughter. I was tough at work for 16 hours a day, 7 days a week with multiple jobs from different departments. I would have to be the caregiver as well as the housekeeper. Despite the chronic staffing issues at Windsor Health and Rehab, with many days leaving, 1 aide to care for 30 residents, 1 aide cared for 60 residents at night, the facility is still allowed to accept admission with very low staff to care for the patient. The state should not make this so easy for operators to open nursing homes and treat their employees this way by paying us low wages for such difficult job. We serve with our heart, but we felt like we disappoint our own families. Low wages force Black and brown families to live in rundown communities where our children are exposed to drugs and violence. We are willing to work hard, but the system set us up for failure. With such low wages and high inflation in the state, I had to cancel my medical insurance this year in order to put food on my table. No employee who works 40 hours a week in this industry should not be able to pay for health insurance and not to able to pay their bills. We cannot take care of our own families. We are forced with struggling to keep our own children in college. We want to give them a better education than we had, but we cannot afford it. Many children of Black and Brown communities, families are dropping out of college because parents like me cannot afford to pay for college. Instead, we have to work 2 jobs or put in overtime up to 8 hours a week, which leaves very little time to spend or care for our families. Something is seriously wrong with this picture. We care about the resident that we take care of. We know how hard we work. Please stop telling us that you care about these residents and staff. Show us that you care. Help us to care for our own families. Please allocate funding to nursing homes so we can attract and retain the staff we need to help allocate our staff in crisis. Thank you for your time.
Thank you, ma'am. Thank you for your testimony. Thank you. I see Jane Adamek. Jane? Jane? Once you've testified, please close your portal because it takes up space for other people that are trying to come on. So if like Angela Perry, you can withdraw from the portal. I'm not sure. Is Jane, and she's already done? Okay. Number 39, Yvonne Foster. Oh, I'm sorry, she just said. Erin Harkreader.
Hi, good afternoon, Senator Austin, Representative Walker, and members of the Appropriations Committee. My name is Erin Harkreader, and I speak in my capacity as the Director of Senior Meals on Wheels for LifeBridge Community Services in New Haven. I'm also the Vice President of the Connecticut Association of Nutrition and Aging Service Providers, or CANASP. I want to offer my testimony regarding DSS and Department of Aging and Disability Services appropriations, and to urge adoption of rate increases for meals delivered as part of DSS waiver programs, such as the Connecticut Home Care Program for elders. In a time where elderly nutrition providers, ENPs, have continued to provide service throughout a pandemic and pivoted services to serve as many seniors as possible, it is only appropriate that reimbursement rates would increase to reflect increased costs, as well as the yearly minimum wage increases that will continue to go into effect through 2023. When COVID-19 became a part of our reality 2 years ago, the 9 ENPs of CANASP did not miss a beat. Programs delivered shelf-stable emergency meals to clients in case of a shutdown, and several providers shifted their service to serve more seniors. With few exceptions, not a single day of service was missed. When senior centers had to close their doors, our program worked with senior center leadership and staff to modify the lunch program to continue providing meals to their seniors. The pandemic has provided other challenges for ENPs as well. Food and supply availability issues have meant that modifications had to be made to menus. Costs continue to increase. Personal protective equipment had to be purchased for staff and drivers. In August of 2021, minimum wage increased, a well-deserved increase for staff, but one that impacts every program's ability to meet their bottom line obligations. In addition, with greater demand for service, programs have had to institute wait lists due to funding and capacity issues. ENPs are committed to providing meals to seniors who are in need. However, every meal that is delivered has attendant costs associated. Food, supplies, trucks, drivers, gas, and time all go into the figures for every meal delivered. More than one ENP has found it necessary to discontinue their contract with CHCPE due to losses as a result of the low reimbursement rate, and other programs have considered doing the same. For programs with a wait list due to capacity issues, eliminating service to CHCPE clients would clear up that space for homebound Title III clients who have no other resources available to them. This is certainly not a road that any of our programs want to go down. However, absent reimbursement rates that reflect cost of living increases for the programs, it may be the future. Time and again, ENPs are told how important the work they are doing is. Unfortunately, though we may believe deeply in the work we do and the importance to our senior population, the reality is that those services have an associated cost, and that cost continues to increase. Without budgetary support in the form of an increased reimbursement rate for waiver programs, we risk providers being unable to continue that important work. Senior nutrition programs provide a wellness check, combat social isolation, provide nutritionally balanced meals that help avert malnutrition, allow seniors to stay in their homes, and prevent expensive hospital and nursing home stays. The benefits are clear and quantifiable. Please help our programs continue to do the important work that we have always done and will continue to do. Thank you for your time and support.
Thank you, and thank you for your testimony. Have a good day. The next is Richard Rodriguez.
Good afternoon, Representative Walker and distinguished members of the Appropriations Committee. My name is Dr. Richard Rodriguez, and I'm a current resident in New Haven, Connecticut. I'm here today in my role as a concerned community member, a graduate student of public health, and a dentist to testify in support of House Bill 5037, specifically the proposed reimbursement rate increase for adult dental services. While we are thankful and appreciative of the increased reimbursement rates for adults seeking dental treatment, we are, especially the dental endodontic rates, we are concerned that 25% increase is too little to increase provider participation in Medicaid. In order to increase provider participation in Medicaid, adult dental reimbursement rates need to be increased to parity with child rates. With my experience as a dentist, I have firsthand seen the consequences for those unable to access dental services within a timely manner. And I want to emphasize how important time is in relation to oral disease. Many patients believe that if they're experiencing no pain in their teeth, there must be no disease, when in reality, oral disease, and specifically cavities, can become quite severe without any symptoms. And once they begin to feel pain, it is often too late or too expensive to save the tooth. After extracting countless teeth and difficult, sometimes heartbreaking conversations with patients and their families, I want to advocate for the adults of Connecticut on Husky. What motivates me to speak here today are the stories of patients struggling to eat their favorite foods after the loss of their teeth or their everyday struggles to feel comfortable smiling again. Through increased reimbursement rates for providers, there's an opportunity to expand the network and provide residents with comprehensive dental coverage. Not only should we increase the rate for residents on Husky, but for the providers in the state of Connecticut who truly want to provide care for adults in their community, but are currently unable to due to rising costs of operating a dental practice and low reimbursement rates for comprehensive dental services. In my graduate studies, I have come to learn the vital role that Medicaid plays in providing healthcare to those in most need. We must continue to invest in our systems of care so that our most vulnerable community members do not fall through the cracks and are able to fully participate in our democracy and society at large. Our country has neglected to provide necessary oral health coverage for our communities, and the state of Connecticut has a chance to show the rest of the country how important oral health is in relation to systemic health. We must collectively move past the idea that oral health care is a luxury not only allowed to the select few, and our state budget must reflect that for both children and the adults of our community. I urge you to increase adult Medicaid reimbursement rates to bring them to parity with child Medicaid rates. We look forward to continuing the conversation about how we can best provide comprehensive dental care to Connecticut's low-income residents. Thank you.
Thank you, Richard. Thank you for your testimony. Glad you're from New Haven. Thank you. Next, we have Kurt Engel. Kurt?
Thank you.
Go right ahead, sir.
Thank you very much. Good afternoon, Representative Walker, Senator Austin, and members of the Appropriations Committee. Thank you for allowing me the opportunity to speak in support of increasing adult Medicaid reimbursement rates. My name is Dr. Kirk Engel, and I'm president of the Connecticut Society of Oral and Maxillofacial Surgery. I represent the 120 actively practicing oral and maxillofacial surgeons in Connecticut, and we wholeheartedly support the governor's proposed reimbursement rate increase. I personally retired from solo practice in East Lyme, Connecticut, where I practiced oral and maxillofacial surgery for over 15 years. Prior to that, I was an oral surgeon in the US Navy for 21 years. While in private practice, approximately 15% of my patients were children in the Husky Medicaid network. As you may know, those citizens who are in Husky are eligible to receive Medicaid or are the patients who are at the highest risk for dental decay, abscessed teeth, and trauma. When these patients can't obtain care in an outpatient dental office setting, they show up in a hospital emergency rooms, occupying valuable resources and driving up the cost of medical care for all Connecticut tax-paying residents. It is far more cost-effective and healthier to treat minor dental issues before they become major emergencies. Unfortunately, the overhead costs associated with private practice, combined with low reimbursement rates, are prohibitive to treating large numbers of adult patients who are presently in the Husky network. The history of pediatric dental Medicaid reimbursement rates in Connecticut provides a hint at what might happen if adult Medicaid reimbursement rates are substantially increased. Prior to a 2008 legal settlement, only 125 dentists in the entire state were providing care to those enrolled in the Husky program. Today, fortunately, we have more than 2,300 dentists, which are almost all the dentists in the whole state, who are active participants in the program. Most do not see adults, however, due to the extremely low reimbursement rates, which are approximately 1/2 that of the pediatric rates. Rates for adults and children have not been increased since 2008, and sadly, pediatric rates were reduced 5% a few years ago. I strongly suspect that the number of Husky providers has also decreased due to increasing inflation, increasing overhead costs, increasing usage of PPE, and stagnating dental reimbursement rates. In summary, dentist participation in the state Medicaid program is an important aspect of the dental care safety net. I hope that you will endorse the proposed increases in adult dental Medicaid rates and increase the rates so they are on par with the pediatric dental fee reimbursement rate for the sake of those Connecticut citizens who are at the greatest risk for dental disease. Thank you for your time and thoughtful consideration of this very important issue. Have a good day.
Thank you, and thank you for your testimony. Have a good day.
You too, Ms.
Next, Mary Britton. Mary, number 43. Okay, next after that, Nicole Hernandez, number 44. Nicole Hernandez. Okay. Next, Sharon Thorntonson, number 45. Sharon? No. Okay, number 46. Aurelia Reynolds? No. Okay. Number 47. Ellen Healy. I saw you up there. You hit jackpot. Eileen, I'm sorry. Yeah.
Good afternoon, honorable committee members. My name is Eileen Healy. I live in Woodbury. I'm the executive director of Independence Northwest, one of Connecticut's 5 independent living centers that serves Northwest Connecticut. Thank you for your past support, and I ask you to increase the line item for centers by $1 million annually. In 2004, the governor appointed state independent living councils set a base level of funding for each center at $550,000 per year. In the past 17 years, the state has never achieved this level of funding. In fact, state funding for centers has been reduced. Thanks to the legislature, we did receive an increase, but we are still almost $67,000 less than 2015's funding. In comparison, New York centers are each state funded at $335,000, and in Massachusetts at $715,000. Connecticut's IL centers, a paltry $92,000 per center. In the last 35 years of center operations, the cost of living increased by 200%, resulting in reductions on top of deficits, which forced the independent living centers to cut back on the towns and cities we serve, created waiting lists, laid off staff, and reduced salaries. Here's what's unique about independent living centers. We are non-residential despite our name, and we serve people with all disabilities and of all ages. Our only eligibility criteria is having a disability. It doesn't matter if someone wants help with housing, employment, transportation, healthcare, or any other barrier they're facing. We employ qualified people with disabilities who share our life experiences and our path to independence, offering practical guidance because we have lived it. Increasing state IL dollars ensures that our services remain free, reducing another barrier to achieving independent living. The IL centers are the only place where people with disabilities can go when they can't afford or are ineligible for other programs or their needs aren't addressed holistically. We support the governor's proposed funding for increasing vocational services, technical education, mental health, and domestic violence services. All are opportunities to improve independent living and include people with disabilities. And with increased funding for the IL centers, we can be valuable resources and partners, in those initiatives. Connecticut's fiscal health is the strongest it's been in a generation. I urge you to increase funding by $1 million for the 5 centers to allow us to hire additional staff to meet the current demand, making vital IL services in every town and city available again. Thank you for your time and attention, and I welcome any questions.
Thank you, Eileen. Thank you for your testimony. And thank you for sharing with us what's going on with your organization. Have a good day.
You too.
Jennifer Nadeau.
Good afternoon, members of the Appropriations Committee. My name is Jennifer Nadeau, and I'm a licensed clinical social worker for Community Health Resources. CHR is the most comprehensive nonprofit behavioral healthcare provider in Connecticut, offering a wide range of personalized services for children, families, and adults whose lives have been touched by mental illness, addiction, and/or trauma. Thank you for the opportunity to provide testimony on the state budget. CHR receives funding from DCF to support families. I want to thank you for the 4% cost of living adjustment for community nonprofits that you fought to include in last year's budget. I'm here today to ask for your support to honor the long-term plan to address underfunding of community nonprofits and increase funding in fiscal year 2023. As we're all aware, we're in the middle of a mental health crisis right now. As a result of the COVID-19 pandemic, children, adolescents, and their families are in need of services more than ever. The acuity of the symptoms we're seeing and the volume of referrals to our programs has never been this high. At the same time we're faced with this mental health crisis, employers like CHR are faced with a staffing crisis. The pandemic has made mental health professionals reevaluate what they want when it comes to their professional careers. In the past, we would have had many applicants for any position that we posted. Now, positions go posted for weeks or months without a single applicant. When we do have a qualified candidate and proceed with extending an offer, they're often declined. Candidates have told us that the salary and benefits that we offer as a nonprofit agency are just not enough to have them accept the position. We're also seeing clinical staff who've been at our agency for years leave to work in private practice settings where they can set their own schedules, see clients via telehealth from home offices, make more money, and see less acute clients. While some people may say any employee is replaceable, we know that in reality, it's not as easy as it sounds. When a trained employee leaves, not only does it take time and resources to hire and train a new employee, but you lose the relationships that employee has with the families they serve, partnerships that they have with other community providers, and their knowledge of resources available. Those relationships and knowledge take years to form. While it's time-consuming as an employer to hire and train new staff, the children and family we serve are the ones who lose out the most. Not only are we able to serve fewer families when we have staff turnover and vacancies, but new staff won't have the same knowledge of the service area and community that more experienced employees have. That means it might take longer to connect a family to a resource that could be valuable to them. Our employees are essential employees. For the past 2 years throughout the pandemic, they've shown up to work day after day to serve the most vulnerable population in the state of Connecticut. It's time that we invest in the workforce that we have by providing adequate funding to nonprofit agencies such as CHR so we can stabilize the workforce and therefore serve more youth and families when they're in need of services. Thank you for all that you do to stand up for us in the budget process. I appreciate the opportunity to speak to you about this important issue.
Thank you, Jennifer, and thank you for your testimony and for your service. Thank you. Have a good day. Dahlia, number 49.
Hi, good afternoon, Representative Walker and the members of the Appropriation Committee. My name is Dahlia Alberti, and I am the administrator for Manchester Manor, located in Manchester, Connecticut. Manchester Manor has been providing nursing home care in our community for almost 60 years, and we have about 170 employees working currently at our facility. For the past 2 years has been the most challenging times for staff in the industry has ever seen. Our staff has dealt with every feature of this pandemic from the very beginning. We experienced firsthand what it was like to be dealing with an unknown virus with little guidance, lack of PPE, testing supplies, and of course, the fear of the unknown. There was not much knowledge about COVID-19 other than what we were seeing. We had to keep up with the evolving CDC and DPH recommendations. With all this going on, our staff was mentally, physically, and emotionally exhausted. Many staff have decided to stay home at the time due to the fear of the unknown, while others have decided to leave the industry entirely. As you're already aware, staffing shortages are at their all-time high and is the most significant challenge our industry is dealing with today. We are left with no option but to turn to staffing agencies, which are negatively impacting patient care and also creates a bitter working environment and puts huge financial burden on our facility. Imagine paying 2 to 3 times more for an agency staff over your own staff. As a facility, we must limit the number of admissions we can accommodate due to staffing, which also has financially impacted us. Every day we say that it will get better and we try to stay positive, but it's been 3 years now and we still are dealing with the challenges from the pandemic. At this time, I would like to thank the state legislator for the support we have received. Our nursing home faithfully has been implementing the 4.5% employee wage enhancement and adopted last session. And moving forward, this will be critically important in helping with employee recruitment and retention. But right now, more help is needed to boost employee wages and benefits. In addition, a financial rate relief to address the increased labor costs that we are now seeing. I want to thank you for your time and consideration.
Thank you. Thank you, Dahlia, for your testimony. Thank you for coming and talking to us. I'm going to go back to Nicole Hernandez. I think I saw her. Nicole Hernandez. There you are. Go right ahead, Nicole. Hello.
Hi, my name is Nicole Hernandez. I am the administrator for Aviana Healthcare. We are a pediatric and adult home care agency that provides complex skilled nursing. I would like to address today the need for the Appropriations Committee to consider funding for the adult population for complex skilled nursing. In the ARPA funding and in the state budget, the pediatric population was awarded 1.7% in the state budget and 30% in the ARPA funding proposal for the pediatric complex skilled nursing. But unfortunately, the adult population was left out. And, that was, I think, inadvertently an oversight on not only agencies who were advocating for the patients, these particular patients, but in general, the DSS and DDS when giving the funding. When these children age to be an adult, which 18, the care doesn't change. They still have trachs, they still have vents, there's still 24/7 care. These parents are still exhausted. The nurses are still caring for the same patient regardless of their age. And, unfortunately, that does not translate into the wages that we can give them with the adult rate. So, my ask, along with the other 2 agencies that provide this very unique service, is that, you guys, take a look at giving some of the money to the adult population as well to, not so that way they don't lose their nurses, because they will go to other cases that can give them more money. We staff about 7,000 hours. We have approximately 160 patients and of that we have 30 adults that unfortunately are going to lose care because when they age out, according to the fee schedule. So I implore you guys to please really look at that. The other thing I wanted to address was when the ARPA funding runs out, then what happens? We're back down to the state budget, and we need to close that gap any way possible. These nurses work very, very hard. These are ICU settings, and these children's livelihood and these parents' livelihoods depend on their nursing services, and it helps keep these kids/adults out of the hospital. So that's something else that needs to be looked at when looking at the budget, is closing that gap from the 1.7% to when the ARPA funding runs out in a couple of years. So I want to thank you for your time, and I apologize for my tardiness. I'm driving, so I had to pull over, but thank you so much for hearing from us. Our agencies, there's only 3 of us. We're very unique, and I just don't want our population to be forgotten about.
Thank you for pulling over, and thank you for your testimony. Have a good day. Thank you. Next, we have Tina.
Yes, good afternoon. Good afternoon, Senator Austin, Representative Walker, and members of the Appropriations Subcommittee. Thank you for the opportunity to offer testimony on budget related to residential care home funding. My name is Tina Yitz. I'm the administrator at the Eliza Huntington Memorial Home in Norwich, as well as the president of the Connecticut Association of Residential Care Homes. I'm here today to raise concerns with the governor's budget related to residential care homes and express the strong need for a rate increase for residential care homes throughout the state and an increase in wages for our employees. Last year's biennium budget included a transfer of some residential care home spending to Medicaid. The shift was done to save the state money and provide us residential care homes with much needed resources. The plan is for residential care homes to become Medicaid billers starting April 1st, 2022. We are currently funded solely with state dollars through the aged, blind, and disabled line items within the budget. As the president of CARCH, I am particularly concerned with the fact that we have been actively participating in various meetings with DSS to try and attempt to form a plan of implementation, only to have no plan in place effective April 1st, 2022. Without a plan, residential care homes will not get increased funding as adopted in last year's budget. We have done everything that has been asked of us to help our membership with confidence in this new process, always with the promise, this is how you will get your funding. I cannot stress enough that our homes have been through a lot during the pandemic and continue to face challenges, and we are anticipating these funds. Under last year's budget, the proposal, which had been originally proposed by the governor and his administration and adopted by legislature, would provide for a $2.1 million savings in current fiscal year 22 and another $12.7 million in savings for fiscal year 23 for the state by initiating this billing, Medicaid billing. The state would then reinvest 25% of the savings into residential care homes, approximating $525,000 in this fiscal year 22 and $3.175 million in fiscal year 23 for a combined total of $3.7 million in increased funding for residential care homes. Despite our association meeting with the Department of Social Services several times to discuss this, there has been no operationalized plan for residential care homes to become Medicaid billers. These funds are critically important to our homes and employees who have been counting on the increased revenue to deal with the impact of the pandemic. We would urge the Appropriations Committee to ensure these dollars go to increasing residential care home rates. As more and more RCHs are either being closed or sold, it's going to be increasingly difficult to place these individuals into other RCHs, and they will inevitably be placed in other long-term care settings at a much, much higher cost than what you are seeing now. We provide a critical service for the state, and we care for some of the state's most vulnerable people, and we do this at a really low cost, some of us at $80 to $90 a day. My home and other residential care homes throughout the state have had to get by with rates failing to keep up with costs, and yet we serve as a safety net for so many people with mental health diagnosis and substance abuse issues.
Can you sum up, please?
Sure can. Unlike other providers, our residents are almost all state funded, limiting our ability to cost shift and make up for low rates. Please support residential care home funding so that we can keep our great employees, pay them their fair wages while we care for some of the most vulnerable in the state. Thank you for your time.
Thank you, and thank you for your testimony. Next, we have Nathania.
Yes.
Number 51.
Hello?
Yes, hello.
Hi.
Yeah.
Hi.
Go
All
right
right.
ahead.
Okay. Good evening, Senator Austin and Representative Walker and members of the committee. My name is Nathania Guerin, and I have worked as an LPN for the last 3 years at Western Rehab Care Center in Danbury, Connecticut. I love my job because it is important to me that I advocate for my patients and give them the sense of being loved and wanted. I love being able to restore their spirit and give them the motivation or push they need to keep moving forward. It is wonderful when I get to see them achieve their goals and obtain their happiness no matter what they have gone through. As an LPN, I provide everything I am asked to provide, whether it be providing care, assistant with transfers, obtaining more orders from their MD, mental health support, and many other things. I am here today to thank you for the money that was allocated in the last budget to nursing homes. It was a great start. We have been able to negotiate some wins for workers, but unfortunately, due to the historic underfunding of this industry, we need more. The pandemic has exposed just how dire the staffing situation in nursing homes have become. We are incredibly understaffed, even with the advances that we made last year. Short staffing means that I am unable to dedicate long hours of my time to help provide my patients' well-being. It means doing jobs outside of our job description that we don't get paid for. It means missing my meal breaks. It means not being able to take time for myself or to spend time with my family. It means having to cry in the supply room for 2 minutes and then put on a smile and try to be positive throughout the entire shift just for the well-being of my fellow colleagues and patients. Our residents are cared for by a staff whom they trust and open up to, whether it be the LPN or CNA. They confide in all of us to trust them and to attend to their needs and to also help them feel at ease during their stay. Because of short staffing, management is using staffing agencies to cover shifts that should be taken by full-time workers. Sometimes staffing agency nurses and CNAs are no call or no show, and they show up. And if they do show up, they don't do their job properly. It's frustrating to clean up after the agency staff and then get blamed for the errors on your shift. It gets demoralizing. If owners would invest in the workforce and hire people, we wouldn't have these problems. I get frustrated that we are not heard by management on a daily basis. I try to give a helping hand to my fellow CNAs every day and give them as much positive verbal feedback as I can for the hard work and dedication that we all give. This should be done by management every day on every shift, but isn't. Instead, we are blamed and we are under-resourced. We need the supplies and equipment to safely attend to our residents. We need the bosses to pay their employees, not the agencies, because we know our residents' needs and we give the proper care that they need. Unlike agencies who do not give the proper care and only look forward to their checks, which, by the way, they get paid double or triple than us regulars. They don't know our residents the way we do. So I appreciate this committee for recognizing for how far behind we were last year and allocating funding for our wages and benefits, but we are so behind. Even that increase isn't attracting new hires. We need funding to increase wages and benefits, and we need investment in the workforce so that people want to work here and that they would stay here and feel valued and compensated. So please help us with this issue, and thank you for your time.
Thank you. Thank you for your testimony. Next, Diane, number 52. Good afternoon.
Good afternoon. Good afternoon, Representative Walker and members of the Appropriations Committee. My name is Diane Sauer, and I'm speaking as the chair of the Board of Directors for United Services Incorporated, a community behavioral health center with 21 towns in northeastern Connecticut. I'm also speaking as an attorney who has been working with disabled individuals and their families since 1979. In these years, I've had the honor and the privilege of working alongside the dedicated and compassionate staff of United Services and of many community nonprofit organizations. I'm here today to express my support for United Services, as well as my support for the many other nonprofits without whom many of my clients and their families would have been absolutely lost. I want to thank you for the 4% cost of living adjustment for community nonprofits included in last year's budget. And I cannot express strongly enough the importance of the support provided by our community nonprofits and their importance to the people of our state. Please support them by addressing their underfunding and honoring the long-term plan to fund services by $461 million over 5 years. That's an additional 8% in fiscal year 2023. Thank you for providing me this opportunity to speak. Thank you.
Thank you, Diane. Thank you for your testimony. Next, number 45, Sharon Thorntonson. I thought I saw her.
Yes, hi, I'm here.
Okay, go right ahead.
Okay.
Hello.
Hi, good afternoon, Senator Austin, Representative Walker, and the members of the Appropriations Committee. My name is Sharon Thorstensen. I live in Southington, Connecticut. I'm a consumer employer who receives PCA services in my home. I became disabled due to diagnosis of demyelinating spinal cord disease and a ton of other conditions since. It's been a long journey, but I am very grateful that I have the PCA program And I come before you today to urge you to please allocate funding so that my PCAs and other PCAs can receive livable wages and benefits. As you know, we who are disabled, we rely on our PCAs for everything. And it is because of their hard work that I am able to remain in my home and continue to live a dignified life. It is only right that PCAs be paid a wage and receive the types of benefits that allow them to live dignified lives as well. Now, my PCAs cannot survive off the wages they earn. It is commonplace for PCAs to work multiple jobs in order to pay their bills and keep food on the table. My question is, when are they supposed to see their family or have time to pursue their own passions? By paying someone this low of a wage, you're forcing them into a life of endless poverty and work simply to make ends meet. By paying someone this low wage, you are saying that they don't deserve time with their family or free time to pursue the things that they love. By paying someone this low wage, you are really saying that they deserve to live in poverty. My PCAs also do not have benefits such as health insurance or a retirement savings plan. Throughout this pandemic, when consumers like me survived by the grace of our PCAs, they worked in a heightened state of risk because they did not have health insurance. How can we call PCAs essential healthcare workers and not provide them benefits like health insurance? It truly blows my mind. State budgets are documents that show where a state's priorities lay. Well, it is clear to me that when looking at home care services, that the state does not see them as a priority. By extension of this means that consumers like me who rely on these services are not a priority. Our dignity is not a priority. Our ability to live fulfilling lives and to matter is not a priority. So I come before you today to advocate for PCAs across the state who go to work every day and give consumers like me life-affirming care. They deserve so much more than what they are receiving. They deserve wages they can live on, health insurance that they can rely on, and a retirement plan that will give them peace of mind and with dignity. Please do what is right and allocate the necessary funding to show PCAs and the consumers like me that we matter and that we are a priority. Thank you for your time.
Thank you, and thank you for your testimony.
You're welcome. Thank you.
Next, number 53, Lori Kibbe. Lori, I know I saw you.
Hello.
Okay, there we are.
Thank you, Senator Osteen, Representative Walker, Senator Moore, Representative Abercrombie, and distinguished members of the Appropriations Committee. I am Lori Kibbe. I am the clinical liaison for Larry Caring Home Care. I've been a behavioral health nurse for 35 years with both inpatient and home care experience. Elara Caring, formerly New England Home Care, is the largest provider of behavioral health home care in Connecticut. We serve approximately 3,500 patients throughout the state. Behavioral health services provided in the community are crucial to the success of the state's plan to allow people to remain in their homes and not in institutions. Today, I ask you to open your ears and your minds to what I am about to share with you. I have dedicated my life to keeping people in their homes and not in institutions, to keep people from returning to the hospital time and time again, to build trusting relationships with people who often have no one else in their life, and to ensure safety and basic needs. Behavioral health nurses show up every day. Through the blizzards, through the hurricanes, through pandemics. Nothing has stopped us. We are the lifeline to a large, very vulnerable population who shows up every day during COVID and during those lockdowns when everyone was closed. No one was seeing a patient. But the nurses, the visiting nurses throughout the state, showed up every day, and we are still showing up to ensure our patients are not left alone, suffering from their increased depression, their anxiety, their delusional behaviors, or their addictions. Practitioners and prescribers trust professionally seasoned nurses to assess and to be their eyes and ears. They rely on us to report outcomes of medication changes, medication compliance, mental status changes, thoughts of suicide, and homicide, only to name a few of what we do. We go above and beyond every day to assure patients are well cared for. Our free time during COVID was spent organizing sewing groups and making masks, so our most vulnerable population would not be without. We worked food drives, we brought them food, we made sure they were not completely isolated in their homes. We vaccinated the public, and we do whatever it takes to keep our communities safe. We give up our family life far more than you'll ever imagine, and we stop doing whatever we have to when we know one of our patients are in trouble. We pick up that call. Over the years, I have showed up to people's homes, never knowing what I may find, and we are often in the most dangerous neighborhoods. I have actually been shot at, assaulted, and disrespected in ways unimaginable to most. And every day, we continue to show up. We all know mental health is at an all-time high for suicide and death by substance use. I am asking you today to please find a way to help us retain the nurses we have and to increase our staffing issues by returning the 10.5% you took away back in 2016. Please, we need you working with us side by side as we make huge strides to save the lives of those suffering from mental illness and substance use disorders. Thank you today for having me.
Thank you. Thank you for your testimony. Thank you very much. I'm going to go back to number 43, Mary Breton. Is she here?
Do you hear me? Hello?
No. There we are. Yes. Okay, there we go. Go right ahead, ma'am. Hello? Mary?
Am I here? You hear me?
Yes, I can now.
Very good. Okay. Good afternoon, Senator Austin, Representative Walker, and members of the Appropriation Committee. My name is Mary Breton. I've been a certified nursing assistant for 34 years. I am currently working at Davis Place in Danielson. I feel the state of nursing homes here in Connecticut are in a state of crisis. I have never seen such nursing home shortages, even so with the funding you gave us last year, and we're thankful for that. There are nights where I am caring for approximately 30 to 32 residents by myself, when at least 25% of those residents are a two-person assist. I am expected to provide 3 sets of rounds per shift, patient care, their dinners, and charting before the end of my shift. Now, how am I to transfer a resident from a wheelchair to a bed with a mechanical lift, which by law, it requires 2 people to operate? So I end up interrupting a nurse to ask for an assist, and it's stopping him or her from concentrating on their medication administration to help me do a Hoyer transfer. Over the years, we have seen major changes in the resident clientele. We are no longer just caring for our elderly. We now have residents who come straight from hospitals, who, by the way, need more attention and care because they are sicker with more acute illnesses. And I wonder why they discharge some of them to nursing homes when it's not always possible to meet their care and their needs. For those who do remain as they recover and heal, they need rehabilitation services such as physical therapy. We are seeing an increase in substance abuse, psychiatric and mentally challenged, and even sometimes homelessness, all needing their own types of unique care, and in which we are not especially trained to deal with. I used to work with the Department of Mental Retardation, so I understand and are trained to to meet their challenging needs. But that's not always the case with some of my fellow workers, as they have not had that training. The patient to staff ratios have not changed, nor monies increased to fix these issues, not even in consideration to the COVID-19. As a result, we have shortages across the board in our state. For example, let's take a look at environmental services at Davis, such as our housekeeping and laundry. There has been cutbacks in staffing, and there are absolutely no housekeeping staff on our second shift. So how can we keep up on our infection control, especially disinfection and sanitization, to prevent the spreading of the COVID-19 or other infections from getting into our facility? As of recent, we have had a nursing supervisor having to go downstairs to do a load of washcloths and towels so that we were able to provide proper care for our residents.
Mary, can you get some up, please?
Yeah. All right. So basically, we need more monies coming into the facility so that we can give the best and most proper care. And we have to give consideration too that we have the baby boomer generation coming up. And that's something we have to build an infrastructure to help meet those needs. I thank you for listening to me.
Thank you. Thank you for your testimony.
Thank you.
Have a good day. Is number 54 here? Dilliner, number 54. Okay, number 55, Leslie. Is Leslie here? Okay. Then we're going to go to number 56, Heather Gates. Hi, Heather.
Hi there. Good afternoon, and thanks for hearing my testimony. I'm Heather Gates from CHR. CHR is one of Connecticut's largest behavioral health providers. We provide housing, foster care, and primary care as well. And we employ over 900 individuals from throughout Connecticut. I want to thank you first and foremost for the 4% cost of living that you fought so hard for in last year's budget. It was really critically important to help us provide increases for our staff, which they so deserve. And they've really been on the front lines for the last 2 years. So those increases were essential. Thank you very much. And then I want to ask you to again fight hard for what is needed in order to help address the underfunding of behavioral health, as well as many other services, and include an 8% increase in the budget for the following year. I cannot begin to tell you how desperate we are for this funding. It's hard to overstate that. We have higher turnover rates than we've ever had before. We lose staff to other settings and providers. Right now, we have 43 clinical vacancies just in our child programs, and that does not include our adult services as well. Throughout the pandemic, we've given our staff hazard pay, increased salaries by as much as 14%, and absorbed health insurance costs. We recently distributed raises to our staff, and the gap between the funding received and the money we spent is $730,000. We have to figure out how to come up with that money next year just to keep everybody even. In addition, inflation is rising, and that's been by almost 6%. And that's having an impact on us as well in all other areas of our budget. What we really need is consistent and sustained funding from DCF and Medicaid rate increases from DSS, which until again recently have been a substantial issue. We currently have a deficit of about 123,000 in our therapeutic group homes. This is one of the highest level of care for kids who have serious behavioral health conditions. We've requested additional funding to no avail. We have a deficit of 289,000 across all the rest of our child serving programs, and including Medicaid. Our outpatient clinics are losing over $1 million right now because of inadequate rates and the need to pay clinicians higher salaries. So we really need the additional funding. And we want to continue delivering the services we provide to our communities. We're an EMPS provider, responding to crisis calls for children. We have clinicians in many schools to respond to urgent mental health needs. We have outpatient clinics and in-home teams, and they're all struggling to meet the needs of the children and families coming to us because of staff vacancies. And so we really need this additional funding to stabilize our workforce. And the cost of not doing so is that our children will not get what they need. And that's too high a cost to pay.
Heather, can you sum up, please?
Yep. We also want to just stress that many of the proposals in the budget are great ideas, but we need to stabilize the fundamental system first before proceeding with them. So we greatly appreciate your time, your attention, and all the work you put into this.
You're muted. You're muted, Senator. I now turn this over to my colleague, Senator Kushner. Thank you, Heather. Thank you for your testimony.
Thank you, Representative Walker, Madam Chair. And next up, we have, I see Anna Dorogazi. Did I say that correctly?
You
Number
did.
57. Please go ahead.
Great. Hello. Thank you, Senator Kushner, Representative Walker, Senator Austin, members of the committee. Thanks for the opportunity to speak with you today. My name is Anna Dorogazi, and I'm one of the policy directors at AARP Connecticut. In addition to the written testimony that we've submitted, I'm going to offer just a few very brief comments in support of the governor's recommended budget adjustments for the Department of Social Services. As DSS outlined in the written testimony, $116 million of the governor's proposed budget adjustment is to support the state's ARPA HCBS reinvestment plan. We appreciate the department's commitment to serving more individuals in home and community-based settings, because we know that's where an overwhelming majority of people want to receive care if and when they need it. According to a survey of Connecticut residents that AARP conducted in 2020, 81% of respondents said if they were to ever need long-term services and supports, they would want to receive that care at home with caregiver assistance rather than in an assisted living or skilled nursing facility. We're excited that the budget adjustments that we're seeing proposed support important ARPA HCBS investments, including, among other things, initiatives to support Connecticut's 460,000 family caregivers, help for long-term care recipients to adapt their home environments for safety and comfort, and programs to improve access to assistive technology. We also appreciate the proposed $5.9 million increase in funding for the Connecticut Home Care Program for Elders, which helps Connecticut residents over the age of 65 remain in their homes by providing assistance with activities of daily living, such as bathing, eating, and toileting. We hear from a lot of AARP members about what this program means to them, and they ask us to help build support for this program every year. One of our volunteers, Jean from Old Saybrook, had a mother who participated in the program for several years before she passed. I included a lengthier statement from Jean in my written testimony, but to just briefly summarize, she describes the program as something that was a gift to both her and her mother that gave her mother the opportunity to feel happy and connected to her community in the final years of her life. So thank you for that additional budget support this year. While we're pleased with the ARPA HCBS spending plan overall and how it's reflected in the proposed budget adjustments, we do want to highlight the importance of continuing support for these programs and services beyond the expiration of ARPA funding in March of 2024, as well as the importance of addressing the serious long-term care workforce shortage and that a lot of other people have spoken about during today's hearing. We know that adequate wages, good benefits, and opportunities for career advancement are critical to building and maintaining a strong workforce. If we don't have workers to do these jobs, there's no level of investment in programmatic support or other services that are going to save us from a crisis now or down the road. Thank you for the chance to speak with you today, and thank you for your ongoing work to help older adults receive services and supports in the setting of their choosing.
Thank you very much for your testimony here today. Next up, we have Dr. Mimi Deliseo Mata.
Good afternoon, everyone. Thank you, Senator Kushner, Senator Austin, and Representative Walker, and the distinguished members of the Appropriations Committee. I truly appreciate your time today. I am Mimi DeLesio-Mata. I am a pediatric dentist from Southbury, Connecticut, and I'm the current president of the Connecticut State Dental Association. I have been a Medicaid provider for 26 years in this state. During my time as a practice owner in Connecticut, I was fortunate to see an increase in the dental Medicaid fees in 2008, allowing Connecticut to be second in the nation for access to care. I thank you for proposing an increase to adult dental Medicaid, but I'm requesting that increase to be at least the same as the pediatric dental Medicaid rates. Although I'm a pediatric dentist, I also treat adult patients with special needs. Patients with intellectual disabilities can only withstand dental treatment if they're seen in the operating room under general anesthesia. General anesthesia is safe in a hospital setting with an anesthesiologist, but it is prudent fiscally and medically to complete all the needed dental work at a single visit. These cases can often take 3 to 4 hours, where I can restore between 20 and 30 teeth. Currently, Medicaid pays a limited amount compared to my fees. So when these cases are completed, I only get reimbursed a quarter of what it costs me to do the treatment. Since the pandemic, all of my supplies, my PPE, and staff salaries cost considerably more. At the current rate, I'm beginning to find it unsustainable to continue treating these patients, and there are no providers nearby that participate with Medicaid to help me. In order to retain a robust dental care safety net, adult dental Medicaid fees need to be increased to at least the same as the pediatric rates. This would help more patients receive the treatment they deserve and allow Connecticut to remain a leader in oral health care nationwide. Thank you for your time and thoughtful consideration of this important issue. Have a great night.
Thank you, and thank you for being here and testifying today. Next up, we have, I think it's Molly Cole. Is Molly Cole here, number 5061? There you are.
Hi, good evening, everyone. Thank you. And thank you for putting in such a long day. My name is Molly Cole. I'm the Executive Director of the State Independent Living Council. We're located in Hartford. I'm going to be brief because you have a lot of my information in my written testimony, but I'm here to testify today on the budget for aging and disability services pertaining to the independent living centers, which are part of the purview and work collaboratively with the State Independent Living Council. The 5 centers have been around since 1987. They are run by people with disabilities, as, by the way, is the council. The council is majority people with disabilities. They are non-residential organizations. They have staff of many, many backgrounds and skills, and they empower thousands of individuals with disabilities every year. They serve individuals across age, across disability, and across the state, and they do it all free of charge. Here are some of the numbers from FY21. I won't go through all of them. Again, you have it in my written testimony. 7,405 individuals received information and referral services on disability topics. 113 transitioned out of nursing facilities through Money Follows the Person. That alone saved the state millions while improving the quality of life for those individuals. 805 received independent living skills. As you heard in earlier testimony, we conducted a study back in 2016 and determined that the base funding level for the centers should be at $550,000 per center. When they were established, the centers were funded with matching state and federal dollars, and they were established at $200,000 each. In 35 years of operation, while the cost of living has increased more than 200%, federal funding for the centers has only increased to $195,000 per center. And at the same time, State funding has actually decreased to $92,000. That's if you take into account the 60,000 per center that's given just for deaf services. So their core base services are only funded by the state at $92,000 a center. It's really, really difficult to even imagine what it's like to have to continually cut back on services at a time when demand is increasing at the rate it is for people with disabilities. The CDC estimates there are 614,000 people in Connecticut with a disability. That's roughly 1 in 5. And since the start of the pandemic in 2020, the need for services and requests for assistance is up 51%, with waiting list in the centers as long as 6 months. They have drastically reduced their staff. They've limited services. They've limited their service areas. They used to cover all 169 towns. Now they're only covering 27. They don't have the ability to do any more. Our neighboring state in New York funds at $335,000 a center, and in Massachusetts, they fund at $715,000 a center. Connecticut continues to struggle to reach a functional level of state support. Our fiscal health is getting stronger, and we really feel now is the time to build back the independent living centers to a reasonable budget. And we are therefore asking for an increase of $1 million annually for the centers in total. Thank you.
Thank you. Thank you, Ms. Cole. Next up, we have, I think we'll go back to Angel Bailey. I see that you've entered the room, number 60.
Good evening, Senator Kushner and Senator Austin and Representative Walker and members of the committee. My name is Angel Bailey, and I am a personal care attendant, a PCA, living in Ansonia. I'm here to ask you to fully fund home care services so that PCAs like me can finally earn a living wage and receive quality benefits. I work as a PCA for 5 years, and I love work. I love what I do. As a PCA, I cook, clean, help my consumers get dressed, do their hair, take them out shopping, or even to doctor's appointments, and other tasks to care for them. The work I do as a PCA allows my consumers to enjoy the same comforts as you and me. I am a lifeline for my consumers, but as a PCA, I also need this work to be lifeline for me. The low wages and complete lack of benefits are unacceptable. I have to keep an incredible tight budget just to make ends meet and save nothing. I am really struggling. I also have to limit my hours to 25 per week so that I won't lose my Husky health insurance. It is wrong that we were called essential during the pandemic, but we were forced to cap our income just to keep our health insurance. With my asthma and other chronic conditions, I can't afford to be uninsured. We also have no paid sick leave. In December, I caught COVID and was out of work for 2 weeks and lost $600 in income. I had to borrow from my adult son to pay rent. Are these the kind of problems that we essential workers should be facing? In addition to poverty wages, no health insurance, and no paid sick leave, we also do not have a pension or retirement plan offered through our job. How are we supposed to save for our future, or do PCA not deserve to retire? I do not want to work until I die, but without better wages and benefits, I worry that I will be forced to leave this field I love. Please do what is right by PCAs and our consumers by allocating the funding necessary to provide PCAs with living wages and benefits, quality benefits. Thank you for your time.
Thank you, Ms. Bailey, and thank you for your testimony and your work as an essential worker. I believe next up we have Lynn Ritchie, number 62.
Good afternoon, Senator Kushner, Senator Olson, Representative Abercrombie, and Representative Walker and other members of the committee. Thanks for allowing me to testify. I've been listening in to these incredibly moving testimonies, and I appreciate all your time today. Many of you know a lot about the Hospital for Special Care. and you have my written testimony. So in the interest of time, I will not go into a lot of details. Let me first give you a little bit of a snapshot of who we are and what we look like today. Today, across our two settings, we have 220 patients. 75 of those patients are ventilator dependent, and many of those patients are children. In addition to the other diverse and unique populations we serve, we have 12 children in our autism unit, which is a 12-bed unit, and we have a waiting list of 20 others waiting for a bed to open there. In addition, we have another 8 beds for autism, which are licensed and ready to open. However, like many others today, we are faced with incredible workforce challenges. Before I go on, let me first say thank you to this committee and to DSS for your incredible support over the past couple of years. We are really grateful for the 4% Medicaid increase that we received last year, which was the first since 2007 for us as a chronic disease hospital. Since then, obviously, a lot has changed for all of us. The significant challenges that we face in recruitment and retention of our workers is much like those who have spoken before me. We employ nearly 1,300 people at our hospital and our various settings, and we alone have experienced a 12% increase in the cost of our wages over the last year. Even with that, we have significant challenges in terms of being able to recruit and to compete with traveling nurse wages and with acute care hospital wages. So the challenges that lie before us today are going to be with us for some time. We are also incredibly grateful that DSS is working on a wage enhancement that will apply to those patients who are Medicaid patients who are on ventilators. We're very grateful for that very significant support. However, it is scheduled to end at the end of the public health emergency. And as you know, these challenges that we face will exist long after the public health emergency. So while we are so grateful for everything that has been done, we are requesting that your assistance in making sure that the DSS rate enhancement for chronic disease hospitals is annualized into the state budget so that we can preserve the bedside far beyond the public health emergency. Thank you all for your time and for your commitment and your value of our organization. Have a great evening.
Thank you so much, and thank you for your testimony. Next up, we have Israel Alvarado, number 63.
Good day to everyone. How are you?
Doing well. We can hear you, so go right ahead.
Okay, so in the last 2 years or so, I've noticed the change in the healthcare system when it comes to employees trying to survive out here. Me personally, I'm faced with a couple of adversities when it comes to my own health. A little bit over a year ago, I suffered a heart attack, and it's been kind of difficult for me trying to work as a PCA and also maintain my own health up to par, so to speak. I've been week to week trying to literally juggle between my bills and my medicines in order for me to sustain, one, my own health, and two, my bills and my roof over my head between me and my family. It's becoming harder and harder every day. It's gotten to the point where there's a strong possibility that within the next month, maybe month and a half, I'm going to have to relocate back to PA because I can't sustain myself here financially when it comes to my medical, which is important and a half when it comes to me and my situation. Coupled with my pituitary tumor and my heart condition, it's a battle every day for me. I don't know how I do it sometimes. Sometimes by the grace of God, and also the doctors from Pennsylvania that are still helping me out by writing me prescriptions when I can afford them, of course. So 1 week I'll go with a certain type of medicine, and then the other week I won't, and kind of compensate and try to get the other ones when I can. But that means that something at home has to go amiss, I'm not paying. And then me catching COVID last December put me between a real rock and a hard place where I went literally almost 3.5 weeks with no pay. And of course, we have no PTO, no type of insurance to kind of help us along through these struggles. But that's pretty much my plight when it comes to my situation. And I know there's a lot of us out there that are, if not in the same, if not worse situations, and they are also crying out for help because we have none. But that's where I'm at with the whole situation.
Thank you, Mr. Alvarado, and I am so sorry for your health struggles, but I do appreciate your testimony here. It's important that we hear your story and the story of others. So thank you for being here.
Thank you for listening.
Next up, we have Emily Morrison.
Hi, everybody. Good evening, Senator Austin, Representative Walker, Senator Minor, Representative France, and members of the Appropriations Committee. My name is Emily Morrison. I'm a Putnam resident, and I'm Director of Development at United Services, Inc. Thank you for the opportunity to testify on the state, provide testimony on the state budget. United Services is the community behavioral health center for 21 towns in Northeastern Connecticut. We provide more than 30 programs under our one administration. We're a nonprofit organization, and we provide outpatient mental health for adults, children, and families, substance abuse treatment, family programs, and crisis services. I want to thank you for the 4% cost of living adjustment for community nonprofits that you fought to include in last year's budget. I'm here tonight to ask you to honor the long-term plan to address the severely underfunded community nonprofits and fund services by $461 million over 5 years, or an additional 8% in fiscal year 2023. Demand for United Services programs has never been higher. The impacts of the pandemic on mental health cannot be overstated. Our staff have now been working for 2 years with a community in crisis. Compounding these stressors is the low salaries our underfunded state contracts have forced our agency to provide. As an agency, we're currently operating at about a 25% vacancy rate, as is most, if not all, of the other nonprofit service providers. Low wages are the major cause. Vacancies lead to high caseloads for our remaining staff and increased stress at an already stressful job. It also leads to longer wait for services for our clients. And right now, our children and families are not in a position to be able to wait for services. The governor's proposed budget for the Department of Children and Families does not provide support to existing services and programs that are struggling and frankly failing to keep up with the demand. We urge the Appropriations Committee to fight for funding for these programs by implementing the 8% funding increase. You've seen the headlines. There is a crisis in children's mental health, and this crisis cannot be solved by only inpatient beds. We need to support community-based outpatient programs, ones that are accessible to children and families. These are the programs that are keeping children out of the hospital and helping them to recover. Please help us help the children and families in desperate need of support in our area. Thank you so much for your time.
Thank you, Ms. Morrison, for your testimony. Next up, we have Lisa Conley, number 65.
Thank you. And good evening, Senator Kushner, Senator Austin, Representative Walker, and members of the Appropriations Committee. My name is Lisa Conley, and I'm the Vice President of Community Living for Hartford Healthcare and the Chair for Leading Age Connecticut. Leading Age is a statewide association representing not-for-profit organizations serving older adults across the continuum of aging services. I'm here today to voice our strong support for the governor's proposed investments in quality nursing home care and community-based services, and to encourage continued investment in these long-term care supports. Over the past 2 years, aging services field has been at the center of the global pandemic. I'm proud to say that our members have endured and managed through it, working hard to establish the policies and procedures and skills necessary to keep our residents and clients safe, secure, and comfortable. Throughout this pandemic, we have valued our partnership with the state, including the vital financial support that has been provided to our nursing homes. Last session, we came to you and explained that we were really, truly struggling, and you responded with a permanent rate increase to support wages as well as temporary rate relief that the governor is now proposing to be extended for 3 additional months. These increases are deeply appreciated and desperately needed as we face rising costs for food, services, and supplies, while the workforce crisis continues to drive up salaries and wages. We also spoke to you last year about the deficiencies and inequities that exist in the current nursing home rate system. You responded to our concerns and placed $10 million in the biennial budget to be used for one-time grants for homes that had significant gaps between their calculated rates and their paid rates. And we thank you for that. Subsequently, the administration has determined that this inequity should be permanently addressed in the new acuity-based rate system. They are proposing a true rebasing of the rates, which will recognize allowable costs and increase the rates of nursing homes that have continually invested in their physical plants, services, and workforce. The governor has included $12.8 million in the DSS budget to support the first year of rebasing. We strongly support this, and we ask that you do as well. Finally, we support the Opera Home and Community-Based Services Reinvestment Plan that is reflected in the governor's budget and which is designed to make needed investments into home and community-based services, including those provided through the Connecticut Home Care Program for elders. This is a need that is essential for affordable assisted living models, complex home and healthcare for adults, and we look forward to working with you to find these solutions. We thank you for the opportunity to testify, and I'd be happy to answer any questions.
Thank you, Ms. Connolly. Thank you for testifying tonight. Next up, we have Allison Ware, number 66.
Good evening, Senator Kushner, Senator Austin, Representative Walker, Senator Minor, Representative France, and members of the committee. My name is Allison Weir. I'm a policy advocate and attorney with Greater Hartford Legal Aid. And I have submitted written testimony, so I won't read that here, but I want to highlight a few points. The governor's budget includes much needed increases in important programs, in particular the increase in dental rates for adults and Husky, the increased funding for behavioral services, and the funding for the community health workers are really important and appreciated. But I'm here to protest the cuts to the only two cash assistance programs the state provides to people most in need. The budget cut $5.5 million from the Temporary Family Assistance Program and $2.3 million from the state administered general assistance program known as SAGA. We're coming off a national experiment in distributing cash assistance to families in the form of these advanced child tax credit. While in effect, the ACTC dramatically reduced child poverty and food insecurity and supported people working by providing funds for childcare and transportation. Bottom line, cash assistance is an effective way to help people meet their needs. Caseloads have steadily decreased since the implementation of the Temporary Family Assistance Program since 1996. This may look like success, but it's actually a sign the TFA program is failing the families it's supposed to help. In 2019, only 27% of the families in poverty in the state received assistance from the program. There are at least 4 contributing factors for the decrease in caseloads. 1, income eligibility levels, which are not tied to the federal poverty level, have failed to keep up with inflation, so fewer people in poverty actually qualify for the program. 2, the time limit of 21 months discourages people from enrolling in the program and is too short for people with significant barriers to finding work to get themselves established in a job. 3, asset limits discourage significant savings and place administrative burdens on the applicants. And 4, the low earned income disregards disqualified families who are earning as little as minimum wage in full-time jobs, especially as we continue to increase the minimum wage in the state. I propose that legislature use the excess funds identified by the state to improve the program in at least 4 ways. 1, change the standard of need to a measure based on the federal poverty level so it continues to match on the federal poverty level and inflation. 2, extend the time limits. 3, remove the asset limits. And 4, increase the earned income disregard to keep pace with the increases in the state's minimum wage. I provide many more details in my written testimony, and I'm happy to answer any questions you might have. Thank you very much for the opportunity to testify this evening.
Thank you, Ms. Ware. Thank you for your testimony. And next up, we have Kyle and Morgan Daly. You are muted, so I'm sorry. Can you unmute yourself?
Sorry about that. Good afternoon, everyone. My name is Morgan and this is Kyle. We were admitted to the Supportive Housing for Families program as a reunification case on October 15th in 2019. We have a 4-year-old son together who was temporarily placed with Kyle's sister when he was 2 years old. DCF had given us some conditions that we were required to meet before we could get him back into our home. So at the time we were admitted to the Supportive Housing for Families program, we were living in a hotel, even though Kyle had been working full-time as a painter. We were both in recovery for less than a year at the time. And during our first home visit, I told my case manager that we had already found an apartment and the landlord was willing to rent to us when he learned that we were in the Supportive Housing for Families program. We were happy when the apartment passed an inspection and we moved in a few days before Thanksgiving in 2019. We've been living in the same apartment for over 2 years now, and with the help of our case manager, we learned how to budget our income and have been able to manage our household expenses. Recently, I worked with the Supportive Housing for Families vocational specialist and obtained employment at a Home Depot, while Kyle found a job at a local fence company. During the 2 years that Kyle and I have been in the program, we maintained our employment, purchased a car, saved money, and were just approved for a WRAP voucher. For the past 2 years, our most important goal was to be reunified with our son. The challenges we faced were not easy. However, with the help of the program and our case manager, we maintained our recovery and stayed focused and positive. We were able to achieve all of our goals, and most important was having our son back. Finally, in December, we were reunified with John, and that's our son, just in time for Christmas. This program gave us all the tools we needed to be successful. And I want to thank the legislators for supporting this program, and so that other families will have the same opportunities that we did. Thank you, everyone, for your time.
Thank you, Kyle, and thank you, Morgan, for testifying. It's great to hear how well you're doing. So thank you for being here tonight.
Thank you.
Next up, we have, I believe, next is Marissa Crean.
Hi there. Yes. Good afternoon, Senator Kushner and other distinguished members of the Appropriations Committee. My name is Marissa Crean. I live in Glastonbury, and I'm a volunteer for the Alzheimer's Association Connecticut chapter, as well as the chair of their Public Policy and Advocacy Committee. Thank you for the opportunity to comment today on the Alzheimer's State Respite Program. I have 2 relevant statistics to highlight for you today. First, more than 80% of the help provided to older adults in the United States comes from family members, friends, and other unpaid caregivers. And nearly half of those families are caring for an older adult with dementia. And second, caregivers of people with dementia are twice as likely to report substantial emotional, financial, and physical difficulties as caregivers of people without dementia. Over my many years of volunteering for the Alzheimer's Association, I've seen families struggle to care for their loved ones at home without supportive services. When someone is diagnosed with Alzheimer's disease or another related dementia, they're at the beginning of a long and challenging journey for both them and their caregiver. And as the disease progresses, it becomes ever more emotionally and physically challenging for the caregiver. Alzheimer's patients eventually cannot be left alone for fear of them hurting themselves. And thus caregivers often quit their jobs and sacrifice the family's financial stability to take care of their loved one. Respite services provides temporary substitute care that gives the caregiver a break from his or her caregiving duties. This temporary relief enables caregivers to ensure their loved ones continue to receive quality care while giving themselves an opportunity to manage and improve their own health, which is often compromised. Respite services are a lifeline to support caregivers, and expand access to this is vitally important in supporting the growing number of people in Connecticut who will be affected in the future as our population ages. Thank you for allowing me to have this opportunity to provide comment today.
Thank you. Thank you for being here and testifying tonight. Next up, we have Jonathan Stakely.
Good afternoon, everybody. My name is Jonathan, and I'm from Gales Ferry, and I've been a PCA for almost 3 years, and I care for my younger brother that has Down syndrome and receives both services through DSS and DDS. It means everything that I can care for my brother. My parents are elderly, and I don't know how they could make it work without me. Eating, drinking, bathing, exercise, and basic survival is dependent on care. My brother and the other 6,000 consumers live and depend on dependable caregivers. My brother's previous caregiver, who was with him for the last 10 years, had to leave the field when she had a baby due to the fact that there's no benefits. A pathway to $20 an hour and basic benefits like health insurance and paid time off would be a great investment to ensure the invisible backbone of the healthcare system, which is home care workers, can thrive and live our lives with dignity and respect we deserve. It has been incredibly disappointing that in DSS draft plan, we only saw a fraction of the money going towards wages and none towards any of these benefits. And as a home care worker, we work tirelessly around the clock and serve as the invisible backbone of the healthcare system. We do a job that serves our state's most delicate and vulnerable citizens, and we do so with the love and quality care that they deserve. But what about us? Our consumers can count on us for their survival, but we're asking if we can count on the state for ours. Thank you, everyone, for your time.
Thank you, Jonathan, and thank you for the work that you're doing. Next up, we have Alice Forrester, number 70.
Hey, good evening, everyone, and thank you so much for sitting through this, all these really amazing testimonies. I'm Alice Forrester. I am the CEO of Clifford Beers, which delivers a broad array of mental health services in New Haven, Greater New Haven, and Norwalk for well over 5,000 children, Connecticut's children. The children's mental health system for Connecticut is largely constructed by private providers with funding by DSS, DCF, and many other organizations and philanthropic organizations. It is private providers who are responsible for delivering the outpatient mental health of most of our children in Connecticut. We're expected to deliver the services in an equitable and timely manner, address the complexity of family and children's needs, and find ways to figure out how to help families stabilize, as well as help children move towards health. We do this work with good intention, using innovation, ingenuity to piece together funding to holistically serve the child and their family. We are the infrastructure for the success, livelihood, and wellness of the children in our state. Just like the contractors who bid on and receive contracts to build a bridge, we create the avenues for our children to succeed. Unlike the contractor who bids on building the bridge, we're not allowed to propose to our state funders the true cost of service. We're asked to fit under proposed budgets, which run at a loss for us. We deserve payment that covers true costs. God forbid we should ask for a relative profit line to reinvest in new programs, technology, or administrative services. We have to agree to start a new program well under the real cost. If we choose not to do it, the kids in the community may lose out. And in order to deliver the services, we have to seek dollars elsewhere to make ends meet. Well, as you've heard in our local and national news, the infrastructure for our children's mental health system is deteriorating. I've been a CEO for 16 years, and the gaps in managing our budgets are large, potholes, and I can no longer fill them. The bridge is shaking on its foundation and ready to crumble. Private providers run their amazing services with a gaping deficit of $461 million over the last decade, owed to us by the state. I ask this question: why, amongst all the businesses Connecticut does with contractors to deliver products and services, do we allow the children's mental health system to be built with bits and pieces? Do we care so little for our kids and families that we abandon them? Does Connecticut expect our bridge contractors to fundraise to fill the gaping holes in their streets and pavement? Our expectations are high. We have our own personal expectations as organizations, and Connecticut is expecting us to continue to accept partial payment and deliver excellent work. I want to admit to you my hopelessness and fear for Connecticut, that we will abandon our children and families by not funding your mental health system the way it needs to be adequately. Please fix this decade of underfunding. Give us 8% next year, or give us all the $461 million that's owed over the last 10 years. Believe me, I am 22 clinicians short and run a deficit sometimes of over $1 million every year that I have to figure out how to pay for. So I appreciate your time. I've spoken to many of you for all of your hard work, but I think it's time for us to start thinking of it as construction and as a deal that needs to be fully funded. So thank you.
Thank you so much for your testimony, Alice. And next up, we have Antoinette Osei. I think it's Osei Bonsu.
Yeah, hi.
There
That's
you are.
me. Yeah. Good evening. I'm going to testify on behalf of Leonie Elibi because she's an LPN and because of shortage of staff and she couldn't make it. So I'm going to testify on behalf of her. Okay. So this is her testimony. It says, "Dear Senator Austin, Representative Walker, and members of the committee, my name is Mrs. Leonie Elibi. I've worked as a licensed practical nurse since 2007, but I've taken care of people all my life. I would like to share a story that has stuck with me since the beginning of the pandemic. It was the night of April 9th, 2021, when I pulled into the parking lot of the reservoir in West Hartford, Connecticut. It was nearly empty. When I walked into the building and punched in, the energy in the building was very tense. The previous shift had worked severely short. When I looked at the schedule, I saw my name, no CNAs. I thought maybe it was a typo. When I asked the supervisor who was working with me, her reply was, "We don't have anyone." Patients were calling as soon as I received the report. My census that night was 17 on a rehab unit, a unit with 17 patients that I alone would have to provide care for, give medication to, and keep safe. I had no time to complain. All I could do was do my best and hit the ground running. The supervisor was also working on a unit upstairs with a CNA and 32 patients. So if we are counting, only 2 nurses and 1 CNA were staffing the reservoir that night and had to care for 49 residents. We as staff members are told never to tell the patients how many staff members are in the building, but it is their right to know. I told each and every one of them who were alert enough to comprehend the situation, just what we were working with. I also ensured them that I would do my best to meet all their needs they would have that night, and I truly meant it. I went through my MAR and quickly gave all my meds that were due at 12 a.m. and which were for 13 patients. I had 2 IVs to set up. 1 IV runs for 30 minutes and the other one 90 minutes. In between all these tasks, I had to answer call lights and attempt to look through the admission paperwork of 2 patients who were admitted 6 hours prior to my shift. When I was done with these tasks, I then had to start giving incontinent care to the 12 of my patients that needed changes. While giving care, I had to stop periodically to change my IVs, check on 4 risk patients, and answer light. It felt never ending. I tried to do my best throughout the night to make sure my residents stayed dry, free from pain and repositioned properly. At 5 a.m., all 17 patients received medication, then last one had to be done. I was so tired and hungry. Instead of taking a 30 minutes break to eat and recharge, all I could do was take a quick bathroom break to cry. I wiped my tears and said to myself in a mirror, "Be strong just a little while longer." I then took a deep breath and went back out. I tried to be as cheerful as possible with my patient. When I finally gave a report to the next nurse, finished all my most important charting, it was 12 noon. I'll never forget that night because it was first night of my many nights of working severely short. But that night or so unsafe, it haunts me. I say this to make the point that safe staffing ratio must be put in place now. We do have the luxury of overlooking the cries of healthcare heroes. Heroes have failings too. Eventually, we all will fall ill to sickness and disease at some point. If ratios are not enforced, we will be on the receiving end of the overworked staff and staff not being able to give the care that we do desperately need because there won't be enough people to handle the workload. My only regrets today is that I can't read this to you myself in person because my patients need me more. I am the only full-time nurse who works night. If I'm not there, no one will be. To those persons who have the power to set things in motion and to change situations like this, please be the light at the end of the tunnel. Please help. Thank you for your time.
And thank you for reading that testimony. Please share with your coworker. We appreciate her testimony, even though she couldn't be here and read it herself.
All right, thank you, guys. Good night.
Good night. Next up, we have, we have Bruce Baxter, number 72.
Good afternoon, ladies and gentlemen. Senator Austin, Senator Kushner, Representative Walker, Senator Minor, Representative France, and members of the Appropriations Committee. My name is Bruce Baxter. I am the president of the Connecticut EMS Chiefs Association, as well as being the chief executive officer of New Britain Emergency Medical Services. Folks, first I want to start off and thank all the members of the Appropriations Committee for the hard work that you've done over the years to support the critical role that EMS responders play in every community in this state on a daily basis. We're deeply appreciative of your efforts last year that provided us with the first increase in our Medicaid ambulance reimbursement structure in 5 years. We continue to be your neighbors, your friends, and the first ones to appear at your doorstep in a time of crisis. Tonight, I'm here to talk about the issues that we are confronted today. These are issues that even a year ago, I don't think any CEO of an EMS organization, not only in the state of Connecticut, but the United States, ever contemplated we'd be in today. The system nationally, as well as statewide, is facing significant duress that requires additional investment to ensure it continues to be available for the residents of our state when they have an immediate need and need EMS the most. As an industry, we're confronting a perfect storm of challenges over which we have little or no control, including but not limited to rising call volumes, increasing staff turnover, a shrinking pool of qualified replacement personnel, wage pressures and expenses associated with a reduced recruitment pool that have seen our wage structures increase by 25% this year, and increased operating expenses caused by inflation, lack of access to essential supplies, inclusive of medications, and the prolonged disruption of various supply chains. If these remain unaddressed, it will result in a deterioration of our essential 911 response services, including reduced availability of staffed ambulances and EMS response units to manage the increased volume of 911 calls, as well as non-emergency medical transfer calls, prolonged response times to patients, leading to negative outcomes and inability for certain agencies to decompress inpatient and outpatient areas of healthcare facilities, and significant fiscal stress in agencies that manage a disproportionate share of patients who rely upon governmental health insurance plans, which fall far short of reimbursing our full cost of providing services. As such, the Connecticut EMS Chiefs Association urges the Appropriations Committee to consider the following help to address some of these challenges as it relates to the state's Medicaid program. We are deeply appreciative, as I said earlier, of the increase that you provided us last year. But for us to make sure that we're readily available, we'd like the committee to consider increasing Medicaid ambulance reimbursement fee structures for emergency ambulance service to the Medicare ambulance fee structure. This would provide EMS agencies with an immediate increase in Medicaid revenue of an average of $126 for each emergency response, treatment, and transport of Medicare beneficiaries they treat on a daily basis. Additionally, we would ask that the loaded mileage rate be increased from the current rate of $5.88 per mile to the Medicare rate of $7.62 per mile. Secondly, we need to consider how to limit our need to come back to this committee on a periodic basis, seeking rate increases to meet our needs. And we would ask you to consider the endorsement of the approach Medicare takes, which is increasing our fee structure on an annual basis through a chain CPI approach. This would turn around and allow our rates to turn around and address the cost of inflation as we move forward.
Mr. Baxter, I'm sorry, but your 3 minutes is up. And so if you could summarize.
I certainly can. Again, we're deeply appreciative of your support. If anybody has questions, please feel free to reach out to me. And I seriously urge you to consider our request. Thank you and have a great day.
Thank you. And thank you for your service as well. Next up, we have Bonnie Gaudreau. I'm sorry. Bonnie, tell me how you say your last name.
It's Gaudreau.
Gaudreau. Thank you. Go ahead.
All right. Good evening, everyone. Senator Olson, Representative Walker, members of the committee, Senator Kushner. My name is Bonnie Gaudreau, and I'm a charge nurse at a long-term care facility. I have worked there for the past 32 years. I have never seen staffing issues as bad as they are right now. Patient to staff ratios have always been an issue, even though according to the state regulations, we always have enough staff. Those guidelines have not been changed in over 30 years until last year and just recently. DPH told employers that they didn't need to follow the guidelines, which is just a roundabout way of saying that nothing has changed. Nursing homes are no longer just for the elderly. We admit a span of many age groups with much more complex acute behavioral, psychiatric, and bariatric issues. I often question why I became a nurse, as I feel inadequate most shifts. I am not able to provide the level of care that these residents deserve to receive. Imagine coming into work on the day shift with 34 residents. 6 are high risk for falls, 2 are actively dying and on hospice, 7 have dementia with behavioral disturbances, 2 are constantly exit seeking, 4 are bariatric, which requires a minimum of 2 to 4 staff to reposition and roll just to give basic care. Only 2 of my patients are independent and the rest have advanced Alzheimer's and are in need of total care. Now try working with only 2 CNAs. How are we adequately providing care for all of these human beings? On day shift, which is 7 to 3, we provide 2 meals, breakfast and lunch. Many of these residents must be assisted with eating or are completely dependent on staff to feed them. With only 2 CNAs on duty, how are they supposed to wash, dress, shave, trim nails, ambulate, toilet, reposition these residents every 2 hours? All while checking on hospice patients every hour, preventing behavioral altercations, preventing falls, preventing exit seeking, etc. It is impossible. As the charge nurse for 34 residents, I have to complete 7 blood sugars before breakfast even comes out and start my morning med pass, which takes a minimum of 2.5 hours to complete if there's no interruptions, and that's minimum. As I'm popping medication, I hear my name paged overhead for a phone call, so I answer it. Family members of other residents approach my car asking for assistance, so I go assist. I hear a resident yelling for help in their bedroom, so I go running to help. I see a high-risk fall resident resident, so I go run to catch the falling resident and yell for help myself. I have to check on the hospice patient who's actively dying. Every hour, recheck the blood sugars before lunch, start my afternoon med pass. There's lots of charting, and complete all the required other activities that can pop up on a nurse's daily shift. All of this is an 8-hour shift. Could you do this? We are constantly faced with this ethical dilemma daily. COVID has only made this whole scenario worse, We lost many staff at the start of the pandemic because they did not want to put their own health at risk. During my facility's outbreak, we lost 30 residents.
Bonnie?
Yes.
Bonnie, we have come to the end of the 3 minutes, so can you wrap up?
Yes, basically, I just want to say that we are asking for your help, and the mixtures of residents in nursing homes is not easy to manage. It is not like it was 30 years ago. And we ask for the staffing ratios to change and to be enforced. And we need to improve our working conditions, and we need to improve the quality of life for the residents that live in these facilities. Thank you for your time.
Thank you so much, Bonnie. And definitely the answer is no, I could not do all of what you do. So thank you.
Thank you.
Next up, we have Fernando Munoz, number 76.
In a minute.
Good afternoon, Senator Austin, Representative Walker, Senator Kushner, Senator Minor.
I'm sorry, just 1 second. I did skip over someone, but we'll go ahead. If you could just hold 1 minute. I inadvertently skipped someone, so we'll come back in 3 minutes, okay? Next up, I apologize. It's Catherine Jones Newton.
Good afternoon, Senator Austin, Representative Walker, and the members of the committee. My name is Catherine Jones Newton, and I am a consumer in the Medicaid waiver program. And I live in New Haven, Connecticut. I am here and I rely on my PCAs, and they can you hear me?
Yes, we can hear you. Go ahead.
I rely on my PCAs, and they deserve better. In fact, I took the arrest last week in front of the Capitol building because I am willing to put myself on the line for my PCAs like they would do for me every day. In 2012, I broke my hip in a bad car accident, and my mobility has been limited ever since I have been able to live in my home and live a much normal life as I possibly can. Thanks to the care of my PCA workers I receive from home care. Being able to receive service in my own home, work where I feel secure and happy and comfortable in my own home. My care workers help me in every part of my life. After being in the facility for 6 months, I know the difference it makes being in your own home where I feel secure. My care workers help me in every part of my life. They help me move, take a shower, fix my meal, remind me of my meds, and get my groceries, clean my house, and a million other things throughout the day. They also become my friend. They support me in every way that they can, and I will do the same for them, which everything they do for me. It's hard to see them struggle. My PCAs are not paid a livable wages, which means they have to work multiple jobs to make ends meet, 2 or 3 jobs, leaving them to be run down and burnt out and stressful. I am so grateful for my PCAs caring for me throughout the pandemic, but I know they did so great as a risk to them, as they do not have health insurance. It is sad to know without any retirement savings, my PCAs will be lucky if they ever get retired. We must do better. I have taken a lot of time and effort in finding my PCAs, training them, and building trust in them. In turn, my PCAs make me feel secure, comfortable, and happy in my home. But they can't be secure, comfortable, and happy if they can't pay their bills, support their families, and have the peace of mind that quality benefits provide. Our home care workers work hard and they deserve better. Thank you for your time.
Thank you, Ms. Jones-Newton, and thank you for the way you've supported your PCAs. Next up tonight, we have Fernando Munoz, and I apologize for getting you all ready and then holding you back for a minute, but thank you.
That's okay, Senator. I appreciate the time. So good afternoon, Senator Austin, Representative Walker, Senator Kushner, Senator Minor, and Representative France, and distinguished members of the Appropriations Committee. My name is Fernando Munoz, and I'm the CEO of Community Solutions. Since 1962, our organization has positively impacted the lives of our clients and their communities by providing services that facilitate skill development, enhance responsible citizenship, and increase overall well-being. We do this by providing programs like Lisa's Wish and Sail, which provide a warm, safe, and structured independent living environment for young people in the care of DCF. Thank you for the opportunity to testify in the state budget. First, I want to thank you for your leadership last year in securing a 4% cost of living increase for community nonprofits. It has made a significant difference in our ability to pay our staff more reasonable wages. I'm here today to ask that you honor the long-term plan to address the chronic underfunding of community nonprofit services by providing an additional 8% in fiscal year 23. This would be the second step on the path to providing the $461 million over 5 years that is needed to make up for more than 15 years of underfunding the service system. Without this additional support, we risk not being able to provide critical services to Connecticut's youth. My organization's group home and independent living program have endured significant staff shortages due to the pandemic and the overall labor shortage. Staff are overworked and often have to work double shifts to maintain staffing ratios. This puts a burden on the programs and could ultimately hamper our ability to provide quality services to the young people DCF places in our care. A recent survey found that 18% of the staff positions in community nonprofits are vacant. At Community Solutions, between 15 and 20% of our positions are vacant on any given day. That's twice the rate of vacancies we experienced before the pandemic. We need to pay more competitive wages in order to recruit and retain staff. And without additional funding, we simply won't be able to continue to provide services to the clients who so desperately need them. I want to close by saying that the governor's proposed budget for DCF funds new children's behavioral health services, for which we're grateful, but it does not provide support for existing services and programs that are struggling to keep up with the demand for services. We urge the Appropriations Committee to keep fighting for funding for these programs by implementing the plan for the additional $461 million. I thank you for your time.
Thank you, Mr. Muniz. I appreciate your testimony tonight. And now I will turn over the chair to Representative Felipe.
Thank you, Senator Kushner. Next up will be Michael McLively.
Thanks, Representative Felipe. My name is Michael McLively. Good evening, everyone, members of the Appropriations Committee. I really thank you for the opportunity to speak with you today. I'm the policy director of the Community Violence Initiative in Giffords. Giffords is a national gun violence prevention organization named for former Congresswoman Gabby Giffords, who, as many of you will remember, was shot back in 2011 while hosting an event for her constituents in Tucson, Arizona. At Giffords, we work with legislators and advocates around the country to promote common sense solutions to gun violence. And with our Community Violence Initiative, we recognize that day-to-day shootings on our city streets that occur disproportionately in communities of color are one of the main drivers of America's gun violence epidemic. Across the nation over the past 2 years, we've seen a large spike in homicides and shootings since the onset of the COVID-19 pandemic, including in Connecticut. Hartford this past year suffered its highest number of homicides in nearly 20 years, and in New Haven, the most since 2011. So there is a clear and urgent need to respond to community violence with every available resource, not just law enforcement approaches, but also community and public health-based solutions, including hospital-based violence intervention programs, which work directly with individuals who have been violently injured to save both lives and taxpayer dollars by disrupting cycles of violence in our communities. That's why we were incredibly pleased last year when this legislature acted to make Connecticut the first state in the nation, along with Illinois, to direct its Medicaid program to reimburse services provided by certified violence prevention professionals. House Bill 5677 directed DSS to amend the state Medicaid plan to include the provision of services from certified violence prevention professionals to Medicaid patients. This is an incredibly important way to leverage federal funds to support services for individuals who are violently injured and at risk of re-injury or of committing violence themselves in the near future. The passage of this bill last year was an important step forward for Connecticut and has already had national implications. Several other states this year, including Oregon, Maryland, California, and Virginia, have introduced similar legislation. And with that said, the next critical step forward in Connecticut is successful implementation of this reimbursement structure for violence prevention professionals. The Connecticut HVIP Collaborative, of which Giffords is a supporting member, has been engaged in ongoing and productive conversations with DSS regarding the implementation process. And this legislature and this committee in particular can help support this effort this year by ensuring that implementation process is fully funded in the budget for DSS. So in summary, we applaud you for taking steps to leverage Medicaid to support violence prevention professionals, and we urge you to robustly fund the rollout and implementation of this innovative policy. As we're seeing this year, other states are taking their cues from you in Connecticut and looking to see how you'll handle implementation of this program, which makes its success all the more critical. Thank you so much for your work on this. Please don't hesitate to reach out if Giffords can support in any way. Thank you so much for your time. Have a good evening.
Thank you, Michael. We're going to go back to 73, but just for a second, a little bit of housekeeping. If anybody is testifying and you see me go like this, that means you have 15 seconds left, just so you can wrap up without me having to interrupt your testimony. Next, we'll call on 73, Chris Kibble. Chris, are you there? Chris Kibbe, sorry. All right, and give him a second to get himself together. Next is 78, Alyssa Godudi. Did I get that right?
You did, thank you. It's Alicia, but close enough. Good evening, Representative Felipe, Senator Kushner, Senator Austin, Representative Walker, and honorable members of the committee. My name is Alicia Godudi. I am the president and CEO of Edelbrook Behavioral and Developmental Services. Edelbrook is a 122-year-old multi-service organization specializing in autism spectrum disorders, developmental services, and behavioral health treatment. We contract with DCF, DDS, and 67 municipalities and school districts. We support hundreds of children and young adults with highly complex needs through the expertise of more than 600 talented and caring employees in 20 different locations throughout Connecticut. Many of the individuals we serve have extensive trauma histories. They've experienced multiple hospitalizations. They've been in and out of other treatment programs and often served out of state. We work to understand and address behaviors, help individuals improve communication skills, maximize their unique talents, and ultimately help them find hope and happiness. Our programs keep people out of the hospitals and get them back into their home communities. And we do this work not just because it's our mission, but really in partnership with and on behalf of the state of Connecticut. Our work in caring for people in need is rightfully a core function and a financial obligation of government. And the value of our nonprofit human service system has never been more apparent than in the past 2 years. When most people were home, able to quarantine, our staff continued to support children in need face-to-face every single day, shift after shift, putting others ahead of themselves. They stayed with children who were COVID positive for days on end. Even before the vaccines existed. I'm just going to pause there because can you imagine a year and a half ago agreeing to stay and help a child with disabilities who's tested positive for COVID? They are heroes, they are essential. And we're incredibly grateful that the legislature supported a 4% COLA last year. We appreciate your commitment to DDS funded staff who will now, for our program staff, get a base rate of $17.25 as of July. But our DCF funded staff are equally deserving, and there is no COLA in this proposed budget for them. If we do nothing, our DCF funded programs staff will leave. They'll go to our DDS programs or they'll go outside the field to lower stress, higher paying jobs. I ask that you honor that long-term plan proposed, and you've heard so much about it tonight, to increase funding and really start to address long-term strategies. We're asking for an 8% increase this year. Representative Walker said earlier today that we must reevaluate the way that nonprofit agencies are funded. This is the year to do it. Our 600 employees and their peers deserve to be paid at levels that reflect their expertise and their dedication. The state needs a stable system to turn to when state employees retire, and the children we serve deserve to have consistent staffing. I will leave you with a quote that means a lot to us. The true measure of any society can be found in how it treats its most vulnerable members. That was Mahatma Gandhi. I thank you for your time, your attention, and your ongoing support.
Thank you, Alicia, and for your testimony. We will now ask Jacqueline Pinney to join us. Or actually, I'm sorry, Jacqueline. I'm going to pull Senator Kushner here. Chris Kibbe, one more time. I see that you're still here if you would like to testify, number 73.
Good evening. My name is Chris Kibbe, and I'm from Wallingford, Connecticut. Thank you, Honorable Appropriations Committee, for your time and attention. Please excuse me if my ESA barks. He is 6 months old and has been graciously waiting to go out on his evening walk. I'm here to give my testimony regarding my experience with home health nursing care. A little bit about me: I am 54 years old, reside in Wallingford, and am a Texas transplant. I resided in Connecticut for 20 years. I am legally disabled as of 2007, and my diagnoses include stroke, bipolar, and PTSD. I'm also an alcoholic with 20 years sober in AA. I've been hospitalized over the years to impart medication changes and also due to deterioration in my mental health. In 2007, following a lengthy mental health hospitalization, home nursing visits on a daily basis were recommended to me by my treating psychiatrist. I welcome the support. A visiting nurse stopped by my home every morning, took my vitals, inquired how I was feeling, both physically and mentally, and administered my medications. The nurse also made sure to deliver and refill my medications and acted as an intermediary between my medical team and my family, who do not live close by. Those daily interactions ensured that I had taken my medications exactly as prescribed, addressed any changes, answered my questions, gave me peace of mind, and gave me the social interaction with the treating medical professional on a daily basis. I've had visiting nurses on and off over a 15-year period, both in my private home and in a private sober house. I have learned over the years of living with mental health challenges that recovery is a moving target because it often includes a chemical imbalance. Meds need to be adjusted, vitals need to be monitored daily, side effects need to be addressed and managed, medication must be taken directly exactly as prescribed, and patients need access to their over-the-counter medications and non-prescription medications recommended by their doctors. Even then, periods of time of hospitalizations may be necessary. One of the bonuses of having home health nursing agencies is that they can both intervene and interpret when these situations arise far in advance or the patient, and bridge the gap between psychiatric and therapy appointments. I am so deeply grateful for the many nurses and home health aides who have been there for me over the years. When experiencing periods of manic or depressive swings, home health nurses reminded me to eat and hydrate because I often forgot. They ensured I had appropriate food and nutrition. I currently reside on my own, work part-time, and am an active member and volunteer in my community. Without past benefit of these nurses and my sober community, I would not be able to live and work and give back independently.
Ms.
It is
Kibbe, you
an
have
honor and a
15
privilege.
seconds. Please summarize.
I'm honored and grateful that I'm able to speak on this important issue. Thank you.
Thank you, and congratulations on your 20 years. We will now move
Thank
on
you.
to 79, Jacqueline Piney.
Penny. Thank you. Good evening, members of the committee. My name is Jacqueline Penny. I am a resident of Wethersfield, Connecticut, and I am the Executive Director of Independence Unlimited in Hartford, Connecticut. We are one of the state's 5 independent living centers which serves people of all disabilities and all ages in Connecticut. Our ask today is to be further funded in the state budget with an increase of $1.7 million for all 5 centers to continue and expand and great work we do. The centers keep and help people be independent in the community, whatever that means to them. This task was especially true during the pandemic. Not only did we help people transition home and out of facilities with the Money Follows the Person program, we help keep people home and independent, and we were able to assist with social isolation needs and assistive technology needs as well. Another program we were able to help people with was grocery delivery when people were scared to go out into the stores. We assisted with delivery and even taught many people how to use technology to get deliveries in the future. We aided people in getting the much needed PPE they needed, and currently are actively distributing COVID tests and masks and assisting with vaccine and booster appointments and coordinating home visits for those who can't go out. Many of the funding to do these tasks will be going away, but the needs are still great. Our numbers of people served in the last 2 years, each year has doubled in information and referral and people we serve day to day. Many of the centers nationwide, as each state has centers of independent living, are much more funded than the Connecticut centers. We are one of the lowest in the region at $92,000 per year, where Massachusetts is $745,000 per center, and they have 10 centers. And in New York, it's $335,000 per center, and they have 15. We need the funding to continue to meet the needs of those we serve and help those we serve find independence and remain independent. We are person-centered and locally based. We help people when no one else can or will, from home security to home modifications, to obtaining medical equipment or obtaining employment or the skills they need to be employed. Thank you for your time today.
Thank you, Jacqueline, for joining us and for your testimony. We will now have Megan Scanlon.
Good evening, Representative Felipe and the rest of the members of the committee. My name is Megan Scanlon. I'm here as the CEO of the Connecticut Coalition Against Domestic Violence. I want to thank you for providing me this time to speak with you regarding the domestic violence survivors and their children across the state. I'm here tonight to thank Governor Lamont for his proposal to allocate $2.9 million from the Coronavirus State Fiscal Recovery Fund to the Department of Social Services to address victim safety risks and needs which have been intensified by the pandemic, and urge your support. This funding would assist our 18 sites in providing critical assistance to victims, including shelter, hoteling, food, transportation costs, childcare assistance, basic needs, moving, utilities, furniture assistance, and housing. In addition to the emergency financial assistance, the funding will assist our 18 member organizations to fund ongoing emergency housing needs. For years, we've been running over capacity in our shelters at 122%. In fiscal 2021, we averaged 156% with a high of 179% in October of 2020. Since the start of the pandemic, we anticipate that the cost of sheltering survivors will continue to be a stress on our service system, and we've already incurred over $2 million in unanticipated costs. It's important to note that the cost of hoteling is not just the cost of the room, but we also provide case management services, 3 meals a day, Wi-Fi, laptops, tablets, anything that is needed for remote learning. The increased staff time in order to get to the hotels and work with children that are held in a room, often with their siblings, is intensified. I know you heard from. In addition, I also want to talk about funding that we are proposing, and we would like the General Assembly to consider for our Child and Family Advocate Program. We are requesting that the General Assembly consider an annual amount of $1,440,000 to fund 18 full-time child and family advocates across the state. We want to thank Senators Looney and Duff for proposing this in their Senate Bill 5. And currently, we just want to be clear that there's no state funding for this position across the domestic violence service system. I know you heard from Jane earlier, who's one of our child and family advocates that operates in Ansonia, New Haven. So I think she gave a pretty clear picture of what her day-to-day looks like. So I just want to get into the fact that we're looking at the number of cases that these advocates are handling each year. And over the period of time from 2017 to 2021, we had an average of 4,313 children served annually. However, given that each member organization is only able to utilize 0.25% of federal funding that we get through OPM, a pass-through we get through OPM, we're looking at children spending an average of 2.26 hours with their child advocate, which is just
Mrs.
not
Scanlon,
enough
if you could
time.
please wrap up. Your 3 minutes is
Yep.
up.
No problem. I want to thank the committee for the consideration of this proposal and urge support of the $1.4 million for child and family advocates. Thank you.
Thank you so much for joining us. Next, we will have, I just saw her, 81, Paulette Bellin.
Hi, good afternoon, Senator Osteen, Representative Walkers, and members of the committee. My name is Paulette Beelan, and I come to you today as an advocate for the most vulnerable population, the elderly. I also come as an advocate for myself and my coworkers. I am 58 years old and have been a CNA for 42 years. I never chose to further my education as LPN or RN because I love the time I spent with my residents. In the last 42 years, I have seen such a drastic change in the nursing home industry, yet I have seen no changes in the state staffing patterns. The public thinks that we take care of elderly residents with Alzheimer's and dementia, but the truth is that it's a mixed population. Connecticut has closed one of the biggest mental health institutions, Norwich State Hospital, and those patients have gone to the streets and in nursing homes. We are also dealing with younger residents that have substance abuse issues and psychiatric illnesses. I am aware that this population also needs and deserves care, but I find it very unfair to our confused, frail, fearful elderly residents. We are expected to care for these challenging residents without any proper training or in-services. Many days I've been tasked with caring for 22 residents alone. If a whole family cannot care for one person, please tell me how I am supposed to properly care for 22. Staffing for nursing homes is quickly disappearing every day. Nursing home workers have and continue to work through a pandemic with little to no compensation or recognition. Nurses and CNAs' lives have been hijacked because they cannot staff the facilities. Mandating daily takes place. You are forbidden to leave after your shift to get your kids off the bus or to take care of your own family. There have been many days that I said I was not coming back, but it was the ones with the cataract weakened eyes that look at me and whisper, "Thank you. I appreciate everything you do for me. I feel so bad you girls have no help." That keeps me coming back. I am caring for broken people when I am broken myself. Doing this hard work for 42 years has taken a toll on my body, especially my back. I cannot afford proper treatment such as cortisone injections, nor take the time off to plan a surgery. We are underpaid and underappreciated by the company who employs me and by the state I reside in. It is not an exaggeration to say nursing home workers have given their life to this industry. Many have died of COVID or brought COVID home to their family members who have died. Many have car accidents driving to work through storms. The people we care for are important. These people have paved the way for all of us and deserve adequate staffing to meet their daily needs. Our younger generation of workers will not do this backbreaking work for $400 to $500 a week paycheck. They will go to a fast food restaurant, grocery stores, or a new Amazon warehouse to do less work for more money. I urge the state of Connecticut, one of the richest states in the country, to take a look at the nursing home communities and their staff. I am asking that the state to show its nursing home residents a little of the same love that the caregivers have shown this helpless community. Please enforce staffing levels and continue to fund the industry so we can hire and keep more dedicated staff. For today, this is their sick pillow, but tomorrow it could be yours or your loved ones. Thank you very much for your time.
Thank you, Ms. Bellin, for your time and your passionate testimony. I'm gonna call on Ann Partridge. I don't see her here, but I'm hoping that maybe she jumped on. Ann, are you there? If not, I will move on to number 83, Michael Sundberg.
Are we going with me or are we waiting on Ann?
The floor is yours, sir.
All right, thank you. Good evening, senators, representatives, and members of the committee. My name is Mike Sundberg. I'm a PCA from Bristol. I've worked as a PCA for 1 year. I have 3 jobs and 2 consumers, my brother and my significant other. And it means a lot to care for someone and to see that care improve their lives. My significant other, I helped her get unconserved, find work, and she's moving forward. She had an acquired brain injury. She had a stroke back in 2015. As a PCA, I tend to my consumers' hygiene, cook their meals, or gourmet meals, as she calls them, help them exercise, and help keep their places clean, but I do much more for them too. I'm also their bodyguard, bookkeeper, scheduler, and best friend. Now, the pay is currently $16.25 an hour. That was probably good about 4 years ago, but we're asking for $20 an hour. Most jobs pay more, but $20 an hour in today's society, especially with all the increases, is the right amount to create like a firm foot to a better future. But the pay never raises to match the costs we incur on a daily basis. For an example, $550. That's what I bring home each week after taxes. It's not a fair wage to handle an unfair society. Even a small wage, like a 50 cents or $1 without benefits, insurance, or anything like that, will still be in a worse position 3 years down the road than we are in today, and it won't keep up with inflation. During our day-to-day routine, we care for individuals in the comfort of their own home, which means we are introducing ourselves to foreign microorganisms. If you can't tell, I'm already stuffy, so I already have some microorganisms, and are much more susceptible to falling ill. Currently, PCAs have no health insurance, which is completely unacceptable. Healthcare is a must, whether it's used or not, because it's a sense of security should anything unforeseen happen at the wrong place in the wrong time. But the key thing here is affordable healthcare, not like $800 a week, which I've seen in some places. I have no health insurance. I'm currently one of the individuals dodging a $3,000 debt from a hernia surgery I needed. I get daily emails and I get bills in the mail, and that goes straight in the garbage. Things happen, people get sick, or we need a break, but we currently have no sick time or any paid time off. Unpaid time off is unsafe in this field, because if I'm sick like I am and I don't have paid sick time, I'm more apt to make stupid, unprofessional decisions, compromising my health and my clients by arriving to work when I should have stayed home, because I can't call my billing collectors and ask them for a break because they won't give it to me because I can't go to work. So keep in mind, PCAs are the people, for a short example, your mother. You were born, they took care of you until you were good to go on your own. And sometimes bad stuff happens and it's time for them to be taken care of, but you can't do it. That's what us PCAs do. We give them the care and love they showed you when you were born. Please do the right thing by PCAs and the consumers we care for, and allocate the funding to provide PCAs a livable wage and quality benefits. Thank you all for your time.
Thank you, Michael, for your testimony. We'll now call on number 84, Karen Siegel.
Good evening, esteemed members of the Appropriations Committee. My name is Karen Siegel, and I serve as Policy Director for Health Equity Solutions. We're a nonprofit organization with a statewide focus on promoting policies, programs, and practices that result in equitable healthcare access, delivery, and outcomes for all people in Connecticut. Thank you for the opportunity to testify on the governor's proposed budget for the Department of Social Services. I'm going to just quickly summarize our written testimony. First, I wanted to note that Connecticut's health insurance landscape is growing increasingly complex, and tens of thousands and perhaps closer to hundreds of thousands are at risk of becoming uninsured when the federal declaration of a public health emergency ends and Medicaid redeterminations begin. Funding trusted messengers to connect people to care and prevent loss of insurance and gaps in care would be a really important investment during this transition period. New programs created to provide affordable coverage for more residents, like Covered Connecticut and Husky Access for a limited subset of undocumented immigrants, are really important steps towards addressing the deep inequities in insurance coverage that remain in our state. But for those who remain eligible for Husky or become eligible for Covered Connecticut in the months ahead, the process for remaining enrolled in health insurance or switching to a new plan can be very confusing. And those who do successfully enroll in a program or remain insured, whether it's covered CT or a qualified health plan, will experience changes in the covered benefits and provider networks. And they may be unaware that Covered Connecticut will provide Husky dental and transportation benefits. These programs are so important, but they will only have their intended impact if people are able to enroll in and use them. To ensure that people remain insured, enroll in new programs, and can use that health insurance, we strongly urge you to fund community-based health insurance navigator supports. Second, I wanted to note that ensuring access to health insurance for all immigrants living in Connecticut is a key part of advancing health equity in our state. Despite the important steps taken last year, many immigrants remain both ineligible for Medicaid and unable to purchase health insurance, and this contributes to inequities in health insurance coverage. Next, I wanted to note that many residents remain without options for insurance that they can afford to both enroll in and use. Just for example, a family of 4 covering only 2 adults, just above the eligibility limit for covered CT, would spend about $14,300 in premiums, deductibles, and cost sharing if they needed to use their insurance. That's 26% of the family's annual income. And finally, I wanted to note HES's strong support for increases in Husky adult dental and endodontic provider rates, and recommend aligning adult and child dental rates in Husky to increase access and address inequities in oral health care. Thank you all very much for your time. I'm happy to take any questions at any time. You all have my contact information. Thank you.
Thank you, Karen, for joining us this evening. Just a reminder for folks who are just letting the room to testify. Last 15 seconds, I will show my hand 3 times. That just lets you have time to summarize in case you need it. Next, and I hope I don't butcher this, it's Tracy Wadich.
Close, Wodach, thank you. Senator Austin, Representative Walker, and distinguished members of the Appropriations Committee, my name is Tracy Wodach, President and CEO of the Connecticut Association for Healthcare at Home. I am also an RN with nearly 40 years experience. The Connecticut Association for Healthcare at Home is the united voice for our licensed home health and hospice agencies, as well as several non-medical homemaker companion agencies. Together, our members provide services that foster cost-effective home care for Connecticut's Medicaid population in the setting they prefer most, their own homes. I'm testifying before you this evening to ask for additional funding in the state budget to focus on both immediate workforce development as well as long-term commitment to agencies who provide home and community-based care in our ever-growing aging state. Our providers have a unique role in healthcare as they do not work in institutions. They go into people's homes alone, not knowing what is behind closed doors. They face multiple risks regularly, including drugs, guns, abuse, neglect, and yes, COVID, where many family members may choose not to mask up. Yet in 2017, the add-on rates to help mitigate some of these risks were eliminated. In addition, in 2016, the home health behavioral health medication administration rate was cut by 15%. The recent ARPA funding made available to both home health and non-medical home care is genuinely welcomed, yet doesn't begin to make up for 15 years of flat funding, combined with added COVID costs and inflationary impact. Of course, it didn't help that our institutional providers, hospitals, and nursing homes received additional funding long before we did, which put us at a significant competitive disadvantage. During the pandemic, our providers have lost up to 20% of our staff to those providers who were able to offer far more competitive wages. Regarding complex care services for the medically fragile living in the community, last year's budget added a 1.7% increase for pediatric complex care. And the ARPA funding added another 30% for the same age group. This created a 27.2% gap in this vital level of care between the age group of 0 to 18 and the adults 19 and older. These are cases requiring the same staff and the same care. Why discriminate when a person turns 19 in the community, yet still requires the same care when they were 18. The overall result of these cuts, lack of adequate funding and disparities, greatly reduced staffing, resulting in fewer Medicaid cases served in the community, less revenue for the providers, keeping them from hiring and retaining staff, and higher costs of care for the state, a vicious, unnecessary cycle. Additionally, with the growing needs of the community, social workers serve a key role with the home health agency as they assist patients with community resources, including Medicaid, waiver services, mental health challenges, psychosocial emotional needs of those with serious illness. But Medicaid doesn't pay for social work. Our specific asks: consistent annual provider rate increases, a 10.5% increase to behavioral health, a 27.2% increase for adult complex care to make it equitable with 31.7% peds, reinstate the add-on rates, and develop a Medicaid social work rate. Thank you so much.
Thank you, Ms. Wodach. We really appreciate it. Next, 1 second. Well, I see Mr. O'Day. Are you there? Mr. James O'Day, number 89.
Thank you, Representative. Can you hear me?
Yes, we can.
Terrific, thank you. So good afternoon, Representative and Senator Austin, Representative Walker, Senator Minor, Representative France, and members of the Appropriations Committee. I'm Dr. Jim O'Day. I'm the Senior Vice President of the Behavioral Health Network of Hartford Healthcare. I've both practiced and been a leader in behavioral health services in the state of Connecticut for over 30 years. So first, I want to thank the governor and this legislature for its commitment to improving mental health care and behavioral health care in general in the state of Connecticut. The governor's proposal clearly begins to address the chronic and persistent underfunding of behavioral health that we've heard about in the testimonies tonight, which has of course been exacerbated by the stress and strain caused by the pandemic. I want to emphasize, though, that improving mental health care really greatly contributes overall to physical health care. It's well established that investments in behavioral health yield significant savings in overall healthcare spending for the state of Connecticut. So, for example, patients with diabetes with insufficiently treated depression cost far more to the state of Connecticut than patients with similar conditions without a psychiatric condition. So by appropriately funding behavioral health care, we avoid so many other downstream costs. So these examples span the healthcare spectrum, not just for, say, patients with diabetes, but across the healthcare spectrum: cardiovascular conditions, pulmonary conditions, health conditions of all types. Our state is in a position right now to fully recognize that behavioral health should actually be seen as a smart investment, not as an expense. Sustained operational investment best serves our patients over the lifespan and is essential to a long-term strategy for our citizens as well as for the state. Patients with mental health conditions deserve access to care in the same way that we provide care for all other health conditions. So more specifically, we applaud the current proposals. The funding of the Wells Research Collaborative Care Code model is an excellent example. The vast majority of psychiatric medications in this country are actually prescribed by primary care docs, not by psychiatrists. But unfortunately, due to the kind of limited training primary care docs receive in psychiatry, they don't really optimize the use of these medication approaches. The Collaborative Care Code model allows for effective psychiatric consultations to provide better diagnostic care, optimization of treatment, and it's really the most important access point for the majority of people who could receive behavioral health care. There's over 90 peer-reviewed articles that demonstrate that this is effective. It's been approved by Medicare, and it's also been approved by 20 other states in the country. Let's have Connecticut join that group. As the legislature continues to look at different proposals, we want to emphasize the need for continued commitment to existing programs. We suggest that the investments in multiple urgent care psychiatric settings in a variety of places around the state, frankly, would be better positioned for rate increases to existing proposed programs that we have right now. So thank you for the 15-minute warning, and thank you for the consideration of these comments. Thank you very much.
Thank you for joining us, and thank you for your testimony. I don't see 90 in the room, so I will call on 91, Marissa Jones. Good evening.
Good evening, Senator Austin, Representative Felipe, and members of the Appropriation Committee. My name is Marissa Jones, and I am the Executive Director at Parkway Pavilion Health and Rehab Center in Enfield, Connecticut, and a proud member of the Connecticut Association of Healthcare Facilities. Thank you for allowing me to speak tonight. I'm going to try to be brief because I know you have a lot of other people to listen to. We are now 2 years into this unrelenting COVID-19 pandemic and continue to be challenged like no other time in the history of providing services. I've been in the industry for a little over 11 years, and this is like no other. Despite the ongoing challenges, I can confidently say that our team at Parkway Pavilion is as determined as ever. Our residents and staff have experienced and dealt with nearly every feature of the pandemic from the very beginning, when the virus was misunderstood and was spreading through people with no symptoms whatsoever, to the most recent Omicron outbreak that's been experienced in just about every Connecticut nursing home. We saw firsthand the consequences of not having adequate testing initially, the extreme shortages of PPE, and the ever-changing guidance that evolved over time as the virus became better understood. Above and beyond all of these challenges, the biggest consequence we've encountered thus far with the pandemic is the severe staffing shortages. This side effect is far and above the most significant challenge we're dealing with at this stage, and it's proving difficult to overcome despite consistent and ongoing efforts to recruit. I'm sure anybody in the industry will let you know that we're all struggling and vying for that same pool, and it just doesn't seem to be enough. Our nursing homes' labor-related costs began an unprecedented and dramatic rise last fall and are showing no sign of relenting. This is a direct result of our team having no choice but to turn to the staffing agencies to help our staff in the building to ensure our residents get the care they deserve. I'm a strong believer in making sure that this vulnerable population is well cared for, and in order to do that, we need to have enough bodies in the building to provide that care. From a patient care perspective, it runs counter to our consistent assignment that has been a longstanding practice. Our residents may see different staff, day after day, week after week, which as we all know or should know, that it's not really best for the continuity of care. But like many other nursing homes, we've had no other option, and the financial consequences have been enormous. We're seeing unbelievable spikes in the cost of staffing agencies. For example, many staffing agencies will upcharge for the hard to fill shifts, whether it be weekends or evening shifts. And many of those agency staff will not pick up unless they're getting additional incentives above and beyond their already exorbitant pay rates. We understand that the Connecticut Attorney General is reviewing these pricing practices, and we believe Connecticut should pass legislation that caps these abnormal and harmful fees. Before closing, I must thank the state legislature for the tremendous support we've received that's provided additional support for our employees and stability during this difficult period. Our nursing home faithfully implemented the 4.5% employee wage enhancement adopted last session, but more help is needed to further bolster employee wages and benefits. You've heard firsthand from a lot of our frontline employees throughout the industry, and we really need to support them. An additional financial rate relief is needed to address the extraordinarily increased labor costs now being experienced and not reflected in any of the prior support we've received.
Ms. Jones, you can please summarize.
What was that?
If you could please summarize, your 3 minutes are up.
Yep. Please help us deliver the high quality care we're committed to delivering by supporting additional funding to our nursing homes. On behalf of everyone at Parkway Pavilion, thank you for your time and consideration.
Thank you. You finished with a flourish. Susan Catal, is that?
My name is Susie Catali of Estonia, Connecticut. I work part-time at 2 independent living centers. These centers for Disability Wise in West Haven and Access Independent in Stratford. I'm here today to ask the state of Connecticut to increase state funding to the independent living centers by $1 million. Excuse me. At both independent living centers, I was hired as the debt services applicant. The services we provide enable consumers to achieve their goals by access the resources they need and to advocate for accessible communication. Independent skills training enables consumers to use technology. During the pandemic, when the office was closed, I continued to work from home. I used video phone to allow me to communicate with consumers while connecting them to service by computer. This is very challenging. However, the independent living centers are creative and responsive, and we continue to provide our services. I'm also deaf, and by experience, I understand the culture and the community as a deaf person. I experience the same barriers and share the same frustration. My interest is to help others because I understand how difficult it can be for people who are deaf or hard of hearing to access services and get the help they need. Without the independent living centers, many people with hearing loss would be lost and confused. Please fund the independent living centers with the $1 million increase so they can continue to provide services to all people with a disability so they can live and thrive in their community. Thank you.
Thank you, Ms. Catali, and great job. Next is 93, Christy Doherty.
Are you there?
Yes, we can hear you.
Okay, looks like my Zoom is not working. Good evening to all the members of the Appropriation Committee. My name is Christy Doherty, and I'm the administrator at Vernon Manor Healthcare Center in Vernon, Connecticut. Vernon Manor has been providing nursing home care in our community for over 45 years. We are a 120-bed family-owned and operated nursing home, employing 140 staff members from our surrounding communities. Throughout the testimony presented, you have heard how residents and staff have experienced and dealt with nearly every feature of the pandemic from the beginning of the spring of 2020, when the misunderstood virus spread at an unprecedented speed with high rates of nursing home outbreaks. You saw firsthand the consequences of a lack of COVID-19 testing, the extreme shortages of PPE, staff fatigue, and the ever-changing CDC, CMS, and DPH guidelines. We have witnessed the severe and emotionally devastating impact the imposed visitors restriction had on our residents, sadness, depression, a sense of loss, and the sense of duty the staff felt as they tried to fill the void brought on by those restrictions. The severe staffing shortages of our nursing home is facing now is the most significant challenges we are dealing with at this stage of the pandemic. The shortage is so profound we have not been able to accommodate admissions from the hospital, affecting revenue. The inability to accept that the nursing home level of care impacts hospitals, as beds are then not available to those in need. The need to outsource staffing to nursing agencies was a decision made from necessity and not by choice. Residents feel secure when there is consistent and stable staff. The use of agency is neither consistent nor stable. Agency staff are unfamiliar with the residents' needs. Those subtle needs, such as when a stick of gum provides relief from restlessness in a resident with dementia who is not able to express themselves. They are not familiar with the facility and policies, and the ability to provide that follow-up to care needs is almost impossible. The cost of nursing agency is financially draining to the facility. The healthcare booster mandate going into effect in March of 2022 is going to further the staffing crises. Our facility is doing its best to plan for the removal of those staff members as they are
recording in
operating
progress.
the facility
Yes,
rather
sir.
than receive a booster. We are doing our best to plan. However, the already stressed staff will be required to do more as our residents still need their care and services regardless of staffing. Before closing, I would like to thank the state legislature for the tremendous support we have received. Our nursing home is applying the 4.5% employee wage enhancements and additional health care and pension benefits adopted last session, all of which are critically important employee recruitment and retention. But we need more to help further strengthen the employee wages and benefit, as well as financial rate relief to address the noted increased labor costs we are now experiencing. Thank you so much for your time and attention.
Thank you, Ms. Doherty. We now have Dr. Thomas Farquhar.
Good evening, Senator Austin, Representative Walker, Senator Minor, Representative France, and members of the committee. My name's Dr. Thomas Farquhar. I'm the Vice President and Legislative Chair of the Radiological Society of Connecticut, which is our state chapter of the National American College of Radiology. I'm a practicing physician in Central Connecticut and Hartford. And on behalf of our society, I wanted to make a few brief comments on the Department of Public Health portion of House Bill 5037. So members of the Radiological Society of Connecticut were actively participated in the breast health and breast cancer screening work group that had been established by Section 14 of Public Act 2135. Representative Gilchrist, thank you, Representative, served as the chair of the group, which met several times in recent months, and their recommendations have been forwarded to the Public Health Committee for review. One key component of this effort to detect both breast cancer and cervical cancer as early as possible is the state's breast and cervical cancer early detection and treatment referral program that's administered by the Department of Public Health. Essentially, this program endeavors to provide mammograms to women who otherwise would not be able to receive care, either because they lack insurance or other financial barriers. The program is funded at $2.1 million through receipts from insurers. DPH estimates that there are about 38,000 women in Connecticut who need this type of assistance that's provided by the program. In fiscal year 2021, 4,200 women were served. So clearly there's a significant gap between the current success of the program and the true need in the underserved community. We believe that increased funding for the breast and cervical cancer early detection and treatment referral program will help to address well-known health inequities, which in this context manifest as lower screening mammography rates for women of color. So the Public Health Committee has raised a bill covering the working group's recommendations that's likely to come before your committee for funding. And we will hope that you would support this by allocating general fund dollars in addition to the existing funding to increase the funding for the breast and cervical cancer early detection and treatment referral program. And in doing so, we'll be able to screen more women for breast cancer, detect it earlier when it's easier and more successfully treated. And I thank you for your time and attention.
Thank you for joining us tonight, Doctor. Next, we have number 95, Mark Anthony Gallucci.
Good evening. Can you hear me?
Yes, sir, we can. You may proceed.
Okay. Thank you. Good evening, distinguished members of the subcommittee, the Human Services Subcommittee, the Appropriation Committee. I'm testifying today in support of a request of Connecticut's 5 Centers for Independent Living for an additional $1 million in funding to meet the unmet needs of Connecticut adults and children with disabilities. No doubt you hear from many folks telling you tonight about the history of CILs and the funding and how it became diminished. It's not my purpose here to reiterate all of that, and some of you are quite familiar with it. Rather, I wish to educate you on the impact of this lack of funding. During this COVID-19 pandemic, many people with disabilities, and especially children with disabilities and students with disabilities, have been especially hard hit. They've been isolated, they've lost access to many of the services and activities that they had and they need, and are in desperate need for services to restore some normalcy to their lives. I note that there have been news reports that this very legislature recognizes this and is looking for ways to increase funding to address mental health issues and need for recreational and social skills development and opportunities to end isolation. Why not fund Connecticut's Centers for Independent Living so they can be part of this response? Years ago, we had assistive technology funded and a full-time assistive technologist on staff at each center. The AT staff would assist consumers to explore technological options to problems created by the disability or obstacles in the environment. The AT specialists would assist them with obtaining financial assistance to obtain technology and the training to use it. More recently, we had a small amount of funding through the CARES Act to assist people to obtain devices, training, and broadband services so they could access services such as telemedicine, counseling services, grocery shopping, etc. But this abruptly came to an end in May of this year. As a result, we have scores of individuals on a list just at my center alone who will now never be served. Undoubtedly, there are hundreds more who could benefit. Why not increase funding for centers for independent living so they can hire AT specialists and reestablish these desperately needed services? Massachusetts has these AT specialists, so does New York. Our summer youth self-empowerment empowerment camps, which are funded entirely with money we raised through a fundraising event, have experienced an unprecedented number of inquiries from parents and educators who want to apply for the very limited number of spaces we have. We're hearing over and over again how students and children with disabilities cannot find appropriate summer camp learning experiences and recreation opportunities that will accommodate their special needs. Why not increase the funding for centers for independent living so that they can expand existing programs or develop new ones to address this issue? In fact, in Massachusetts, CALs, they'll not only get more funding than Connecticut still, they got $550,000, but they also get $125,000 for youth programs. Don't you think it's a good idea now that the state is out of fiscal distress that the General Assembly restore the lost capacity of centers for independent living by increasing the funding to address mental health and isolation problems experienced by citizens with disabilities? Thank you.
Thank you, Mr. Gallucci. 1 second for a bit of housekeeping. Just panelists, please make sure that you keep your phones and computers muted while others are speaking. And I'd like to give Taylor Hyde a moment to identify a phone number.
Thank you, Representative. Well, the owner of it says Galaxy S21 5G. I see your hand is raised. If you could just identify yourself so we can make sure that we get you on the list. Want to let us know who you are? If you're on a phone, you'll have to press *6 to unmute yourself. *6. Alrighty.
Okay.
Thank you.
We're now going to move on to number 96, Kiana Ricketts.
Good evening. Good evening, Senators Osteen, Representative Walker, and members of the committee. My name is Kiana Ricketts, and I'm a personal care attendant living in Manchester. I have been working for the last 13 years as a PCA, and I love the work that I do. I provide mobile assistance, ADLs, run errands, grocery shopping, help during the medical appointments, and lots of other things. During this COVID, I love taking care of other people. Caregiving is my calling, and one day I would like to become a nurse. While I am proud of what I do, is so frustrating being called as essential frontline worker when we are paid like we are expendable. Throughout the pandemic, PCAs like myself were called heroes, yet we can't get the state to lift a finger to give us wages we could survive on and benefits that allow us to save for our futures. Is that how Connecticut treats heroes? Is that what heroes deserve? Recently, I've been sick. Thankfully, I tested negative for COVID. The cough and the fatigue have stuck around. I don't have paid time off, and I worry about what will happen if I get sick and have to go without pay. I can't afford to take any time off. I take the bus to get to work, but I hate taking the bus because I like being punctual and it's important to me. On the bus, sometimes the other person has control over whether I'm late or not. That takes time away from my paycheck. So getting a driver's license, but since every penny goes to paying my bills, I don't know how I'm gonna save up enough to get a license. Right now, I don't receive time off. So there are times I can't go to the doctors for checkups because I have to work. I only get part-time hours because if I make too much, I lose my health insurance from the state. But then if I don't use them, I still lose my health insurance. It hurts because it hurts to be told I make too much money to qualify for food stamps, but then I can't afford to buy food because Ally hasn't paid me on time. But I'll spare you on the details about Ally. I can imagine a future where maybe working one job is just enough, where we don't have to worry that our electricity gets cut off or sick and we can't save up the money that we need to make our lives better with the basics, transportations, healthcare, staying home when we're sick. Please do the right thing and fully fund home care services. Thank you for your time.
Thank you, Ms. Ricketts. Next is 97, Lucia Nunez.
Yes, good evening.
Good evening.
Yeah. Good evening, Senator Austin and Representative Work.
Are you there?
Yes, and I appreciate personal care attendant from East Hartford. I immigrated from the Dominican Republic about 40 years ago, and in search of the American dream, like many other PCA, is my passion to help out. Hold on a second. Let me see if this my glasses help. I've been crazy. American Dream, like many other PCA, is my passion to help the most vulnerable people live independently and maintain their dignity at home. Every human being deserves to live with dignity and thankful. And I am thankful to do work to allow me to live my passion as daily basis. Despite all we give, PCA can live with dignity. We pay through the state of Connecticut because our client quality for Medicaid, but we make so little that I work 3 jobs, nearly 70 hours. It should say about 70 hours a week. It been working for this pace for the past 20 years. I actually used to work 90 hours a week, and I've scaled back a little. Even though I work an equivalent of 2 full-time jobs, the state of Connecticut provides no health insurance and no sick time, and no retirement security to PCA like me. In August, my car was totally in an accident that was the fault of the other driver. I was disoriented and I had to be taken to the emergency room. But without health insurance, I could only hope that my car insurance pay for my bills.
Ms. Nunez, if you please summarize.
Well, on August, I was in a car accident and I just took, I would have been in big trouble if I wouldn't have a car insurance. The point is that my car insurance is worse than my body, than me. So it is it is not right for us to be working, especially me working over 70 hours and not have a health insurance. That should be something that everyone should have. Is the right of human being to have at least health insurance or affordable health insurance. It is, to me, I'm very disappointed that we're living in one of the richest states of the United States, and we cannot afford health insurance. We had no benefit. We had no benefit. We had no sick time. And when I was into the accident, I just rest for 1 weekend. And me in pain and sore, I had to go back to work on Monday. So I guess that something should be done about it. I'm not asking the government to give me anything for free.
Ma'am, can you please summarize in 1 sentence or less to finish your testimony?
To finish my testimony, well, PCA deserve better, and we're working, so we should be entitled to have benefit like sick time, health benefits, health insurance, and all basic need for human beings.
Thank you.
You're welcome.
We appreciate your testimony. Before we get to number 98, I'd like to turn it over to Rep. Curry from East Hartford.
Good evening, everyone. Nice to be with you today or tonight. Number 98, we have Marlene Ciccarelli. Good evening.
Hi, good evening. My name is Marlene Ciccarella. I am chair of the HCAOA Connecticut DSS Medicaid Committee and managing partner of B&M Homemaking Companion Services. We're a non-medical home care agency providing homemaking companion and PCA services throughout New Haven County. I'm here today representing the Home Care of America, of Association of America of Connecticut, and the testimony submitted. I want to thank you first for your hard work and for giving me the opportunity to speak today. In reference to House Bill 5037 and the state budget and its impacts to home care agencies. I spoke last month in front of the Appropriations and Human Resource Committees, and I explained the importance of the approval for the funding a plan to sustain the billing rates and the need for a process to ensure that any future expenses could be addressed. Today, I want to speak to the urgency and impact if the funding is not approved by the end of March. All of these funds are of great value, but not enough for the agencies to continue providing essential services. Agencies will be forced to make decisions to stop providing some services or close their doors altogether on or around the end of March, based on the decisions. This will have a critical impact to many elderly and disabled clients and their caregivers. There are well over 100 agencies like mine that care for thousands of clients and thousands of caregivers that make minimum wage or above. A 1.7% increase has been approved, but not yet released by DSS to providers. We're also waiting for the approval of the ARPA funds in order for our agencies to remain viable and continue to provide services, and we're at risk of losing the 10% federal match if the approval is not submitted by March 31st. I ask you to think about your parent, your grandparent, disabled family member, and what would happen if they didn't have the caregivers to care for them. I don't have to go into detail. You've been listening to all of the PCAs provide all of their testimony and how important their role is. Family members depend on us so that they can continue working, so that they can take care of their immediate families. I'd also like to ask you to understand the position I will be in if I have to tell my staff and my clients that I can no longer afford to provide these needed services and provide needed employment for so many. The governor has commented that the need for home-based services will increase, especially after the issues incurred by COVID-19. The benefit of agencies like mine allows the state to save taxpayer dollars per $450 million per year and keeps individuals in their home much longer, which is where they want to be, home with their families, so they can visit and enjoy time at home. We strongly support the minimum wage increase, and we're also looking for a fair billing rate that will be sustained.
Marlene, if you wouldn't mind just summarizing.
Sure. I'm asking that the promised 1.7% increase in reimbursement rates be put into effect immediately. I'm asking that the promised ARPA funding be put in place by March 31st so we can remain viable and so the state doesn't lose its 10% matching federal funds. As of July, the minimum wage will increase to $14. At that point, we will be paying out more in expenses than I will be allowed to bill. I thank you for your time.
Thank you very much for your testimony.
Thank you.
Next up, we have Heather Victoria. Good evening, Heather.
Good evening, members of the committee. My name is Heather Victoria, and I am the Intensive Services Division Director with United Services. United Services is the Community Behavioral Health Center for 21 towns in Northeastern Connecticut. We are a nonprofit organization providing more than 30 programs to our community, including outpatient mental health, substance abuse treatment, family programs, and crisis services. I oversee the domestic violence program, which includes 2 emergency shelters, the Young Adult Services Program, and the Milner House Medicaid Rehab Option Group Home. I want to thank you for the 4% cost of living adjustment for community nonprofits that you fought to include in last year's budget. I'm here today to ask you to honor the long-term plan to address underfunding of community nonprofits and fund services by $461 million over 5 years, including 8% in this budget year. United Services, along with CCDV, is also requesting $1.4 million in annual state funding to cover the cost of 1 full-time child and family advocate at each of the state's 18 domestic violence service organizations. There is currently no state funding to support this critical position to work with children exposed to domestic violence, something that unfortunately has only increased during the pandemic. We currently receive only enough federal pass-through funding for 1/4 of a full-time position, which is not nearly enough time to adequately meet the needs of these children. Experiencing domestic violence in the home is a traumatic experience for children, but one that does not have to define their lives. With the proper evidence and strengths-based services provided by child and family advocates, it is something that we can overcome to create positive generational change. The demand for other United Services programs has never been higher. Our staff have now been working for 2 years with a community in crisis, and the impacts of the pandemic on mental health cannot be overstated. As an agency, we are currently operating at about 25% vacancy rate, and low wages are the major cause. Vacancies are taking a toll on our remaining staff, which of course impacts clients. I currently have staff who are frozen in on a weekly basis because they are covering for vacancies that we have been unable to hire for due to low wages. This adds more stress to an already stressful job. We urge the Appropriations Committee to fight for funding for these programs by implementing the 8% funding increase. In addition, our request of $1.4 million is a very small investment, but one that can have a tremendous impact. We urge you to invest in the future for children experiencing domestic violence. Thank you for your time.
Thank you very much, Heather. Have a good evening.
Thank you.
Next up, we have hit triple digits, 100 with Penny Lore. Good evening. Oh, you're muted.
Hello.
Hi.
Good evening, distinguished members of the Appropriations Subcommittee. Thank you for the opportunity to offer testimony on the Department of Social Services budget related to residential care home funding. My name is Penny Laurie, and I am the administrator for Parsonage Cottage Senior Residence in Greenwich, Connecticut. Our population is the frail elderly who may not need skilled nursing services, but can no longer live independently at home. Most of our residents are funded through the state. Last year's biennium budget included a transfer of some residential care home spending to Medicaid. The shift was done to save the state money and provide residential care homes with much needed resources. The plan is for residential care homes to become Medicaid billers beginning April 1, 2022. Our association has had several meetings with DSS to discuss and facilitate the Medicaid billing plan. To date, there is no operational plan in place. These funds are critically important to our homes and employees who've been counting on the increased revenue to deal with the impact of the pandemic. We would urge the Appropriations Committee to ensure these dollars go to increasing residential care home rates. We value our employees who deserve so much more for the work they do. Their dedication is exceptional, while their compensation is minimal. Unfortunately, paying employee wages to attract new people to our industry is difficult, resulting in high employee turnover. Continuity of care is essential for better long-term health outcomes and aging in place. This can also prolong or prevent admission to a nursing home, saving the state at least half of the cost of a skilled facility. Due to the pandemic, all facility costs increased immensely. And unlike other providers during this time, we did not see any federal funding to support our work or employees. We've had to survive with rates failing to keep up with increased expenses. The governor's proposal to enable residential care homes to bill Medicaid acknowledges the need for higher rates. We provide a critical service to the state, and we do this for a low cost. Please support residential care home funding so that we can retain our dedicated employees and pay them fair wages as they care for the most vulnerable in the state. Thank you.
Thank you so much, Penny. Have a great night.
Thank you.
Next up, we have 101, Gary Allen. Good evening, Gary.
Hi, how are you?
I am well.
Okay, so I just want to thank the Appropriations Committee for hearing us today, taking the time. Hello, my name is Gary Allen. I work for Independence Northwest Incorporated, one of the 5 centers for independent living in Connecticut. I work as an advocate and information and referral specialist. Centers for Independent Living, CILs, are non-residential cross-disability community-based non-profit organizations. They are designed and run by people with disabilities to help other people with disabilities live independently. CILs are unique is that they are operated according to a strict philosophy of consumer control, where people with all types of disabilities directly govern and staff the organization. Centers for Independent Living provide peer support, information and referral services, individual and systems advocacy, independent living services, and transition services. Over the time that I have worked for the Centers for Independent Living, they have been forced to cut services and staff because funding has been reduced over the years. The centers have been asked to do more with less year after year. Especially during a time when Connecticut was experiencing a fiscal shortfall. Connecticut's contribution to the state independent living centers is one of the lowest in the region. It is substantially less than the surrounding states provide. It is important to increase funding in order for the state's independent living centers to provide the essential services that our consumers need in order for them to live independently in the community. Today, we are asking for an increase in funding of $1 million to create a base level of funding for the CILs as recommended by the Connecticut Center for Independent Living. Thank you.
Thank you so much, Gary. We appreciate your testimony. Have a great night.
Yeah, you too.
Next up, we have Lynn Ritchie, 102. No. All right, we'll move on to 103, Andrew Wildman. And Gary, if you'd like to mute yourself also. 104, Christina Katsopoulos.
Hi, everyone. I'm actually going to be speaking on behalf of Anna K. McCullough. She could not make it today to read her testimony due to short staffing at her nursing home facility she works for. So I'm going to go ahead and read her testimony. Good evening, Senators Austin, Representative Walker, and members of the committee. My name is Anna K. McCullough. I am a certified nurse's aide at Chestnut Point in Windsor. I have been employed at my facility for 10 years. I started my career in housekeeping department and advanced to a certified nurse's aide position. I'm here today to ask for help with the ongoing staffing crisis within long-term care. My coworkers and I have seen the staffing issues increase throughout the years. However, the pandemic has escalated our situation beyond words. Prior to COVID, there had not been enough staff, never mind during COVID outbreaks and where we are today. It is disheartening that I chose to advance to become a CNA, but I wanted to help our residents. Our residents in this state deserve quality care. The care that our residents are currently receiving is far from quality. A typical day consists of assisting with washing, bathing, grooming, dressing, toileting, and serving meals of which many cannot eat without being fed. Things that we all take for granted in our lives because we are able to do them for ourselves. My residents need extensive care. The residents we care for today are not the same kind that we cared for 10 or 20 years ago. Today, patients are being released early from hospitals due to overflow. These patients need more extensive monitoring and rehabilitation. We are dealing with substance abuse and mental illnesses of residents at a much younger age. These residents are so complex and time-consuming because many have behavioral issues. After the first wave of COVID, our census dropped. Elective surgeries were put on hold and families were afraid to send their loved ones to long-term care facilities in fear of never seeing them again. Our company held a massive layoff instead of taking the advice of our union to furlough workers. When hospitals started to reschedule elective surgeries and the company started to accept admissions again, we had limited staff. The workload became unbearable. Workers decided to leave. Those close to retirement retired. Many left to go pursue jobs that were offering more money for less backbreaking work. Instead of recruiting new employees, the company resorted to bringing in pool agency staff. The agency workers are being paid well above our highest paid worker wages. It is a slap in the face to only make $16.50 an hour and hear that these agency workers are being paid $25 to $30 per hour when the company supposedly doesn't have any money. Many of my coworkers, including myself, went to apply at these agency companies in our area. If our company was willing to pay agency workers this type of wages and not their own workers, then why wouldn't we leave? The nursing home facilities in the state need to recruit more permanent help, not only in the nursing department, but in all departments. The only way to do that is to increase wages and benefits and create incentives to do this kind of work. In addition, nursing home operators need to be held accountable for staffing. We are tired of hearing them say there is nothing that we can do.
Christina, would you mind summarizing?
Yeah, last sentence. This cannot continue on with the large population of baby boomers needing care. This situation needs to be dealt with now. Thank you for your time.
Thank you very much. Have a great evening.
You too. Thank you.
And it sounds like we are going back to number 88. We have Kathy Flaherty, I believe, with us.
Thank you so much, Representative Curry and members of the Appropriations Committee. Thanks for taking me out of order. I appreciate it. My name is Kathy Flaherty. I'm the Executive Director of Connecticut Legal Rights Project. You have my written testimony, so I'll just hit on a few things. Very glad to see in this budget proposals to increase funding for Husky Dental. I think we all know oral health is health. And to see additional funding for services for people who are currently on the autism waiver wait list and for home and community-based services. What I'm concerned about is that the use of a lot of these federal funds that are going to run out. A lot of these programs are basic needs programs that we need to figure out as a state how we are going to pay for them sustainably in the long term, especially if we are going to consider things that I think we should consider, like expanding Husky to cover all immigrants regardless of age, and to look at the asset limits and income limits, especially for Husky C, for people with disabilities who are unable to work. And I know that you're also taking a look at Med Connect. I think we need to make sure that the money that we're investing in healthcare, that whatever path that we go down, that we don't emphasize primary care at the expense of the specialized care that many people with disabilities need. And I'm here to ask and join in the ask for additional funding for the independent living centers. You know better than anybody how those organizations have been doing more with less for a really long time. Right now, they only serve people in 27 of Connecticut's 169 cities and towns. We know that this pandemic is a mass disabling event. There are 614,000 people in Connecticut who live with disabilities. And right now, those independent living centers are funded at $1.22 for each of us. Their funding ask would be an additional $1.62 for each one of us, meaning a total of $2.85 for each person with a disability in Connecticut. I think we're worth a cup of coffee. So I'd really encourage you to pay attention to that ask. I will see you again tomorrow. I appreciate you taking me out of order tonight.
Thank you for your advocacy and your Twitter feed, Kathy.
Thanks.
Going back in order, we have 105, Brenda Glazier. All right. 106, William White. Nice to see you, William.
Nice to see you. Thank you for having me. Senator Austin, Representative Walker, Representative Nolan, and members of the Appropriations Committee. My name is Bill White. I'm the administrator and president at Beechwood Post-Acute and Transitional Care in New London, and a board member of the Connecticut Association of Healthcare Facilities. Beechwood has been providing family-owned and operated nursing home care in our community since 1955. We are a 60-bed home. We have nearly 100 employees working with us. I am proud of the work our nursing home has done during the last 2 years, a period unlike any of us have ever known. We have worked as a team to keep our residents and each other safe. We have passed multiple visits by the Department of Public Health without any infection control violations. We established our own booster mandate, requiring all eligible staff receive their COVID booster by 11/30 of 21. 100% of our eligible staff are boosted, with only one staff member now still waiting for their eligibility date. Most of all, we have been blessed to not have a single death from COVID. That effort has not been without significant expense, every bit of which was worth it to keep our Beechwood families safe. We have seen a dramatic reduction in income due to occupancy levels reduced by 20 to 25% over prior years. The severe staffing shortages our nursing home is now facing is far and above the most significant challenge we're dealing with. The shortages are so significant that Beechwood routinely is unable to accommodate admissions from hospitals, as we are not fully able to address the care needs of additional residents without additional staff. Lack of staff is hindering our mission as a good community partner. Consequently, our occupancy is much lower than normal, but the low number is really a distortion caused by staffing shortages and how that impacts admissions. It's not a true reflection of the need or demand for our services, but it is a reality. We fully expect to improve over time as the staffing situation improves, but we're concerned that this will be a slow process as our state and nation recover from the pandemic. Beechwood has been negatively impacted by the staffing shortages in many ways, but the impact of having to turn to nurse and CNA staffing agencies has been particularly troublesome. Using these nurse staffing agencies has been a measure of last resort at our nursing home. The financial consequences have been enormous. We are seeing unbelievable spikes in the cost of staff through these agencies. For example, in the last 6 months, we spent the equivalent of what would have been 2.5 weeks of total payroll for the entire facility on a handful of agency staff in order to staff our building. We ask that you please pass legislation to cap these outrageous fees. Before closing, I want to thank the state legislature for the tremendous support we've received that has provided additional resources for our employees. Our nursing home faithfully implemented the 4.5% employee wage enhancement adopted last session, but more help is needed to address the extraordinary labor challenge that has developed subsequent to that increase. Please help us deliver the care we all want, and please make nursing home funding ever more urgent as you assess this year's budget. On behalf of Beechwood, thank you, and I'd be happy to answer questions if you have them. I know you're trying to move things along.
Thanks, William. We appreciate your testimony. It doesn't appear to be any questions at this time. We're going to go back to 105. Brenda, I see that you're in the room.
Yes, good evening.
Good evening.
Good evening, Senator Austin and Representative Walker and the members of the committee. My name is Brenda Glazier, and I am a PCA from Simsbury. I'm here to ask you to invest in home care services in Connecticut that we as PCAs do not have to live in poverty. I love to work, I love the work I do because I make a positive difference in my consumer's life. The consumer I care for has a traumatic brain injury and has lived in my home since 2016. I'm essentially a round-the-clock caregiver. I have been without health insurance throughout the bulk of the pandemic. I have looked into private insurance, but I looked into private insurance, but it would cost me $600 to $700 per month. If I purchased that insurance, I'd be living in a tent. I don't qualify for food stamps or any other state assistance because I get paid 40 hours per week, which puts me technically over the poverty level, but still working poor, uninsured, and without any safety net. I got COVID last month, and with the anxiety of worrying about what would happen if I would need emergency medical care was overwhelming. When I was having severe leg pain with COVID, I was worried that it might be another blood clot, which I have experienced in the past. I made a plan that if I needed care, I would have to call 911 because that would be my only option not to get denied if I was having an emergency. I'm also on a maintenance medication for a chronic condition and just got a letter from my primary care physician that if I do not come in for an annual physical, she will no longer prescribe my medication. But the physical costs hundreds of dollars, and I can tell you exactly how much I have in my checking account, $1.68. To add insult to injury, in addition, working through COVID with no paid time off, I have been not paid for 3 weeks due to Allied and DSS's delay in the processing of my consumer's paperwork, with no outreach to explain why. Please do what is right by me and my consumer and allocate the funding needed for PCAs to earn a living wage and receive benefits. Thank you very much for your time.
Thank you very much, Brenda, for sharing your story.
Thank you.
Next up, we have 107, Janet Williams. No? I see you on the board, Janet. All right, we'll move on to 108, Frank Fortunati. Good evening, Frank.
Hi, good evening. My name is Frank Fortunati, and I'm testifying on behalf of Yale New Haven Health System. I'm the Deputy Chair of Psychiatry at Yale New Haven Health, the Vice Chief of Psychiatry at Yale New Haven Hospital, the Medical Director of the Yale New Haven Psychiatric Hospital, and I'm also a child and adolescent psychiatrist, and I've been one in Connecticut for approximately 20 years. Emergency departments at our affiliates in Bridgeport, Greenwich, New Haven, and New London, and hospitals across the state and country are filled with children and adults in crisis, many of whom are brought to us by their families for psychiatric evaluations. In many cases, these patients don't require an inpatient psychiatric admission, but we're not able to immediately safely discharge them home due to a lack of appropriate and immediately available outpatient services. This results in children and adults remaining in our emergency departments for days and sometimes weeks until appropriate services are secured. Of course, many who come to our emergency departments do require an inpatient psychiatric admission, and they too often spend days in our emergency department waiting until an inpatient bed becomes available. Often beds are not immediately available because others on our inpatient units are awaiting another lower level of care, such as a psychiatric residential treatment facility, which is scarce in Connecticut, particularly for children 12 and under, or intensive outpatient services. I'd like to provide a snapshot for you. On Monday, this past Monday, across the Yale New Haven Health System, there were 86 children, adolescents, and adults in our emergency departments receiving psychiatric care or there for psychiatric evaluation. 61 of them were at Yale New Haven Hospital. Of all of those patients, of the 86, 15 were children, 18 and younger. 18 were young adults, 19 through 27, and 53 were 28 and older. And of the 86 in New Haven, 32 were waiting in inpatient psychiatric bed, while another 16 patients were on a medical floor waiting for a psychiatric bed. And in our outpatient programs, we had 110 children waiting for assessment in our outpatient services and 40 waiting for in-home services. In November, I presented at Speaker Ritter's Children's Behavioral Health Forum, and on that day, there were 77 children 18 and under in our psychiatric beds, with another 28 in our emergency departments. 14 of them were waiting for an inpatient bed. Children and adults are lingering in our emergency inpatient and inpatient medical settings, waiting for the next appropriate level of care, and we need your help. The governor has proposed $159 million in behavioral health services, including $26.4 million for the expansion of adult and children's emergency mobile psychiatric services. Yale New Haven Health joins the Connecticut Hospital Association in urging these resources be directed to peak demand times and locations rather than programming services 24/7 on a statewide basis.
Frank, if you wouldn't mind just summarizing for us?
Yale New Haven Health also supports, as Hartford Health did, the psychiatric collaborative care management and reimbursement for that for Medicaid. And the governor's allocated $26 million for new levels of behavioral health care, including crisis stabilization. We urge you to invest in existing inpatient and outpatient levels of care to address the significant wait time for children and families. And finally, as a summary, to invest additional resources, including Medicaid rate increases for community and hospital-based outpatient services to address the current needs. Thank you very much.
Thank you, Frank. Have a good evening. We're going to go back to 105. Brenda, I see you there. You want to just unmute yourself? I think is it #6, I believe? No. All right, we will move on. We'll come back if you're still there later. 107, or excuse me, 109, Linda Alder.
Good evening.
Good evening, Linda.
Good evening, Senator Austin, Representative Walker, Representative Curry, and members of the committee. My name is Linda Alder. I'm a personal care attendant living in New Milford. I come before you today to ask that you properly fund home care services so PCAs like myself can have livable wages and quality benefits. I have been in the medical field in some form or fashion for 32 years, and I've been working as a PCA for 3 years now. I love my job as I'm a natural born caregiver. Most consumers are just people who want to live their lives, but they struggle due to things that are out of their control. Knowing that I can step in with guidance, direction, laughter, smiles, some sweat, and sometimes some tears to enable my client to live independently and have a better quality of life is amazing. Things that we take for granted every day, like putting on our shoes, dressing ourselves. These individuals face those challenges eagerly with a smile as they try to be as independent as possible. That alone puts an exclamation point on how important the services we offer are to this most vulnerable population. What we do is not a privilege for vulnerable people, it is a necessity. Even though I love this work, it is challenging to work this hard for poverty wages. Many PCAs got into this work because we have big hearts and we want to care for others, but we're at a point where we can barely take care of ourselves on these wages. Most of us are working 2 and 3 jobs. We're literally turning into the most vulnerable population, oftentimes having to choose between food and medicine, housing or vehicle, shoes or clothes. It should not be like this. If healthcare workers are supposedly the heroes for the work that we do, then why isn't the money that was earmarked for us being utilized to provide a living wage, health insurance, retirement program, disability insurance, paid sick leave, and paid vacation. With the work we do, paid vacation is just as important as the rest of it so that we can reboot ourselves and be ready. With additional funding for home care services, PCAs could have all of these. Living wages means not choosing between rent and food. Health insurance means we can seek out medical treatment when we need it without risking financial ruin. Paid time off or sick leave means we can take days to care for ourselves without the danger of falling behind on our bills. We aren't asking for a lot. We're asking to be treated with dignity as the professional caregivers we are, treating our consumers with dignity. It's time for the state of Connecticut step up and do what's right by PCAs and consumers that we care for and properly fund home care services. I thank you very much for your time.
Thank you so much, Linda. Have a good evening.
Thank
We're
you.
gonna go back to 107, Janet Williams.
Hello, my name is Janet Williams. I'm a PCA, and I just had the table turned on me as I wrote in my statement. Now, I am the client who needs the care, and to my surprise, there was not any money out there to help to do anything. My insurance I had to get because I passed out in my driveway, end up in the hospital. I have a spinal infection. I stayed in the hospital for a month. Then I ended up in a rehab, and I've been in rehab until January. I came home. But now that I'm home, I'm facing the same problems as my client. Nobody to take care of me, no additional money. I wish you would pass the bill and give us the money for the PCA, because we don't make enough to live on. And we worse than, because we get sick, there's nobody to take care of, no money to take. We have no 401k, so we're the working poor. Hello?
Oh, yeah, you just cut out at the very end.
Oh, I was saying we are the working poor with no means of taking care of ourselves. So I know we need that extra increase in order to have insurance, 401k, paid vacation, and more wages, because now that I am sick, I can hardly afford to pay my bills. Thank God I have good family. If I didn't have that, I would be under the train station sleeping, because I would have no place to go. And nobody should work this hard all their life and still be the working poor when they get sick and nothing to look forward to. So I'm asking if you guys could consider our position when the table is turned, what happens to us? Thank you.
Thank you, Janet, and wishing you well on your health journey.
Thank you.
We're gonna go back to 105. Brenda, I saw you unmute yourself at one point. Are you able to do that again? Oh, there you go. Are you there?
Hello. Hi, I'm sorry. I'm here. I just didn't hear what you said. I had trouble unmuting.
Oh, did you already testify?
I did.
Oh, I'm sorry.
Not a worry at all.
Poor George is probably like, all right, get to me already. 110, George Kingston.
Good evening, Senator Olson, Representative Curry, and members of the Appropriations Committee. My name is George Kingston. I'm the administrator of West Side Care Center, a 162-bed skilled nursing facility located in Manchester, Connecticut. With me is my colleague, Judy Cano-Hines, administrator of Chelsea Place Care Center in Hartford, Connecticut. Together, we wish to speak on behalf of iCare Health Network.
Good evening. As administrator for iCare since 2007, I have provided multiple testimonies before the Appropriations Committee. And I often look back and compare year over year. And each year has brought new challenges, but nothing can be compared to the past 2 years during the COVID-19 pandemic. In the early days of the pandemic, we experienced a lack of public health guidance, lack of PPE, lack of testing, and sickness and death like we've never seen before. 2 years later, we are cautiously optimistic about the future, but we still face ever-changing public health guidance, high rates of community transmission, increased costs, decreased occupancy, and staffing shortages. To put in perspective our current challenges for staffing, when I presented in 2020, I had 300 employees at Chelsea Place. Today, we have 212 employees. Faced with the most traumatic experiences in their careers, our staff have been working countless hours throughout the pandemic to ensure the needs of the residents they care for are met. These overtime hours not only create a financial burden for us as the employer, but it also has a mental and emotional toll on the dedicated healthcare workers that we employ. At Chelsea Place, we have been very fortunate to avoid using agency staffing. But because of this, our overtime numbers are incredibly high. The increase in overtime from 2019 to 2021 has risen almost 50% for our nurses, 140% for our nurses' aides. As a company, iCare has implemented staffing bonuses. These have resulted in an overall increase in labor costs of $20 per day, per patient per day in facilities like Westside Care Center. Additionally, the cost of agency for the company has been astronomical. Agency costs at iCare's 11 Connecticut homes has risen over 500% from 2019 to 2021 for both nurses and nurses' aides. The cost of agency staffing is crippling, and the lack of consistent staffing is concerning. The pandemic has been devastating for our residents. With visitor restrictions, quarantines, and a fear of severe illness, the only constant has been the staff. Agency is a last resort, but especially now when the residents have suffered so much. They need consistent caregivers to provide for not only their physical needs, but their mental and emotional needs. Our industry needs statewide incentives to encourage Connecticut residents to go into the field of nursing and for prospective nurses to work in the long-term care industry. As an industry, we appreciate your
Just
support.
summarizing, my apologies for interrupting.
Yes, we are so thankful for the employee wage enhancements and healthcare pension benefits adopted last session, but we need more help. We need to continue to increase employee wage and benefits, and we need additional rate relief. And as previously stated, we need to incentivize Connecticut residents to seek training and employment in our long-term care industry as nurses and nurses' aides through tactics such as education grants and refundable tax credits in favor of staff members that fill these valuable positions. On behalf of Chelsea Place, Westside Care Center, and all of iCare, I thank you for your time and your support.
Thank you very much. Have a good evening. Next up, we have 111, Marilee McPeters. Good evening.
Good evening, Senator Austin, Representative Walker, and members of the Appropriations Subcommittee. Thank you for this opportunity to offer my testimony related to residential care home funding. My name is Marilee McPeters, and I'm the manager of Massac Memorial Home, a 19-bed residential care home located in Rockville, Connecticut. I'm here to express the urgent need for a rate increase for all of Connecticut's RCHs. We are desperate for additional funding due to the high cost of living and the urgent need to increase the wages of our dedicated and overwrought staff. Should our industry continue to be significantly underfunded, some homes will inevitably close their doors and leave our vulnerable population at risk. As an RCH, we provide 24-hour supervision, 3 homemade meals and 2 snacks daily, medication supervision, full housekeeping, maintenance, laundry, cleaning services, and limited recreation. In the wake of COVID-19, most of these services needs have tripled. In days of past, RCHs were simply room and board. Now we are considered the social model, with highly functioning independent residents who can book their own doctor's appointments and arrange transportation. However, I'm here to tell you that this description is far from the reality, as only one of my 19 residents is actually that capable. Our residents are extremely dependent on myself and my staff for all of their needs, mental, physical, and emotional. We are the liaison that juggles the schedules between the residents, the doctors, the case managers, and their nurses. We schedule copious amounts of appointments and follow-ups and provide most of the transportation. I'm currently working with a resident who has had a total of 12 separate appointments for eye care and another who has had required 9 appointments for his dentures. We have transported these residents as far as Hartford and Enfield. Often in these cases, the cost of my staff member's salary actually exceeds our daily rate of care. Doctors are now asking us to monitor and record items such as blood sugar levels and weights and refuse to see our residents unless the staff member is present. The doctors state that our residents are unable to appropriately describe their medical concerns and needs and fear that they are at a loss to relay the appropriate information to staff, which is unfortunately often true. When a resident becomes physically ill, my staff is there to clean up the urine, feces, and vomit. When they have a personal or mental crisis, my staff intercedes, and when they're lonely, my staff take the time to talk with them. Luckily, my staff members are empathetic human beings who consistently strive to provide each resident with the utmost in dignity, respect, and importantly, as joyful a life as possible. Right now, as a manager, I'm struggling to get my own work done due to the shortage I have in staff. I'm working weekends and nights, and I'm desperately struggling to find a new employee. I've not been able to procure a viable employee as you know, for over 3 months, and our business simply cannot afford the starting wages most are looking for. This has resulted in employee turnover for many of our homes. Our goal is to employ people in long-term careers so that they can establish and maintain relationships with our residents. This leads to better long-term outcomes, stability in the home, and savings significantly to our state. My home and other RCHs throughout the state have had to get by with rates failing to keep up with the costs, and yet we serve as a safety net for some of the most difficult clientele.
Meredith, if you wouldn't mind just summarizing for us?
I am. Unlike other providers, all of our residents are state funded, limiting our ability to cost shift and make up for low rates. Please support residential care home funding and uncap our rates so that we may keep our exemplary employees. Please also approve a viable plan for residential care homes to provide become medical billers. These funds are essential to our homes and paramount to our long-term survival and ability to provide excellent services to our residents. Thank you so very much.
Thank you very much for your testimony this evening. 112, Shirley Dizelle. Good evening, Shirley.
Good evening. Can you hear me?
I can.
Well, how do I? All right, so I'm all set.
You're good. Go ahead with your 3 minutes, please.
Okay, good evening. I'm Shirley Dizelle. I'm a registered nurse and clinical manager for the Torrington office of All About You Collaborative Healthcare Services. All About You provides an array of services through their offices in Naugatuck, Torrington, and East Haven. The agency, provider-owned, participates in all major insurance plans. Currently, 54% of our clients are enrolled in Medicaid. The service I'm here to discuss with you pertains to our patients with behavioral health and/or substance abuse disorders requiring medication administration services. Our Torrington office services 186 clients, of which 132 receive daily or twice daily medication administration visits. Medication administration is a task. For a behavioral health nurse, it's an opportunity to observe, to listen, to assess, and educate, as well as administer medications. Processing information can be a challenge for some. Daily reinforcement by the behavioral health nursing team helps to reduce symptoms, have risk reduction, and improve quality of life. However, the COVID pandemic has had an enormous impact on this underserved population. COVID education, masks, hand hygiene, social distancing, symptom management, self-imposed or forced isolation became part of every patient's visit. With many of our folks, we were the only human contact they would have for weeks at a time. As the manager, my hope is to be able to retain and recruit staff committed to our mission of putting the needs of our patients first through collaboration, communication, and health education. We respectfully request the human service budget include the following: increased reimbursement for home care medication administration nursing services by 15% based on inflation.
Hey, Shirley, I don't mean to interrupt you. I think we're having a little connectivity issues, so I think it might help if you turn off your camera.
To sustain home care providers in future budget years. Thank you very much.
Thank you very much, Shirley. We appreciate you coming out this evening to provide your testimony. Next up, we have 113, Marta Sanchez.
Thank you.
Marta Sanchez. I see you're on our list.
Good evening. Can you hear me?
I can hear you now. Good evening.
Okay. Good evening, Senator Olson, Representative Walker, and members of the committee. My name is Martha Sanchez, and I am a CNA at St. Joseph Center in Trumbull. I've been a caregiver there for 17 years, and I love my job because my residents feel like they are being well taken care of, and I love to make them feel safe and that they can trust me on a daily basis. I shower them, I dress them, I feed them, I comb their hair, I walk with them, I talk to them, I listen to them. I make them laugh. My work is very important. I let them know someone cares. I make, I'm sorry. I have seen work in the nursing home change over the years. It frustrates me that there is not enough staffing. With better staffing, we can give our residents proper care for our residents, let alone ourselves. These homes cannot hire, these nursing homes cannot hire enough staff due to the workload has increased. Not the pay and benefits though. Our workload has increased, but not our pay and our benefits. Life has gotten expensive, and we still don't get paid nearly enough for the work that we do. And to add to that, the disrespect that management subjects us to, and add in the short staffing increase in our workload. It's no wonder we cannot hire more workers that will stay in the workforce. The funding that was given to the nursing homes was a huge step in an industry that is not so far behind. If it wasn't for COVID, I think we'd have continued to be limping along until we fell apart instead. COVID blew the doors open to the problem that we can fix this, but we need your support and your investment. Thank you for your support.
Marta, thank you very much for coming out this evening.
Thank you.
Next up, 114. Good evening, Christy. Nice to see you.
Good evening, Representative Curry. Good evening, Senator Austin, Representative Walker, and members of the committee. My name is Christy Koval, and I am the Director of Public Policy for the Alzheimer's Association Connecticut chapter. It is my honor to be with you here tonight. I know you've heard from some of our advocates, and you have my written testimony. I just want to touch upon a few things. I am commenting tonight on HB 5037. For the Alzheimer's State Respite Program. Currently, right now, there are 80,000 people in Connecticut who are living with Alzheimer's disease or other dementia. We do estimate that this number is going to go up to 91,000 by 2025. Connecticut is the 6th oldest state, and age remains the biggest risk factor for developing Alzheimer's disease. So we are seeing our numbers grow. Alzheimer's disease is the most costliest disease in America. People can live on average 4 to 20 years once they do get diagnosed, and care needs only increase while someone is living with this disease. 80% of people who are living with this disease are cared for in the home, usually by an unpaid caregiver, a family member. And respite services provide temporary substitute care that really supports the caregiver who's trying to manage at home. So respite services can be a day a week in an adult day center. It could be a home health aide coming in to be with that person so the caregiver can go out and do errands. It manifests itself in a number of ways. We do see benefits to this program, and we do know from the people that call our helpline who are in such need of services immediately that respite provides that lifeline. Those folks who are on the state Alzheimer's respite program who are receiving that short-term help are able to keep their loved ones at home much longer. Alzheimer's disease does take a devastating toll on caregivers. Compared to caregivers of people without dementia, twice as many caregivers of those with dementia indicate substantial emotional, financial, and physical difficulties. So we are asking, in addition to increased funding for the Alzheimer's respite program to deal with the growing numbers of people who are dealing with this disease and prefer to stay at home, we also are recommending increased transparency on where the dollars are in the budget so that they can accurately reflect the utilization of this program. I am happy to answer any questions. You have my testimony, and I know that many of my advocates came out tonight to also express their support. So thank you for your time.
Thank you, Christy. We appreciate your advocacy, and just a point of personal privilege. I just want to thank you and your organization for really being a touch point for a number of my friends who are actually needed that guidance and that help with some of their parents that are working through this right now. So really appreciate that.
Thank you so much.
Next up, we have 115, Dwayne Gordon. Good evening, Mr. Gordon. Just need you to unmute.
Good evening, everybody.
Good evening.
My name is Dwayne Gordon. I've been working at St. Mary Home in West Alford for the past 7 years now. And I currently was working in the dietary department as a prep cook that you make $1.25 more than your normal wages. And since COVID started, they have cut staff in dietary tremendously, like twice. Approximately a year ago, they cut like staff in like maybe 20 to 30% less than what it is, and the workload is the same. In Francois Tower, which I used to work, I was a 40 hours prep cook there, and I have to transfer from dietary department to housekeeping because of the stress and the workload and not enough help from management. And we need funding because I train like a bunch of people coming in looking for a job, and some of them really willing to work, but is the starting wages are so low, really low for taking care of 90 residents. Also, we got to provide breakfast, lunch, and dinner in 8-hour shift with 3 person, and we're short staffed. Most days is only 2 person working, and since the COVID hit, it's really bad because few weeks ago, it was like 9 person out from dietary and COVID, 9 employees. And it just keep going. Like, we don't get as rate pay as other departments do. We don't get pickup shift. If a pickup shift, we don't get that pickup shift as other departments do also too. And they cut out dinner. We serve dinner at lunchtime. Meanwhile, they're getting the lunch. We have to give them a bag for the dinner right after. And I was just hearing a lot of complaints from residents them that they're losing weight because it's cold food. It's like salad and sandwich with a juice and a milk and maybe a snack for the dinner. That should hold them all over until like 8 o'clock the next morning. And it was a sad in my heart because I lost my grandparents them years ago, and I wouldn't want to see my grandmother or my mom or anybody, mom and dad in that situation that they're crying, say they're hungry. And when I speak up and tell management that we need more supplies or we need more food, they're saying that it's all about portions. And I have to leave and go to housekeeping for 20 hours and take $1.25 less than what I was making, and also pick up a 3rd job. Now I'm working 3 jobs to support my family. And wages is one of the biggest concern. Like, I'm there 7 years and I'm not making $15 an hour. And we need the state to step in and do some funding that we can get like a better living wages as we can actually make ends meet to support our family and have to worry about buying $20 gas instead of $4 gas and buying grocery. If you can buy 2 tray egg instead of 1 tray egg, all those stuff, we should not be worrying about it when we are essential workers because they call we heroes.
Mr. Gordon, if I could just ask you to summarize your testimony.
Yes. We need funding for nursing home, big funding, and we need a lot of help. We need staffing. Staffing is the biggest issue. and funding. Thank you for your time very much.
Thank you very much, Mr. Gordon. You have a great evening.
Same to you.
Next up, we're going to call Richard Treat, and I will hand the hearing over to my good friend, Representative Gilchrist from West Hartford.
Thank you. Go ahead, Mr. Treat. I don't know if we have Mr. Treat. Richard Treat, are you here? All right, if not, I'm going to move on to number 117, Stan Mingione. My apologies for the last name.
Yep, you got it right. Thank you.
Okay, go right ahead, please.
Good evening, Senator Austin, Representative Walker, and members of the Appropriations Committee. Again, my name is Stan Mingione, Executive Director of the Estuary Council of Seniors located in Old Saybrook, Connecticut. We are an elderly nutrition provider, providing Meals on Wheels for 9 shoreline communities and over 400 seniors in Lower Middlesex County. I'm here today to voice some concerns about the elderly nutrition program in our state and how the impact of COVID will forever change how we deliver our vital services to the state's most vulnerable population. Each meal provider in the state has had to become creative, flexible, and innovative during this uncertain time of change. Many of us coming up with alternative ways of making sure that no senior suffers from food insecurity. The grab-and-go meal service that many of us have instituted during COVID, once seen as a temporary fix during the pandemic, is one that I feel should be a permanent part of all ENP's toolbox of services. These changes to the nutrition programs are not without costs. As food costs are rising along with the proposed rise of minimum wage, each meal provider is now challenged with continuing to provide meals to an increasing population of seniors who otherwise would have nowhere to turn. Fear of going to supermarkets or being in public places has increased the demand for both Meals on Wheels and grab-and-go meals. Also, as we like to say, our service is more than just a meal. We provide socialization, daily wellness checks, and our meals help folks remain independent and in their homes, reducing the need for institutionalization. I believe it is imperative that Meals on Wheels are not left out of the conversation regarding funding to offset the impact of COVID and the minimum wage increase. Lastly, we appreciate intended increases through the federal ARPA HCBS plan, which these proposed adjustments fund and support. While we're still waiting to see the rates, our support is cautionary, but hopeful. So I thank you all for your support of our vital meal programs and the seniors who rely on them.
Thank you so much, Mr. Mingione. All right, we're going to move on to Janelle Roberts.
Good evening, Senator Austin, Representative Walker, and members of the committee. My name is Janelle Roberts, and I am a PCA from West Haven. I have been a PCA for 28 years, and I love my job because I get to spend time with my consumers and I get to know them and know when something isn't right. I cook for them, I clean, I help them bathe, I feed them, I go to appointments with them. A lot of times I'm their therapist because I listen to their concerns and I listen to what problems they feel like they are having. Without providing these services, my consumers would not be able to do anything without the satisfaction of being able to live independently. I get frustrated that we are treated like glorified babysitters when we do 3 times the amount of work than what is equally distributed by nursing facilities among coworkers on any given shift. Because of this mentality, we do not have sick days or health insurance. When I get sick, I have to go to work or I'll fall behind in my bills. If I have sick days, I would be able to stay home and not have to worry about passing germs back and forth. I would be able to rest and get healthy and not worry about the stress of falling behind on my bills. My client got COVID over Christmas, and then I got COVID from my client. Because there's no backup coverage and I don't get paid sick leave, I had to work while having COVID, which isn't healthy for either of us. I have asthma and I struggled with breathing during that time, and all while providing care for my consumer. My 16-year-old daughter has a full-time job at Dunkin' Donuts and makes more pay weekly than I do. Please make this right and allocate funding to help PCAs like me gain the basics, the ability to stay home when we're sick, have health insurance that we can count on, and take care of our families. Thank you for your time.
Thank you, Ms. Roberts. Thank you for your time and your testimony. Next, we're going to hear from Diana Estasio. Is Diana with us tonight? Okay, if not, then we're going to go to Shomit Sengupta. I hope I got that, sorry.
That's correct.
All right.
Good evening, Representative Gilchrist, Senator Austin, members of the committee. My name is Shomit Sengupta. I live in West Hartford. I'm one of your constituents, and I've worked as a home care worker for 4 years, over 4 years. I come before you again today to ask you to increase funding for home care services so that PCAs like me can be provided the wages and benefits that we deserve. I currently provide services for 3 gentlemen, one client through DSS and 2 others through a home care agency. My responsibilities include feeding, exercise, house cleaning, and so on. And the pay for all this work is a meager $16.25 an hour, and the agencies pay even less. I'm getting married this year, and I don't know whether I'll be able to afford a mortgage, childcare. I have no idea when I'll be able to get vacation again, honeymoon. I have no idea. I can't afford to buy a new car, so instead I spend money on the bare minimum of maintenance and repairs necessary to keep the one I have right now running, but it's not cheap. An economic commentator once said, as new innovative industries pop up, workers are finding fewer and fewer jobs that will even classify them as employees. If you're a gig economy worker, you're racking up miles in your own car, driving absurd hours to make pennies, and the company does not provide you with any benefits because you're not an employee. Then when your car breaks down and you have to spend all the money you made to get it fixed, where does that leave you? Even though he speaks of companies like Lyft and Uber, I quote him because his observation hits very close to home. One of my responsibilities is driving my clients to restaurants, concerts, festivals, and so on. Last year, I drove my consumer employer 2,000 miles, over 2,000 miles, and with a standard IRS rate of about 57 cents a mile, that works out to about $1,100 or $1,200. There are times I've worked shifts and actually netted negative because of having to drive so far. In addition, my car has also been vomited in, urinated in, defecated in, and I've received absolutely no reimbursement for those either. The fact that we are paid $16.25 an hour while being called heroes and essential workers is shameful. And the fact that we're forced to drive around our clients 2,000 miles a year with no reimbursement whatsoever for gas or vehicle maintenance is highway robbery, pun very much intended. I ask you to do what is needed to put an end to this kind of exploitation. We deserve better. Thank you for your time.
Thank you, Mr. Sengupta, for being here and for your testimony. Next, I'm going to see if we have a few people here. Is Denise Panella here?
I'm here.
All right, wonderful. Please go right ahead.
Good evening, Senator Austin, Representative Walker, and members of the committee. My name is Denise Panella, and I'm an RN at a long-term care facility in Colchester. I've been employed there for 20 years. I'm a dedicated, loyal employee to a company that couldn't care less about me and my coworkers. I am here today to shed some light on the current long-term care staffing crisis in Connecticut and explain why so many people are leaving the industry. Way before COVID was even a thought, I urged the state to fund facilities for better staffing and to change the staff to patient ratios. The second the pandemic hit Connecticut, the workers of retirement age finally retired, and those employees not vested never returned. It was the employees with the longevity that have remained and suffered. We continue to show up during a pandemic with no compensation or appreciation, risking our lives while everyone else runs the other way, including management. Due to the pandemic, we went from a building that once was employed with over 200 workers being left with less than 80. This is nowhere near enough to provide care for 3 shifts a day, but the admissions keep on coming and no one else is coming to work in these facilities. The starting wages are too low for double the workload that is now expected. Mandating was something that we used to only see during blizzards, but has now become the new normal to fill the schedule on a regular day. Staff are being mandated at least 5 times a week, and this is unacceptable. We choose the shifts we work for a reason, whether that means we have other jobs, we take care of our elderly parents at home, or we have to take care of our own children. We are now being told that we are not allowed to take vacation time or personal days. Why do we not deserve our time off for our own well-being? We earned that time. Why is that too much to ask? When we try to leave, we are threatened and told that DPH will be called and we will be reported for job abandonment. We are not abandoning our jobs because we worked our scheduled shift. Our employers are abandoning us by refusing to raise wages to attract new hires. When schools were not open and my son needed to be homeschooled, my employer refused to accommodate my hours. So I gave up my full-time position and went per diem. This way I could make my own schedule and be there for my son. Then the company decided to fill the open positions with agency staff. I was told that the agency staff could no longer sign up day to day, but that they needed to be given full-time positions by signing monthly contracts. So let me get this straight. The company that claims to have no money is willing to pay a stranger $60 to $100 an hour to come and go as they please, but are not willing to pay me a penny more or accommodate a schedule for me so that I can continue to deliver the care that I have for the last 20 years. How are these companies being allowed to misuse funds and not being held accountable? How are they allowed to pay strangers to come and take care of our residents, but cannot pay the dedicated, loyal staff that have worked there for years? And we know our residents. Now the company is saying that they spent too much money on these agency staff workers and will no longer use them. So instead, they will go back to abusing us. We are on the verge of leaving because we are overworked, underpaid, and tired of being abused. It is not a rewarding feeling knowing that you are being set up for failure and cannot provide quality care. These residents are suffering and it's heartbreaking. Imagine if it was your mother, father, or even you. We need to do better. We need funding so that we can attract and retain new staff or else we're doomed. Thank you for your time.
Thank you, Ms. Pinella. Appreciate your testimony and your time tonight. Next, we will hear from number 122, Terrell Williams. Nope. All right, moving on to number 123, David Fenton. Okay, 124, Suzanne Kuligowski. Nope. 125, Stephanie Tate.
Hi, I'm here.
All right, wonderful. Please go ahead.
All right. Good evening, everyone. Thank you for taking the time to hear me speak. My name is Stephanie Tate, and I am a parent educator at CHR in Norwich. And I consider myself one of the lucky ones. My personal journey thus far has been anything but smooth. But from each challenge and obstacle along the way, I've learned a lot. One being that everybody from all walks of life struggle at some point, and some of those struggles will break some of them along the way. And to thrive in this world, we do need a village. I've witnessed so many lives lost to personal struggles because of the lack of supports and resources at home, in schools, or in the communities. We can't get those lives back, but we can do better to ensure that more lives aren't lost. Children are impacted more than we realize by our choices. As parents, educators, and political figures, what we choose to do or say impacts what and how children learn, what they think and believe, and how they respond emotionally and physically, and who they become as adults. To ensure all children's well-beings are being met, we must stay vigilant. CHR's Parent Support Service program uses 2 curriculums, Circle of Security and Triple P, to enhance attachment security within parent-child relationships, improve positive parenting strategies to help build parental skills to manage behaviors, create and improve boundaries, and appropriate expectations. We also offer access to or search for various resources and any needs that are needed for services. Implementing these programs are breaking maladaptive generational cycles and creating stronger parent-child connections that will aid in reducing stigmas placed on mental health, strengthen bonds and security within future relationships, and ensure that no one faces their challenges alone. It is also worth noting that the same strategies can be implemented into classroom settings to strengthen student-teacher relationships, parent-educator partnerships by creating a secure, trusting educational environment. Utilizing evidence-based practices in educational settings will give staff working directly with children the skills to create strong and secure relationships with multiple children within one setting. Doing so will decrease the prevalence of problematic behaviors in classrooms. It can also enhance educators' ability to effectively identify behavioral or mental health concerns and give them the opportunity to utilize early interventions to reduce long-term effects of untreated mental health or cognitive delays. The message is simple, and it is expressed perfectly through the Circle of Security program. We need to learn how to become bigger, stronger, wiser, and kind, individually and collectively, to create secure bases, safe havens for our children, and nothing says it better. Actions really do speak louder than words. Thank you.
Thank you, Ms. Tate. Perfectly timed. Thank you for your testimony tonight. Next, we will hear from Gloria Duquette. Are you with us? Nope. Beatrice Drayton? Okay.
Madam Chair, Beatrice is actually with us, but she has not accepted her promotion to a panelist.
Hello. Oh, okay.
There you go. Thank you, Beatrice.
Can you hear me? Hi, how are you?
Yes, we can. Go right ahead.
Yes. How are you? Yes. Good evening, Senator Osteen, Representative Walker, and members of the committee. My name is Beatrice Drayton. I am a personal care attendant, a PCA from Hartford. I come before you today to ask you to allocate the funds necessary to give PCAs livable wages and good benefits. I have worked as a PCA for 14 years. I love my job because I love helping my consumers accomplish their goals and making them happy, comfortable each and every day. If they are not happy at the end of the shift, I didn't do my job. I provide services for my consumer like bathing, grooming, and hygiene. I assist with dressing, preparing nutritional meals, accompany consumers to medical appointments, grocery shopping, and errands, such as picking up medications from the pharmacy. I also help my consumers make decisions, such as when to schedule their medical appointments, and will collect mail to do their laundry as well. While not in my job description, maybe the most important part of my job is providing companionship to my consumer. While I do love my job, it can be frustrating and challenging at times. For instance, one of my consumers has dementia, which means it takes a lot longer to help them with tasks or to give them care. This, of course, takes a toll on you as a caregiver and may leave you exhausted at the end of your shift. However, a PCA that comes with the job, what shouldn't come with the job, is back-breaking poverty, crushing medical debt, and no vision of a future in which you are not poor. This is what happens when you do not pay someone a living wage, when you don't provide them with health insurance or pay time off, and when you don't provide workers with any type of retirement plan or pension. Home care services are critical, and yet PCAs are kept in poverty through the wages and benefits we receive. When Connecticut properly fund these services and PCAs start earning a livable wage, we will not have to work 2 or 3 jobs to make ends meet, which will allow us to focus on the consumers they care for. When PCAs have health insurance, we can see our doctors when we need to instead of waiting for a medical crisis. When PCAs have a retirement plan that we can use to plan for their future, we can gain some peace of mind knowing that we won't have to work until we drop. We know it is entirely possible for the state to allocate the fundings needed to make livable wages and quality benefits for PCAs a reality. It only requires the vision and willpower to do the right thing. Please do the right thing for me and my consumers and properly fund home care services. Thank you for your time.
Thank you, Ms. Drayton, for being here
You're
tonight
welcome.
for your testimony.
Yeah, thank you.
You're welcome. Next, do we have with us Sandy Pepin? Okay, if not, do we have Christine DeLeon? How about Cynthia Johnson? All right.
I'm here.
Oh, all right, wonderful. Ms. Johnson, go right ahead.
My video and stuff. All right, ladies and gentlemen, good evening. Senator Olson, Representative Walker, members of the committee. My name is Cynthia Johnson, and I am my daughter's, Anissa Johnson. I'm her PCA. We have lived here in New Haven since 2010. However, for the last 6 to 7 years, I've been caring for my daughter as her PCA due to a series of events that took place in 2014. She suffered from, she now suffers from a unusual, rare syndrome of epilepsy that her seizures change up. She has different types of seizures. She goes from grand mal to drop seizures to bilateral seizures, back to grand mal seizures. In 2015, she had a drop seizure on Dixwell Avenue. The fall itself broke her jaw in 3 places. The impact of the fall knocked her teeth out. Didn't break her teeth. Her gums released her teeth from her mouth, so they were full from the root. My daughter also went through PTSD from that traumatic fall and lost almost 75 pounds. She is still battling gaining the weight. She also has a learning disability that has made her mildly retarded. With all of this going on, through the fall, she picked up vertigo. I am taking care of all of that at one time. I also suffer from epilepsy myself. So when the Medicaid waiver program stepped in and helped me and helped my daughter, I am able to at least have an income, but I don't have any benefit. My daughter is totally disabled. She's not going to be able to do but so much. If I'm taking care of her and I have to worry about whether or not I'm going to eat or whether she's going to eat, where we're going to live, things of that nature, that puts undue stress on both of us. This funding helps us in ways nobody else can think of, but it's not just me. It's other PCAs that are taking care of family members or those that they love, because once you start caring for these consumers, you become family and you don't want any of them to be without. Just like I'm taking care of my daughter, someone is taking care of somebody else. They become family too. We are giving love, we are giving care each and every day. I care for my daughter just like somebody else would care for her. I have PCAs that come in that help me clean her, take care of her, do several
Ms. Johnson,
things.
can you summarize, please?
I myself, I wash, do her hair, I give her medication, I take her to the doctors, I clean the house, I do the laundry, I do everything that she cannot do. I'm her companion, I take her everywhere she needs to go. I help her with work if she goes to school. I help her with basically everything that she needs to do, where she wants to go, her personal agendas. Right now, I'm her dietitian. I help her with her diet so that she can gain the weight that she wants to gain back. I help her with her educational dream to finish college. helping her with her exercise. She likes yoga. I help her keep that routine going. So her PCA comes in. She's her companion. She helps to watch TV with her. She keeps her focused on things that she want to do, and takes her for walks and everything like that, so that she doesn't get despondent.
Thank you, Ms. Johnson. Thank you so much for being here and for your testimony. Truly.
Thank you. And I hope that the funding is given, because we really do need it.
Thank you.
All right then.
We're going to go back to Suzanne Kulagowski.
Good evening. I apologize for being late. I've been trying all day to connect and had some technical issues. Good evening, members of the Appropriations Committee. I am Suzanne Kulagowski, President and CEO of ARI of Connecticut, a provider of services for people with developmental disabilities in Stamford. But we do much more. Most of the people we serve have additional diagnoses, including mental health, medical, and physical disabilities, and Alzheimer's disease. Some have 20 or more different diagnoses. The staffing crisis has made it nearly impossible to provide minimal levels of staffing and keep everyone safe. We're only able to do that with an incredibly dedicated, yet completely exhausted and frustrated staff team. Yesterday, in an email from Michelle Gilman, Acting Commissioner of the Connecticut Department of Administrative Services, she acknowledged that it is in large part due to the efforts of community nonprofits that the state of Connecticut has grown our economy and cared for our most vulnerable residents throughout the pandemic. While we appreciate this acknowledgement, it is actions, not words, which will demonstrate the state's appreciation for the essential services we provide. The additional funding for agencies that provide services under the DDS umbrella does not do anything to ease the huge burdens we have. All of that funding will go to cover state-mandated and well-deserved increases in wages and benefits. This means that there are no additional funds to cover the extraordinary increases in every other expense we have, from utilities to vehicle gas and maintenance to food and so much more. In fact, this issue started long before the pandemic was ever imagined. We haven't received an increase to cover administrative and general expenses for 17 years. In order to compensate for lack of revenue, we have to cut expenses. That means we defer maintenance and eliminate necessary positions by spreading the work out over already taxed employees. Some agencies have turned to food banks to cut grocery expenses. This is not an acceptable approach to serving vulnerable populations. There is new funding proposed in the governor's budget. However, all of this funding is for new programs. I fully acknowledge that new services are needed for so many individuals and families that are on the waiting list, but I can tell you that the provider community is not yet in a position to add new services. For the reasons already mentioned and so many more, our foundation is crumbling. And just as you can't build an addition onto a home with a crumbling foundation, we can't add new services until we have the appropriate resources to fund and maintain our current services and to recruit and retain a qualified and well-trained staff. I ask you to add a COLA for DDS providers that will fully fund our services so that we can provide the quality services people deserve and solidify our foundation so that we can grow and serve more individuals. I thank you for your time.
Thank you, Ms. Kulagowski, for your time and your testimony tonight.
Thank you.
All right. Next, do we have with us Marilyn Wenzel? All right, then we'll go on to Cal Patel.
Hello, Representative Gilchrist. I'm here.
Wonderful. Go right ahead.
Senator Olson, Representative Walker, members of the Appropriations Committee. I thank you for the opportunity to offer testimony on social services budget relating to residential care home funding. My name is Cal Patel. I am the administrator of a 33-bed residential care facility. We provide housing services to mentally challenged and vulnerable adults. We provide 3 square meals, medication administration, housekeeping services, and physical plant maintenance, doctor's appointments. I've already provided written testimony. I just wanted to take this opportunity to highlight a couple of important things. Our number one cost, and I wanted to take this opportunity to advocate for our staff. We have been flat funded for many of the past few years, and we cannot keep up with the staffing payments. I was in front of this committee before COVID, before the COVID challenges. The minimum wage increases were a challenge to us. Our employees barely make above a minimum wage, and we've had a tough time keeping up with maintaining our staff. I've lost staff to big box retailers, to larger providers. We just can't keep them. We cannot compete, and they deserve to be making a lot more money than close to minimum wage. Also, this challenge was highlighted and acknowledged by the state last year in the biennial budget. They did pass for us to become Medicaid billers, and some of that savings was supposed to be reinvested back into our industry. We are supposed to become Medicaid billers effective April 1st of 2022, but despite meeting with some DSS members, we have yet to have an operational protocol in place to become billers. So therefore, it doesn't look like those funds are going to come to us this year. So I wanted to highlight those two factors. We desperately need assistance in better funding to pay our employees. Thank you.
Thank you. Thank you so much, Mr. Patel, for your testimony and your time. Next, I'm going to go to Nishant Pandya. Are you with us? All right. How about Michael Warburton? Michael, we can see you, but we can't hear you, even though you're unmuted. So maybe it's something. Try again to unmute. And let's see if we can hear you. No, we still can't hear you. Maybe exit and come back in. And when you come back in, we'll get you back in the queue. You won't have to wait too long, but your microphone's not working.
Okay. All right. Thank
you.
Wait,
now we can hear you.
You can hear me. Oh, great. Wonderful. Good evening, members of the Appropriation Committee. My name is Michael Warburton. I'm from Waterbury, Connecticut. I'm testifying on behalf of our state's 5 independent living centers. I've been a transition coordinator at my local center, Independence Northwest, for the Money Follows the Person program, with whom we are contracted with the state of Connecticut, now for almost 20 years, both in the Money Follows the Person project and its predecessor project, the Nursing Facility Transition Program. I'm also a person with a hidden or non-visible disability. I'm here to speak on behalf of the center's request for an additional $1 million to be added to our current level of state funding. Independent living centers serve persons with disabilities across the lifespan and across all disabilities of any kind, whether physical, mental, cognitive, or psychological. Most of the staff and board of each local center for independent living is made up of persons with disabilities. We provide advocacy, peer counseling, independent living skills training, information referral services, and transition-related services to assisting people to return to life in the community, out of an institution, or assisting young men and women in transitioning either into work or higher education when they leave high school. We do all this, as we have always done, free of charge to those whom we serve. When a person calls our center, they're seeking either to regain control of their lives after they've encountered disability later in their lives, or they're seeking to control their lives for the first time. I'm especially proud of the work that my center does in assisting disabled veterans of our U.S. Armed Forces. In my work as a transition coordinator for Money Follows the Person, I've seen so many families reunited following placement in a skilled nursing facility through our work together. I'm thinking particularly of an elderly woman who had been a resident for many years of a nursing facility in Danbury. And during those years, she was separated from her adult daughter and son. In the process of our work with this family, we were able to assist the person's daughter in obtaining the necessary modifications to her home to allow her mother to return to the family home in order to live out the rest of her days with the home accessibility features necessary and the in-home care services needed to maintain her mother's daily functions. We did all this at the height of the COVID-19 pandemic that was threatening the very lives of nursing facility residents and staff. On my current caseload, there are many such cases. This week, I'll be transitioning a husband and a wife and reuniting them back in their home in Northwest Connecticut following a stroke that forced the wife into a nursing facility. This could happen to any of us. This past year, the Centers for Independent Living have transitioned 113 individuals out of costly skilled nursing facilities in Connecticut. In order to continue the work, as I've mentioned, centers are requesting an additional $1 million on top of what is currently proposed for funding for our state's 5 Centers for Independent Living. Having worked at my Center for Independent Living for a number of years, I've seen the independent living centers repeatedly cut several times during difficult budget years. Federal funding for independent living centers has only increased to $195,000 per center, while Connecticut funding has decreased down to $92,000. The current situation has forced
Mr. Warburton, can you summarize? You're coming to the end of your time.
Cool. Okay. The current situation has forced many of our residents to, many of our centers to reduce services and cut staff. We're asking for your help with the additional funding so that we can restore some of our services and also advance and increase some of our services to the disabled citizens of our state. Thank you.
Thank you so much for your time and your testimony. Next, we'll hear from Gloria Duquette. Ms. Duquette, go right ahead.
Hello.
Hello, we can hear you.
Hi. Are you hearing me?
Yep, we can hear you.
Okay. Hi. Good evening, everyone. Good evening, Senator Huston and Representative Walker and members of the committee. My name is Gloria Duquette, and I've been a CNA for 15 years. I am currently working in multiple facilities because I need to work 80 hours a week to survive. 1 hour of my pay is the cost of chicken in grocery store in this state. Both of the residents and staff at these nursing home facilities are traumatized by what the pandemic has caused. This is no staff. We work hard and even harder now that we are taking a double, triple the workload. The residents are sicker and younger on tube fees, dialysis, and heart monitors. For many residents, we are the only interaction that they have with another human being. No family, no visitors, just us. They're direct caregivers. They are happy to see us when we come to work and sad when we are off. It is so heartbreaking that these residents have to wait so long to be attended to. It is not our fault or our purpose. There are just too many residents who want care at the same time. Someone gets to be first and someone has to be last. One of my favorite residents was a teacher in the state, a respectable, educated woman who has no one but me. I walked into her room and she was crying because she had to go to the bathroom and I was tied up with other residents. She had to wait 25 minutes for me to get to her. All I could do is apologize repeatedly, say that I'm sorry, and give her a hug. She was not mad at me because she understands, and I was the only staff member on the floor. There was no one else, but this is why she was crying. The state needs to do better. Black and brown communities have been suffering our entire lives. We cannot afford basic human needs such as shelter. We are backed up on our rent and our mortgages. We cannot afford food at the grocery store to feed ourselves and our children. There are a lot of single mothers in this industry who cannot afford childcare services. Most of these women are immigrants who do not have family around to help. We have to pick up so many shifts that our bodies are tired, causing our immune system to weaken. We cannot afford healthcare to see a doctor when we are sick. We are also in need of the state to invest in mental health services, such as counseling. We are broken physically, mentally, and emotionally. We live in the richest state in the country, but no one can afford to take care of us. You are abandoning us like we do not matter. Please do the right thing and help us survive. Thank you for listening.
Thank you, Ms. Duquette, for your time and your testimony tonight. Next, we're going to hear from Matthew Rowe. Is Matthew with us? All right, how about Alicia Freeman? Marshall Torres. How about Sheldon Tubman?
Yes, good evening.
Good evening.
Hello, members of the Appropriations Committee. I'm Sheldon Tubman, and I'm the litigation attorney at Disability Rights Connecticut. We're the protection and advocacy system for Connecticut, serving individuals with a full range of physical, behavioral, intellectual, and developmental disabilities. I'm here to testify about the impact of certain of the provisions in the governor's proposed budget on people with disabilities. First, it does propose to address a glaring unmet needs of people with disabilities in terms of dental care, but the proposed increase of 25% is not enough to meet the need. It's not comparable to the rates for kids' dental services. Second, I acknowledge that the governor has proposed some new funding for behavioral health services, which will help to address the needs of some of the thousands of individuals with mental health disabilities. But the governor's budget does not address the severe problem of access to in-home treatment for children with autism, many of whom cycle in and out of hospitals because they simply cannot get the community services they need. The governor's only proposal directly related to the needs of individuals with autism is to address the long waits for adults seeking services under the special autism waiver, which is not relevant to children who meet the eligibility criteria for Medicaid. For these kids with a diagnosis of autism, there are extremely long waits. Beacon Health now warns parents in their official brochure about ASD services that it may take several months after the diagnosis to connect your child with a provider in the community. The extreme waits are largely due to an extreme shortage of providers, which can be explained by the fact that Connecticut Medicaid payment rates are very low compared with private rates. And even if we look at Massachusetts Medicaid, they pay their techs, one of the kinds of service providers, 38.5% higher than we pay under Connecticut Medicaid. And the so-called BCBAs are paid 52% higher across the board in Massachusetts. So we have a serious problem. If the rates were made higher to be, say, equivalent with Massachusetts' rates, then disabled children with autism would have far better access to timely care. And finally, I wanted to note that the governor's budget and the budget the legislature ultimately passes will be affected by the Office of Health Strategy's proposed primary care roadmap and cost growth cap proposals, some of which I'm sure you've heard about, and they are partially codified in SB 15 and HB 5042. If those were adopted, it would dramatically increase spending on primary care, which is not what you're hearing about as a problem, while the cost cap proposal would limit overall healthcare spending, forcing a large shift of healthcare dollars to primary care from other areas, such as everything you've heard about this evening, behavioral health, dental care, PCAs, home care services, which are already a problem, obviously, in accessing services, and folks there need to have increased rates. Any spending restrictions from the roadmap being proposed and pushed by the Office of Health Strategy could hamper this committee and the legislature as a whole in implementing the needed increases in payment rates for these services to the benefit of people with disabilities. Thank you for the opportunity to speak with you this evening.
Thank you, Mr. Tubman, for your testimony and your time tonight. Next, we'll hear from Matt Barrett.
Hi, good evening. On behalf of the Connecticut Association of Healthcare Facilities, thank you for this opportunity to testify. And first, I'd like to observe that it would really be quite unimaginable to think of where our long-term care community would be were it not for the help provided by Governor Lamont and the support of the Connecticut General Assembly in so many ways during the public health emergency, especially the critically important financial support provided last session to increase rates by 4.5% for staff wage enhancements. The governor's state fiscal year 23 budget recommendation continues to support nursing home recruitment and retention initiatives, such as a second 4.5% wage enhancement effective July 1st, 2022. The budget recommendation also includes additional investments that would pass through to employees for enhancements to pension and healthcare benefits. And the budget provides new resources to begin a 3-year phase in implementation of a Medicaid acuity-based payment system with rebased rates. And we urge the Appropriations Committee to continue to support these important employee-related initiatives. However, severe staffing shortages caused by the elongated pandemic is hindering admissions, increasing labor costs, and slowing the occupancy recovery for Connecticut nursing homes, while the expanded use of nursing home staffing pool agencies is worsening the situation. A number of factors related to the ongoing pandemic explain the significant labor-related cost increases. First, the relentless pandemic has destabilized the healthcare workforce. Many have left the sector in favor of equal or better paying work in other less challenging non-healthcare environments, and new recruits have been reluctant to take on this critically important work. And so we say a new infusion of resources needed to bolster pay for these critically important healthcare workers. And many employees believe that the slated 4.5% wage enhancements are simply lost to 7% consumer inflation, which is now the norm in Connecticut's economy. And frankly, it'd be hard to argue that they aren't correct about that. Second, our nursing homes report they are literally forced to use nursing pool agencies in ever-increasing numbers due to staffing shortages. The consequences are severe for clinical and a consistent assignment of care reasons beyond the unfunded escalating costs. Moreover, nursing pools routinely hire away staff from nursing homes and sell them back to the nursing homes at many times the cost. It is completely proper, in our view, for the state to curtail these practices, given that the state is paying for the majority of this care in our nursing home in the Medicaid program. And I'm really happy to report that the Aging Committee has raised a bill in this regard. And we're looking forward to supporting that and seeing that move through the process. And so in conclusion, the ongoing and recent support that the state has been provided to nursing homes has been a lifeline in addressing the financial instability of the sector due to low and recovering nursing home occupancy. However, these important resources do not address the current situation regarding staffing, and we look forward to working with the executive branch and the Connecticut General Assembly on addressing these issues this session. Thank you very much.
Thank you, Mr. Barrett, for your testimony and your time tonight.
Thank you.
Next, Angie Goschnauer.
Hi, I'm Angie Gockenauer. Thank you so much for allowing me to testify this evening. The substance use opioid epidemic has highlighted the need for wider access to pharmacological and behavioral treatments for substance use disorders, and it has been exacerbated in Connecticut during COVID-19 crisis. I am the Director of State Government Affairs for Pear Therapeutics, and what we offer is a FDA-approved prescription digital therapeutic that delivers clinically validated disease treatment via mobile devices that can mitigate many treatment barriers by offering accessible and consistent evidence-based treatments available to patients 24/7. Specifically, the two first FDA-authorized PDTs, Reset and Reset-O, they're available in both English and Spanish, including part of their 3 mechanisms of action for addiction-specific cognitive behavioral therapy, fluency training, and contingency management to treat a substance use disorder and opioid use disorder, respectively. Advances in digital and behavioral technology may increase access and cost effectiveness and may further optimize technologically based CM. Digital tools permit remote reporting of substance use, but also remote delivery of incentives to provide new ways to deliver contingency management to promote abstinence from substance use. Currently, Reset and Reset-O are on the preferred on Mass Health non-drug formulary with no PA. We have requested Connecticut and Medicaid to mirror coverage like Mass Health, given the high need in Connecticut for more evidence-based treatments for substance and opioid use disorders. Currently, some employers in the Connecticut private sector offer commercial coverage for Reset and Reset-O, but the citizens in the Medicaid program are not able to access these treatments. What we're asking is to get support for coverage in Medicaid for PDTs for OUD and SUD, or a line item to be used by the Connecticut and Medicaid to develop a pilot program integrating innovative prescription digital therapeutics to help people in Connecticut with substance use disorder and opioid use disorder on their recovery journey. Thank you so much for your time.
Thank you, Ms. Goschnauer, for your testimony and your time tonight. Next, we'll hear from Angela Schlingheide.
Thank you, and good evening, Senators Austin, Kushner, Representatives Walker, and Abercrombie. My name is Angela Schlingheide, and I am the Director of Legal and Court Advocacy Services at the Center for Family Justice, a member agency of the Connecticut Coalition Against Domestic Violence in the towns of Bridgeport, Stratford, Fairfield, Trumbull, Monroe, and Easton. I'm testifying this evening in support of the governor's budget, specifically the one-time allocation of $2.9 million from the coronavirus funds to address victim safety risks and needs, which have been intensified by the pandemic, as well as the request for annual funding in the amount of $1,440,000 to support domestic violence, child, and family advocates across the state. I have submitted detailed written testimony, but I would like to focus my oral testimony on a real-life example of why having a fully funded child and family advocate at each DV agency statewide is essential to breaking the intergenerational cycle of violence and preventing future domestic violence. Siblings Robert and Rachel came to the center after experiencing significant abuse in their home. During their sessions with a child and family advocate, both children disclosed a lack of engagement with school, little to no social interaction with peers, the beginnings of aggressive behaviors, difficulty trusting adults, and an overall lack of hope for their future. Through ongoing counseling sessions, both Robert and Rachel began to unpack the years of trauma and abuse and started to heal. They began to learn about building healthy and trusting relationships. They attended our Camp Hope program, became engaged in our year-long Pathways to Hope program, and started to re-engage with their school and friends. Rachel discovered a love of writing and participates in a storytelling group, and Robert has a love of science and has joined a STEM Engineers program. They have a long way to go as they continue to heal from their trauma, as years of abuse cannot be unraveled in a short period of time. But having access to a highly trained, skilled, trauma-informed advocate has changed the course of these children's lives and given them an opportunity to break free from the cycle of abuse. Every child in Connecticut who has experienced domestic violence deserves the same opportunity. Currently, federal pass-through funds in the amount of $11,500 support only about 1/4 of the cost of a full-time advocate. That means that we need to cover the costs of the rest of that person's salary through annual appeal campaigns, private donations, events. But for less than 0.01% of the overall state budget, we have an opportunity to not only provide the reactive services, but to focus on work that can help to break the intergenerational cycle of violence and prevent future domestic violence in our communities. We can ensure that the children in Connecticut are healed and able to live happy, healthy lives. Thank you for your continued support of victims and survivors in our state.
Thank you, Ms. Schlingheide, for your testimony and your time tonight and your work.
Thank you so much. Have a good evening.
I knew you looked familiar. Good to see you.
Good to see you too.
Next, we'll hear from Deb Poulin, another person who looks familiar. Good to see you.
Good evening, everyone. Thank you, Representative Gilchrist, and thank you to the many, many members of the Appropriations Committee who were here for this hearing. And I'm making note to mention that because when people are watching online through CTN or YouTube, they don't have the opportunity to see that there are so many members of the legislature here listening to everyone this evening. And I wanted to express my appreciation for all of you for taking the time to listen and hear from people across the state about the importance of these social services programs. I am the executive director of the Connecticut Association for Community Action, or CAFCA. We work with the state's 9 community action agencies, which are the anti-poverty agencies for our state. Our mission is to support, strengthen, and promote the work of community action agencies statewide to advance economic, racial, and social justice. And I wanted to speak with you about just 2 items from the governor's budget, and actually one from the budget and one from the implementer. And you have my written testimony as well, which I have already submitted. So the first is Meals on Wheels. And 5 of our community action agencies are Meals on Wheels providers in our state. And this is, as I'm sure you know, such an essential service for people who are homebound to help them age in place. When you think about Meals on Wheels, the resources that you need to run a Meals on Wheels program, generally speaking, are food, paper products, gas, and labor. And we all know how quickly costs have increased in the last couple of years for food, paper products, and gas. And we're doing what we can as a state to increase the minimum wage, and that takes money as well. And so I'm here to request that you consider a substantial increase for the Meals on Wheels programs through the elderly nutrition line item in the budget. Again, this program is so essential to helping people age and thrive in their communities when that's the choice that they would like to make. Secondly, I just wanted to bring to your attention a fix that's contained in House Bill 5040, which is the governor's implementer bill on human services. While this isn't before you today, I wanted to make sure that you're aware that this is out there. Last year, you wisely created a community health worker program for community action agencies and funded that with $6 million. Due to a drafting error, most of that money is not available to be released right now. The budget implementer does contain the language fix that's needed to release all those funds and get that program up and running and off the ground with the community action agencies. What I would ask is, if possible, if you could grab that language and put it into a bill that's passed early in the session, then that would release those funds and allow that program to get up and running. That's all I have for you tonight. I appreciate your attention to all of the speakers before me and to all of the speakers that come after me. And as always, I appreciate your service to the state.
Thank you, Deb, for your testimony and your time. Good to see you.
You too.
Next, we'll hear from Michelle McKenzie.
Good night, Representative. My name is Michelle McKenzie. I'm a certified CNA at St. Mary Home in West Hartford. I come before you today to share the perspective as someone who has worked in the nursing home for 33 years, to ask you to please use our power as legislators, address the critical issues that exist in nursing homes across the state. As I mentioned, have been worked for 33 years as a CNA at St. Mary's Home. And for the last 13 years, I've worked there on the rehab unit. I love the residents I care for. I truly give me the joy, the care to see them, to help them to recover. As a CNA, I am responsible for many tasks, including bathing, changing, and feeding residents on my unit. We have residents who need extensive care, for some lacking the ability to even brush their own teeth. As it has been a pleasure to care for my resident. However, I have a staffing crisis as arose over the years. It has become harder and harder to provide the level of care they deserve. I often care for 14 to 15 residents all on my own. To put this in perspective, I must bathe, change, and feed 14 individuals all on my own. What happened if an incontinent resident has an accident? I can't attend to them right away. They must lie in their own pee and poop until I can get to them. More and more, I'm finding I cannot keep up with all my tasks at work, despite not taking any of my breaks and running myself ragged my entire shift. I simply put, there is no way a CNA can care for 14 to 15 residents to provide the level of care those residents deserve. A CNA should never have more than 8 residents they are caring for. Another challenge we face is ever expanding nature of our work. Nursing homes are no longer places where only elderly receive the end of life care. Now are caring for individuals with psychiatric conditions, substance addiction. Daily, I am beat up by residents as I attend to them. I do not blame the residents. I know this is a symptom of their condition. However, the fact remains that my coworkers are constantly being asked to do more with less. To address these challenges, we need more staff. We cannot be expected to provide quality care with the staffing level we have. I understand nursing homes are struggling to find people who wants to do this work. But because we
Ms. McKenzie, you've hit your 3 minutes. Can you summarize, please?
Okay, I sadly would appear nursing home operators like Trinity would rather advance in good nature to co-workers and then pay a living wages. Personally, I have been enough, will be leaving St. Mary Home in the coming year. At my age, I cannot continue to subject myself to this condition. So please, do right by the home and workers and residents I care for, and take action to address the critical understaffing in the nursing home. Thank you.
Thank you, Ms. McKenzie, for your testimony and your time tonight. Do we have with us Lori Novak?
Oh, yes.
All right, I'm going to turn it over to Representative Johnson, and Ms. Novak, please go right ahead.
So my name is Lori Novak, and I will be speaking on behalf of Eva Val tonight. Good evening, Senator Oyston, Representative Walker, and members of the committee. My name is Eva Val. I work at Newington Rapid Recovery as a dietary aide for over 25 years. We are so short of staff to the point where schedules cannot be filled. There are not enough workers. We recently suffered a layoff due to COVID and the facility's low census, but the new residents coming. The company has not increased the amount of workers allotted. Before the layoff, we would have 1 cook and 4 dietary aides. After the layoff, we were only allowed 1 cook and 3 dietary aides. However, some days we are so short-staffed that there is only 1 cook and 1 dietary aide. On more than one occasion, there was only 1 cook and no dietary aides. It is unmanageable. The cooks are having to do the work of a dietary aide. There are so many holes in the schedules, and dietary workers may be occasionally compensated for picking up shifts or staying late. Other departments are regularly offered bonuses or receive gift cards, but not us. I have worked 14 days straight with no compensation or appreciation. With no staff, the whole process is delayed and meals are being delivered late. We are having to consistently break the food tray line to deliver the meal trucks to the floors, which halts the preparation of the next meal truck's food trays. The residents are the ones who are suffering. Their meals are being delivered late. Do you know what happens when a diabetic resident gets their food late? Their sugar bottoms out, which could be a critical emergency. We need your help. Please step up to the plate and do what's right. We need the increased funding for staffing to help build a new path for today and for all of our futures. Thank you for your time, Eva Val.
Thank you so much, Ms. Novak, for your testimony. It's much appreciated. The next one I see on the list is Elizabeth Frazier, 148. Elizabeth, are you there? Hi, Elizabeth. How are you? You're muted, Elizabeth. Unmute yourself. Can you unmute? Doesn't seem to. It's not working. You're still muted, Elizabeth. There you go.
Oh, okay. Thank you very much.
Sure.
You think I hadn't done this before?
I'm sure you have.
Good evening, Senator Austin, Representative Walker, and Representative Johnson, and members of the Appropriation Committee. I'm Liz Fraser, the Policy Director for the Connecticut Association for Human Services. My complete testimony has been submitted, but I would like to make a few comments this evening. CAUSE opposes the governor's proposed DSS budget adjustment, which seeks to reduce the temporary family assistance line by $5.5 million and eliminate the annual COLA for families receiving temporary family assistance. The proposed adjustment is disturbing. Connecticut has a filled rainy day fund, is on track for a large budget surplus, and for those who can afford property, there's a proposal for property tax relief. Reducing funding for the one cash support program available for families who are in extreme economic distress is beyond comprehension. Over the past 20 years, the Connecticut TFA cash assistance caseload has consistently declined, and at a much greater rate than the decline in poverty or even deep poverty. However, this is not due to the success of the program. It has more to do with eligibility income limits, how eligibility is determined, and the short time period that parents have to train and get a job. Meanwhile, census data tells us that between 2015 and 2019, there were approximately 97,000 Connecticut children living below the federal poverty level. And in 2019, over 44,000 Connecticut children living in deep poverty, which is defined as 50% of the federal poverty level. The majority of these children are children of color. This is just not a success. Now is the time to question which families and children we are leaving behind and what steps we must take to ensure there is a path to economic stability for every family and for every child. For the most economically challenged families, it begins with TANF reform. We ask you to keep the 5.5 million, there's another 2 million for SAGA in the budget, and take the additional steps necessary to make the TFA assistance program a stronger program with the supports that lead to economic self-sufficiency. Lapsed funds should be used to provide additional resources to the families it is intended for. We ask you to keep the TFA COLA in place this year and going forward, to use the federal poverty level to determine program eligibility rather than the outdated statement of need formula, to increase the TFA time limits from 21 months to 60 months, allowing increased time to stabilize and participate in longer-term training and education programs, eliminate the asset test, and increase the earned income disregard, allowing families to earn additional money as they're ready to exit the program. The purpose of TFA is to provide cash assistance to the most economically unstable families and create a pathway for family economic stability. Cash assistance works. Cash assistance helps families meet basic needs, can stabilize a family budget, promotes economic and racial equity, and can help children succeed. As demonstrated by the federal child tax credit, cash in the pockets of parents has been proven to move children out of poverty and increase family stability. TFA is the only cash assistance program in place in Connecticut and is specifically for those families in the greatest of need. We ask that we do not keep leaving these families and children behind, unable to access the kind of life that we all would like to lead. Thank you very much.
Thank you so much for your testimony. Very much appreciated. Next,
you.
the Amanda Skinner. Please proceed, Amanda.
Hi, thank you so much, Representative Johnson. Senator Ostin, Representative Walker, Representative Johnson, and honorable members of the Appropriations Committee. My name is Amanda Skinner, and I'm President and CEO of Planned Parenthood of Southern New England, testifying regarding the Human Services budget of House Bill 5037, an act adjusting the state budget for the biennium ending June 30th, 2023. As the state's largest provider of family planning and sexual and reproductive health care to 63,000 patients at 14 health centers across the state, Planned Parenthood believes all patients should have access to quality, affordable health care, regardless of who you are, where you live, your income, or if you have health insurance. We are compelled to speak out about the importance of the Medicaid program to our patients, half of who are enrolled in the Husky Health program, and the importance of investing in family planning providers. As a healthcare provider, we thank Governor Lamont for prioritizing strategic investments in women's healthcare and family planning in his budget adjustment, including a Medicaid reimbursement rate increase for family planning providers. Our Medicaid reimbursement rates have not changed since 2008. However, our staffing costs in our health centers have increased 63% since then. This is an urgent sustainability issue for PPS&E and the patients we serve. 50% of women in Connecticut between the ages of 20 and 44, under 250% of the federal poverty level, have visited a PPS&E health center at least once in the last 3 years. And for 6 in 10 of these women, PPS&E is the only healthcare provider they see all year. Medicaid reimbursement for family planning services puts more resources into preventive healthcare, a crucial investment with long-term public health benefits. Further, PPS&E must make significant compensation advancements to be a fair and competitive employer and to attract and retain a clinical workforce that is representative of our patients. Our Medicaid reimbursement for office visits is a fraction of the Medicaid OBGYN rate. Additionally, Medicaid reimbursements cover less than 85% of our associated visit costs. We respectfully ask for an increase in these rates to match the OBGYN fee schedule. The public investment in family planning programs and providers is a smart state investment. These investments help avoid unintended pregnancy, cervical cancer, HIV, and other sexually transmitted infections, infertility, and preterm and low birth weight births. For a majority of these services, the federal government provides states with an enhanced match of 90% for family planning, a higher rate than for other services. Further, PPS&E believes that all children and adults need health insurance to work, learn, and thrive. Expanding the Husky program to cover all income-eligible immigrants who are pregnant, postpartum, or under the age of 8 in 2021 was a huge step forward, but it was not enough. We therefore also urge the committee to consider addressing the coverage gap by incorporating solutions to expanding healthcare coverage for all immigrants in our state. Planned Parenthood plays an indispensable role in providing family planning care in Connecticut, and increasing family planning Medicaid rates will strengthen patients' long-term access to essential preventive health care and help ensure equitable compensation for a clinical workforce that is representative of our patients. All people need and deserve equal access to comprehensive health care, including sexual and reproductive health care, as a basic human right. We thank the Lamont administration and this committee for strengthening reproductive health care access by investing in family planning providers in our state. Thank you very much.
Thank you so much, Ms. Skinner. I appreciate your testimony. Moving on now to Sharon Hiddle, number 151. Is Sharon there?
Good evening.
Hi, Sharon. Thank you so
Hi.
much.
My name is Sharon Heddle. I'm the Executive Director of Disabilities Network of Eastern Connecticut, one of the 5 independent living centers in Connecticut. I'm also the chairperson of the Connecticut Association of Centers for Independent Living, a collaboration of the 5 independent living centers. I thank you for your continued support of the independent living centers and ask that you increase the funding for the centers by $1 million annually. Our current state budget provides each of our 5 independent living centers with $92,000, plus an additional $60,000 that is exclusively for providing deaf services. In 2004, the Connecticut State Plan for Independent Living, created by the governor-appointed State Independent Living Council, set a base level funding for each of the independent living centers at $550,000. We've never reached that base funding amount, and in fact, in some years, we have faced significant decreases that have not been restored. The decreases, combined with the cost of living increases, have resulted in each independent living center needing to make tough decisions, which have included reducing the number of towns we can provide services, creating waiting lists, and reducing our staff. Increasing our total funding by $1 million will get us closer to the base amount of $550,000 per independent living center, and will restore and expand our services to people with disabilities. Independent living centers provide each of our consumers with an independent living plan, ensuring each person's unique needs are addressed specific to the individual. We assist all people with disabilities, regardless of their age, income, or the type of disability they have, helping them to work toward achieving their goals. The Connecticut Association of Centers for Independent Living supports the governor's proposed funding for increasing vocational services, technical education, mental health, and domestic violence services. All are opportunities to improve independent living for people with disabilities. And with increased funding for the independent living centers, we can be a valuable resource and partners in those initiatives. I urge you to increase the funding for the independent living centers by $1 million or more. Thank you.
Thank you so much for your testimony. It's much appreciated. Moving on, are we looking at Marcel Torres? Is that someone who is didn't get a chance to speak before on 138? Okay, if not, let's see. We'll go on to Bryn Haig.
Yes, I'm here.
Oh, okay, Marcel. Please proceed, and thank you. I didn't hear you before, so please feel free to go ahead.
Okay. I am a member of the Union 1199. I'm here asking for funding for a proper contract for PCA workers that right now are struggling to make ends meet. We are here asking for proper funding to be able to have time off, to be able to have health insurance, to be able to have some form of retirement, to be able to have basic worker rights. We are, in my testimony, in the time that the surge came for Omicron, I have lost 70% of my income in the month of the month of January. I didn't have no time off, paid time off. I didn't have no sick time. I don't have health insurance currently. We're asking for these because many of us PCAs are struggling to make ends meet. We are essential workers, but we are not getting the proper funding that we need as essential workers. We work with clients that may or may not have COVID, may give us COVID. And when we do contract COVID, we have to take time off that is unpaid. I believe this is not fair treatment for those that are essential workers and that put their life on the lines, like us, the PCAs. And I ask for proper funding, for a proper contract for us, the PCAs, to be able to sustain ourselves and not depend on other resources of the government that are Husky. And many of the PCAs depend on Huskies because they don't make ends meet. We're asking for proper funding of the PCA contract with the state, and so that we can have a better life. Thank you.
Thank you so much, Mr. Torres, for your testimony. It's much appreciated. Moving on to 152, Brian Hickey. Are you there, Brian?
Yes.
Okay. Oh, Bryn, I'm sorry. I'm sorry.
It's okay. My name is Bryn Hickey. I am the program director at Disabilities Network of Eastern Connecticut, one of the 5 independent living centers. We serve the New London County area. And I thank you for your support of the independent living centers. And we're asking that you increase the funding to the independent living centers by $1 million annually. That would give each center $550,000 to be able to increase our services, increase our catchment areas, and which now in the time of the pandemic is even more important than ever. Through the pandemic, individuals who had not ever heard of the centers before have now found the centers and are reaching out to us for services. And currently that's being covered by special funds of COVID. But those consumers are going to stay with us even after funding has gone away. And so this is an even more crucial time to be supporting the independent living centers so that we can provide these crucial services to people of all disabilities and all age groups across the whole state of Connecticut. And this will enable us to be partners with all the other nonprofit agencies that are out there working together to improve the social service network. Disabilities Network does support the governor's proposed increases to the other nonprofit organizations. We ask that the independent living centers funding is increased as well so that we can improve services to people with disabilities in the community. So we're urging you to increase funding to the independent living centers by $1 million or more this year. And I appreciate your time and have a nice night.
Thank you so much for your testimony and taking the time this evening. The next person on the list is Lisa Emmer, number 153. Lisa Emmer.
I'm here. Can you hear me?
Okay. Yes, I can. Very good. Please proceed.
Cell phone. So bear with me. I'm here.
Okay, great. Go ahead.
Thank you. Good evening, Senator Osteen, Representative Walker, and members of the committee. My name is Lisa Emmer, and I am a certified nurse's aide. I have not always been a CNA. I have a college degree and business experience, but due to layoffs, I pursued a new career at an older age. I had no interest in going back to school, and I saw the need for this line of work. It was a real eye-opener, and I have the utmost respect for my coworkers who have been doing this type of work their entire lives. I have been working as a CNA at Harrington Court in Colchester for 14 years. I really enjoy my work and the relationships I build with my residents. I am 68 years old. Let me repeat that, 68 years old. Old enough to have retired 5 years ago, but I cannot afford to retire. This line of work is the backbone of the industry as we provide the most essential and personal care of residents daily. The workload is extremely heavy. We have no staff and CNAs are doing double the work assignments with no compensation. We do not receive extra pay for working short-staffed, and management of our nursing homes do not receive any punishment when they make us work short-staffed. I may be older, but I am dependable. I continue to show up, not knowing who else will show up. There are so many nights that I am alone to care for up to 20 residents, especially on the weekends. There are names on the schedule, but no one knows who they are. These are the names of CNAs or nurses from the pool agency staff that have signed up to come in, but do not show up. The state needs to hold these pool agencies accountable. How are they allowed to be paid triple the pay, come in as they please, or not show up at all? They are not invested in working at our facility and not invested in giving quality care to the residents. They get paid triple to do less work. They are the body. They are not held accountable for work that they do not do, such as charting. After I work my 8 hours alone to care for 20 residents, I am then told that I have to stay for another 8-hour shift. I am beat, tired, and held hostage. Mandating happens on a regular basis, and this is not fair. We are burnt out physically, mentally, and emotionally. We are not compensated and then are threatened with discipline if we cannot stay or fall asleep while on break. How is that fair? If you do not prepare to work doubles, fatigue kicks in. The next day, my body is sore and I have difficulty sleeping, become restless, and am too tired to do even the most basic of my own personal tasks. We all have our own medical health problems to deal with. We are human too. Something needs to be done. We all have a common goal to give our residents the best quality care, that the state provides these nursing home companies the funds to do so, but yet are not held accountable when they do not. We cannot continue on like this. No one is coming to work in nursing homes. When the new hires do show up, they never return. They are not even giving a professional 2-week notice. Nursing homes cannot afford any further cuts. We need the funding for staffing. These younger generations are not interested in working in this hard for such low wages. At the rate things are going now, who will be there to take care of you? Thank you very much for your time.
Thank you for your time and your testimony. It's much appreciated. Moving on to Denise DeVayo. Denise, are you there?
I am, thank you.
All right, please proceed.
Thank you. Good evening, Madam Chair and distinguished members of the committee. Thank you for the opportunity to testify on HB 5037. I'm Denise DeVayo, the CEO for SARA Inc. We are one of the state's largest early intervention providers, also known as Birth is Free, delivering supports to children and families in 50 towns across 5 counties. Connecticut's 19 early intervention providers serve nearly 10,000 children a year. These services are provided at the most critical stage in a child's development, setting them on a path to achieve their academic, vocational, and social potential. While there has been much discussion over the years on the chronic underfunding of human services, the impact on early intervention has been a lesser known issue. I can assure you it is no less dire. Simply put, Connecticut's nationally renowned early intervention infrastructure is unraveling. Of the 19 providers, at least 60% are facing unsustainable financial deficits. Service rates have not increased for years, and those changes last took place as a result of going from a bundle to a fee-for-service billing structure. Providers understand that since we are Medicaid funded, fee-for-service is seen as a billing best practice. However, historically thin operating margins are stretched even thinner with the fee-for-service model, and over the course of the pandemic, that margin has evaporated. Much of this is related to the non-billable demands of the high-quality services we deliver. These include months of initial and ongoing staff training, completing very complex assessments, and travel time between families, especially in the less densely populated areas of our state. It must also be mentioned that early intervention providers did not receive any ARPA payments to provide relief during COVID, and we were not included in last year's legislative funding increases for nonprofits and human service agencies. Our primary cost is paying the clinicians and therapists needed to evaluate and work with the state's most vulnerable children. These are highly educated and skilled staff, most with advanced degrees, including PhDs. Providers have always had difficulty recruiting staff due to our inability to compete with wages and benefits offered by other settings such as schools and clinics. After 5 years, including 2 in a pandemic, it has become even more difficult to hire and keep staff, with vacancies taking months, even up to a year to fill. Chronic staffing vacancies mean a break in service continuity, and for the example with autism assessments, children can wait several months for an evaluation. This is precious time lost to help children in the brief and invaluable 0 to 3 age window. The dollars needed to properly fund early intervention services are without a doubt one of the best investments Connecticut can make in its children. I would encourage you to read the article submitted with my testimony from Nobel Prize-winning economist John Hankman, known for his work on the economics of human potential. Investments made in the first 3 years of a child's life will pay off for decades with better school performance and employment opportunities, and turn into stronger communities and, yes, a healthier and better economy. For the sake of today's children and future generations, please include birth to 3 in any additional funding for community human service agencies, revise regulations to provide timely and predictable early intervention rate increases, pay for non-billable indirect services by increasing the funding for that monthly general administrative payment to $200 per enrolled child, and immediately increase birth to 3 rates by 10%. Please don't let the potential of Connecticut's children slip away. Thank you for your time. And I know it's been late and you've had a long day. If you have any questions, please let me know.
Thank you so much. Thank you for being here for your testimony.
Thank you.
Okay, moving on to 157, Laura Nassar. Laura, are you?
I am here. Hello.
Hello. Thank you so much for being here. Please proceed with your testimony.
Good evening, Senator Osteen, Representative Walker, then the members of the committee. My name is Laura Nassar, and I have been a PCA for 8 years. I live in Wallingford, and I love my consumer. I am a caretaker at heart, and I am lucky that I get paid to do what I love. It is satisfying to care for someone else's needs. There is nothing that I don't do for him. I go to the grocery store. I take him to every doctor appointment. I run every errand. I cook and clean. There's nothing I don't do for him. He is in a wheelchair full time, and I take a lot of pride in the fact that I could help him. It's important to me to be there for him because he's not able to take care of himself, and he can't be independent without assistance. So, like I said, I love him. He calls me on off hours for help. I'm there. I don't get paid for it. I do it because he needs the help. He gets nervous and he won't be able to get out of bed or eat without help at times. If I was able to work more hours with him and get paid for them, he would be able to he wouldn't feel bad about calling me on off hours, but I would be able to spend more time with him, giving him care. The lack of paid time off, mileage reimbursement, like I said, I take him to every doctor's appointment. Health insurance and retirement frustrates and worries me. And when I get sick, I don't have to go, I can't go to the doctor. I have to treat myself. I am late on my rent every month. I have to wait 1 or 2 paychecks to pay for rent. And I miss a paycheck, it throws me off longer than a month. I don't get mileage reimbursement, and I use my car mainly to do the things for my client. I am often home without gas because I need to make sure I have enough gas to make sure my client's needs are met. I feel like I work for Bank of America most of the time because I have so many late fees that it's 3 hours of work out of my check every week. So I don't work for Bank of America, but I feel like I do. I have a very small studio for myself, and I make enough money just to cover that. And if there's anything else that comes up above, there's no money. I could, like I said, I could retire at lunchtime the day of my funeral because we don't have any retirement. On February 17th, I protested and got arrested with my sisters and brothers for PCAs. And I wouldn't have done that if I didn't feel it was necessary to protect the services for my consumer and get better wages and benefits for myself and other PCAs. Thank you so much for listening. And I hope everyone has a great night.
Thank you so much for being here this evening, and thank you for your testimony. Moving on to Bob Santos, 159. Bob, please proceed.
Hello, I am Bob Santos. I'm an organizer for 1199 Union. I'm reading this testimony on behalf of a CNA that can't be here due to short staffing at his nursing home. Thank you. Good afternoon, Senator Austin, Representative Walker, and members of the committee. My name is Terry F. Yonai. I work at Genesis Healthcare at Fox Hill as a CNA. I've been working with the company for 25 years. I have seen it all over the last 25, but until COVID hit. When COVID came into our building, fear and anxiety became part of our uniform. Some of our staff with already compromised health conditions started to get sick and they never returned. This was the beginning of our nightmare and frustration of staff shortages. I used to care for 13 residents. Now on a good day, I am having to care for 18 to 20 residents alone. We need to have LPNs and RNs come in on their day off to be a CNA. In order to fill any opening holes, everyone needs to work on their days off. If you do not come on your day off, on your well-deserved day off, then you are considered not to be a team player. We are all exhausted and burnt out. To make matters worse, we have a pool agency staff that comes to help us, but they do less work than us. These CNAs and LPNs come into our facility to brag about how much more they are getting paid than us. CNAs are being paid about $30 an hour, and LPNs are being paid $40, some even more, which is very frustrating and discouraging to hear. There are no repercussions for when they do not follow the state and facility procedures and guidelines. They do not care about our residents. It is just a paycheck to them. We need help. We need help to give the quality care for our residents that what they deserve. They currently are not getting the care they need. There is not enough time in a single shift to provide care to all of our residents. The residents feel like they are being punished and abandoned because they're unable to care for themselves. Please help make that positive change. Thank you for your time. Terry F. Yonai. I thank you for giving us the opportunity to give our testimonies. Thank you very much.
Thank you. You're very, very welcome. And thank you for taking the time to provide us with that information. Moving on to Paul Listro, 163. Paul, are you there?
I am.
Good evening. Good evening.
Good evening, Senator Austin, Representative Walker, and members of the Appropriations Committee. My name is Paul Listro. I'm the CEO of Manchester Manor in Manchester, Connecticut. Manchester Manor has been providing nursing home care in our community for nearly 60 years. We are a second-generation family business, and we have 170 employees working at our facility, and we are members of the Connecticut Association of Healthcare Facilities. In the nearly 60 years of providing rehab and nursing care to our residents, these last 2 years have been a living hell. Now, 2 years into the unrelenting COVID-19 pandemic, the public health emergency, and all I can say is the nursing home, the residents we serve, and the employees continue to be challenged. I can also say that our nursing home is as determined as ever, as we feel each week is getting closer to the time when we can say the pandemic is behind us. The pandemic will become endemic, but we need your assistance. Our residents and staff are experienced and dealt with nearly every feature of the pandemic from the very beginning of spring 2020, when the misunderstood virus was spreading through the persons showing no symptoms, especially in regions of Connecticut experiencing high rates of community prevalence, to the most recent Omicron outbreaks experienced almost in every Connecticut nursing home. We saw firsthand the consequences of a lack of COVID testing, and here in Connecticut, the extreme shortages of PPE and ever-changing CDC, CMS, and DPH guidance. We experienced the severe and emotionally devastating visitor restrictions imposed early in the pandemic, and we have experienced the optimism of what the COVID vaccine and now booster means to the community. While the trauma our residents and caretakers faced was extraordinary, I can say that their resilience and determination was equally extraordinary. With severe staffing shortages our nursing home face is is far and above the most significant challenge we are dealing with. The staffing shortages our nursing homes are experiencing are like no other in all the years of providing skilled nursing home services. For example, recruiting was compromised by fear of becoming infected, of a lack of knowledge about the effectiveness of source control PPE, by third-party agencies paying rates to our own staff 2 and 3 times what we could afford, and changing and confusing guidance from the government. The staffing shortages are so significant that our nursing home routinely refuses hospital admissions as we are not able to address the care needs of additional residents without staff. No staffing, no admissions. But the demand is there. Elective and emergency procedures and follow-up hospital visits are occurring in hospitals. No staffing, no admissions. Consequently, the occupancy in our buildings is much lower than normal. It's not at all the true reflection of the need or demand for our services, but it is a reality. Our nursing homes labor-related costs began an unprecedented dramatic rise in last fall and is showing no signs of relenting. Costs impacted, 1, by the agencies charging egregious fees for temporary help, 2, individuals demanding more money, and 3, the rampant wage inflation in unskilled warehouse positions. Our nursing home has been very negatively impacted by the staffing shortages in so many ways, but the impact of having to turn to nursing staffing agencies has been particularly troublesome. From the patient care perspective, it runs counter to the consistent assignment of staff that has been our longstanding practice. The financial consequences have been enormous. Imagine paying 2 to 3 times for an agency staff over your own staff. It creates acrimony.
Mr. Ostro, could you please summarize? We're a little over the 3 minutes.
The pandemic has breached normal course of things. Long ago, paying underfunding philosophy is in the past. Now caregivers and nursing homes want to receive a true living wage with full benefits. The state has the money. We simply need a plan. Thank you. I'd be happy to answer any questions you have.
Thank you so much for your testimony. Very much appreciated.
Thank you.
Moving on, Audrey Julian, please proceed. Thank you for being here.
Okay, thank you. Good evening, everyone. I'm here to offer my testimony on the Department of Social Services budget related to residential care home funding. My name is Audrey Julian, and I am the manager of Morning Star Residential Care Home located in Kent, Connecticut. I'm here to raise concerns with the governor's budget related to residential care homes and express the strong need for rate increases. Morning Star is an 18-bed RCH, and our residents have lived here for a long time. They range from individuals who are ambulatory to residents who need assistance with 1 or more activities of daily living but are not qualified to be in a nursing home. Due to the age and medical conditions of these residents, they slowly decline in ADL function and mental status. We maintain the residents at Morning Star by relying on community resources which are paid for by Medicaid. The services are limited and the residents are attended to for only maybe 1 to 5 hours a week. When outside caregivers leave the premises, the staff are left in the position wherein they would be automatically responsible for the care of the residents. And it's sad to say that while the residents slowly decline in their functional and mental status, the staff and of the residential care home perform the responsibilities of a home health aide or a CNA or a worker employed in a big institution that can afford to pay the employees a lot more and give them vacation days, sick days, and full medical benefits until the residents are evaluated to be of nursing home level. The residents and families are hesitant to agree to a nursing home transfer due to the fast decline once they move from the residential care home and due to COVID infections. And we did experience this in the past 2 years, wherein we had 2 residents after they moved, they passed away. If we had the monetary resources to hire an extra hand, we could have kept these residents here as long as we reasonably can. And with the quality of life still the same, and their last days would be more serene. Last year's budget included transfer of some residential care home spending to Medicaid. The shift was done to save the state money and provide residential care homes with much more resources. And it was supposed to have come into effect on April 1, 2022. But despite our association's meetings with the Department of Social Services for several times, there has been no operational plan yet. So we value our employees and who deserve so much more. During the pandemic, the staff had to do more than 3 meals a day, laundry, housekeeping, medication supervision. And since behavioral care doctors, primary doctors, and social programs were not available, the staff had to spend longer hours and keep more time with the residents, keep them occupied to decrease their mental decline and physical well-being decline. So the staff had to double up on their duties to keep the facility sanitized and assist the residents in doing Zoom doctor's appointments and also learning. It was a learning experience with the staff too, who had no basic computer skills. And it has been 2 years since the pandemic, and we had not a single case of COVID among our residents. And the inconsistent funding also challenges our business operations. We are constantly having to make repairs and that are subject to state inspections, and we have no margin to do so. At present, our roof is leaking. We need our windows done. We need our sidings done, which would save on the utility expenses. However, it would cost around $70,000 for repairs. And I attempted to get a grant from the town and from nonprofit organizations. And it is very tedious, especially that we are considered for profit. Doing this would have me disclose our financial situation. And it just hit me right now because the administrator who does everything that almost a nursing home administrator does only receives less than $60,000 per year, with a responsibility of med supervision, caregiving, budgeting, transportation to doctors, dietary, housekeeping, and dealing with the audits. So the administrator deserves much more. And
thank
the
you
staff,
so much for the,
yes.
excuse me, you're
Yes.
exceeding your time, but thank you so much for this excellent testimony. Please summarize.
Okay, so unlike other providers in the pandemic, we did not see any federal funding to support our employees and our workers. My home and other residential care homes throughout the states are getting by with low rates with the population aging. So we really, please support us and give us the funding that we need. And as we support the residents in our residential care home, and maintain them so that they could live in the comfort of their own home until they die. Thank you.
Excellent. Thank you so much. Have a great evening. Moving on to Tracy Shatini. Are you here? 164.
Hi, yes, I'm here. Thank you so much, Representative Johnson. Thank you. And Senator Austin, Representative Walker, and members of the Appropriations Committee. My name is Chrissy Scatini, and I'm the director of the Palace Adult Day Health Center Complete Care Program in Bridgeport. And I'm speaking today on behalf of the Connecticut Association of Adult Day Services, for which I am currently serving as the Vice President of the association. I appreciate the opportunity to testify, and we're here to speak in strong support of the ARPA HCBS reinvestment plan. The federal ARPA initiative provides a perfect opportunity for the state to make needed reinvestment of federal funds into the Connecticut Home Care Program for elders and provider rates. We know this investment will strengthen the community-based provider network, enable a successful rebalancing of the long-term service and support system, and ultimately save the state money. Adult day centers like ours are just one of the covered services in the home care program for elders, and we're also utilized by many families in the statewide Alzheimer's respite program. Adult day services are truly a valuable and cost-effective community-based option. Within our centers, we provide seniors with a full day of programming, supervision, assistance, socialization, and respite for families throughout the state. The current Medicaid rate of reimbursement for a full day of a medical model adult day service remains at $74.74 for the full day, which includes door-to-door transportation, nursing services, personal care service, daily exercise, activities, 2 meals a day, and many more services, all while allowing seniors to remain living at home and being part of their community. We do anticipate a rate increase, a stabilization payment, once this section of the reinvestment plan for waiver service rates receives the final approval from CMS. This increased funding is urgently needed as our adult day centers are struggling to meet the costs of providing our services. We've seen a huge increase in expenses such as food, transportation, as well as payroll expenses, which are constantly going up due to the serious workforce shortage that many other providers can relate to and have described here today. Community-based providers like adult day centers are meeting the growing needs of Connecticut's older adults while preventing or delaying placement in skilled nursing facilities, which, as you've heard, are already facing serious burdens. And we can also help to prevent and reduce the need for more expensive healthcare, such as emergency rooms and acute care hospitals. In fact, we believe that it would be beneficial to incorporate adult day services into the Medicaid state plan rather than keeping it exclusively as a waiver service, which could create further savings for the state and allow many more seniors the option to choose adult day service versus the more expensive alternatives. And it would allow them to remain living safely at home and in their community. We really hope that you would support us in that endeavor. In conclusion, we'd just like to thank you once again for the opportunity to provide this testimony, and thank you for your ongoing support for adult day services. We'd be happy to meet with or speak with any of you further at any time to provide more information or answer any questions. I did my best to speak quickly and keep it in the time limit because I know it's been a long day and evening for everybody, but hopefully you can all still understand me and hear me through Zoom. We really appreciate it. And again, looking forward to working with you further. Thank you so much and hope you all have a great evening. Thank you.
Thank you so much for your testimony and you're much appreciated. And thank you for taking the time.
You're very welcome. Take care.
Yeah, you too.
Representative Johnson?
Yes, Susan.
We have speaker 160 who's been waiting to be called.
Oh, I'm so sorry. I didn't see that. And there's some of them I've seen that I thought that I had already called upon. So thank you for that.
Thank you.
Please proceed, Joanna Schubert.
Hi, good evening. Thank you so much for your time tonight and for all your patience. My name is Johanna Schubert, and I'm testifying today in support of allocations of funds through DSS to support Public Act 2136, an act concerning the availability of community violence prevention services under Medicaid. I work at Hartford Communities That Care, a nonprofit located in the north end of Hartford. Our agency works directly with gunshot victims and their families using the evidence-based best practices model, Hospital Violence Intervention, or HVIP. This model engages with the victim and their family right after an injury, often at bedside in the hospital, where research has shown there is a golden moment to build a relationship and change outcomes. Our team of frontline violence prevention professionals, alongside case managers and other staff, work holistically with families. We connect families with trauma-informed and culturally aware mental health services, in-home nursing and doctor visits, support through any justice involvement, and in worst-case scenarios, funerals and family support after loss of life. Hartford Communities That Care, along with its hospital partner, St. Francis, have provided this opportunity of support to over 1,800 victims since our partnership began in 2004. The HCTC and St. Francis partnership was the first HVIP to be recognized in the state of Connecticut by the Health Alliance for Violence Intervention, or the HAVI. I want to thank the legislature for understanding the importance of this work and for supporting HB 5677, now Public Act 2136. This bill was passed unanimously out of the Public Health Committee, the House, and then the Senate last year. Since its passage, conversations with DSS on the logistics of Medicaid support for certified VPPs have been ongoing and productive. We look forward to being able to collaboratively lay the foundation to compensate these hardworking individuals who choose to make violence prevention a career. We have sent the members of this committee a packet before the hearing with 4 documents we feel give a comprehensive snapshot of why funding violence prevention through Medicaid is a sound financial move for the state. In short, those 4 are a fact sheet on HVIP with more information on this best practice, an ROI study of 82 victims in Hartford showing that Medicaid reaps $8.88 for every dollar invested, a snapshot of Hartford area hospital data from 2021 showing that 2/3 of gunshot victims are Medicaid patients. This statistic tracks with national data, and a link, lastly, to the report of the Gun Violence Intervention and Prevention Advisory Committee. This committee was convened in 2021 through SB1, which brought together experts across the spectrum of gun violence prevention to make recommendations to bring rates of violence down. Thank you so much for your time tonight, and I'll happily answer any questions.
Thank you so much for your testimony. Really appreciate it very much.
Thank you.
Okay, moving on to Jen Schimmerling, number 165. Please proceed.
Thank you. Senator Austin, Representative Walker, members of the Appropriations Committee, thank you for the opportunity to speak to you this evening about the state budget. My name is Jim Schmerling, and I'm President and CEO at Connecticut Children's Medical Center. As the state's only health system focused exclusively on the needs of children, we have a unique perspective to share. I've submitted my full testimony for your review, but did want to highlight a few things in my remarks this evening. While the past 2 years have been difficult for all of us, we know that the pandemic has been especially challenging for children. Children have faced isolation, disruption in their school schedules, and changes to family structures. We can help children come back stronger if we all work together to prioritize critical investments that strengthen families. The governor's proposed budget includes many measures that illustrate how public and private leaders can work together to improve the physical and emotional health of children. We applaud this focus and especially recognize the commitment by state leaders to address the current children's behavioral health crisis, which existed before the pandemic and has resulted from years of underinvestment in children's emotional well-being. As the state's largest provider of emergency behavioral health services, we've witnessed every day the impact the pandemic has had on the mental health of children and families. We appreciate the suggested investments in short and long-term solutions that more efficiently connect children to the care they need. It's with this in mind that we envisioned a new medical psychiatric unit at Connecticut Children's, where we'll be able to simultaneously address the physical and behavioral health needs of children and shorten the time children must wait between identification, treatment, and improved health. We are primed and ready to work with families and community-based providers to ensure this unit is impactful and reflective of the growing demand for care. We recognize that this investment is only one way we can partner with state leaders to improve children's health. We also seek your partnership to address the social factors that impact families. Only about 10% of children's overall health is determined by the healthcare services they receive. In partnership with state leaders, community-based organizations, public health offices, schools, and families, we're working to address the social determinants of health, like building quality housing, creating strong family structures, and ensuring access to healthy foods. If successful in these efforts, we can collectively prevent illness before it starts. We know that this is the right approach for children, and we urge state leaders to support investments and program changes that will address these upstream efforts to keep children healthy and thriving, especially in underserved communities. We can also support family resilience by implementing innovative payment structures that support the connectivity between community-based organizations, providers, and hospital systems. We believe state leaders are in a strong position to advance innovative payment structures which foster the utilization of tools like care coordination and home-based care. These types of innovation will move the state one step closer to addressing health disparities and improving outcomes for the most vulnerable children. We welcome the opportunity to partner with state leaders around more holistic approaches for building resiliency in families by ensuring that they have what they need to succeed. The resources the state chooses to invest in children are just that, an investment. When the state supports early childhood development programs, it can have a lifelong impact on their physical and emotional health. By investing in our youth and advancing policies that support their health, we can strengthen the state's future workforce. We're grateful for this focus on children and for the support our organization from the governor's administration and legislative leaders. We value our role in caring for many of the state's children and look forward to future collaborations with you. Thank you.
Thank you so much for your testimony. Moving on to Cecil Smith, number 166. Is Cecil Smith there? Okay, if we don't hear from Cecil Smith, 166, then we'll move on to Joyceanne Alex. 168, Joyceanne. I see you there, but you probably can't hear me. 169 is Mike Whalen. Mike Whalen, are you there? 170, Allison in Manchester.
Hello.
Mike Whalen seems to have, did you hear me? Mike, you can proceed if you would like.
Yeah. Good evening. My name is Mike Wells. I'm a consumer employer for my savings. I was one of the first consumers on the waiver program. I've been hiring PCAs since 2007. I'm lucky to have 4 PCAs that have been with me for a very long time. Over Christmas, I got COVID, and unfortunately, 2 of my PCAs got sick too. It hurts me that the state of Connecticut does not give them any paid sick days when they get sick. It's very unfortunate, but my PCA can now continue to care for me while she was sick with COVID, both because she couldn't afford not to work and because it's pure and simple. If my PCAs don't come, I don't get up. But because she could not take time off to heal, we kept passing the virus back and forth. PCAs are human beings. They deserve the same dignity and respect we demand from ourselves. If they had health insurance, there would be less illness passed back and forth. We have made significant progress in the last 10 years, but myself and my PCAs deserve better. Thank you very much for your time.
Thank you so much for your testimony. It's very much appreciated. Have a good evening.
You too.
Thank you. Moving on to Joyce-Ann Alex, I think.
Hello.
Hello, how are you? Thank you for being here today. 168, please
Yes.
Thank you.
Yes. Can you hear me?
Yes, I can. Thank you so
All
much. I called you before, but I don't think you heard me initially. So.
Oh, yeah, I stepped away a little bit. Thank
No
you
worries.
so much.
Thank you.
Good evening, Chair, Senators, distinguished members of the Appropriation Committee. Thank you for your time tonight. My name is Josiane Arix. I live in Meriden. I am an advocate for people with disability and the board member at Independence Northwest, one of the Connecticut 5 independent living centers. I'm here to ask for an increase in funding for all 5 independent living centers because these centers have changed my life, but also many lives, but including mine. For the past 6 years, I have struggled with a chronic illness and pain, often debilitating physically and mentally. This obstacle almost caused me to give up my education dreams because I was struggling to care for my health and make ends meet. Thankfully, I was referred to Independence Northwest, where I was in school. I relied heavily on the center's housing services that helped to become more independent. As a result of the Independence Northwest services, I was able to finish my education, obtain a bachelor's degree from University of Connecticut, apply to medical school, and have been admitted to a master's degree program at Yale School of Public Health. The Centers of Independent Living are the first place to get accurate information related to anything disability. If these centers are closed, essential services are received and many other people with disabilities receive the help they receive that helped me achieve my education and autonomy will not be free and accessible. In addition, Many people with disability, children, adults, elders here in Connecticut, they would not be able to receive vital support services, and many will be stuck in costly institution settings. Please increase the funding for Independent Living Center by 1 million. Otherwise, there will be a severe reduction of vital independent living services across state, an increase in institution placement for individuals with disabilities, and the loss of jobs for numerous individuals with disabilities. Thank you for your time tonight and for your patience.
Thank you so much for waiting and your testimony, much appreciated. Moving on to 170, Allison Manchester. Please proceed, Allison.
Hello, my name is Allie Manchester. I work at Community Health Resources as a Parenting Support Services Supervisor. Parenting Support Services provides support to parents to enhance positive family functioning. We incorporate 2 evidence-based curricula into weekly meetings with parents. Therefore, it takes several weeks for new staff to be trained and accredited as instructors for these curricula. It has been an ongoing struggle to staff this program. In the 2.5 years CHR has held this contract, our program has been fully staffed with all staff members being completely trained for only the last 3 months. It seems CHR is able to attract and train talented individuals. However, we are unable to compete with the current job market. Therefore, we are unable to keep employees in these positions and turnover is rampant. The pattern I have seen in recent years is staff joining CHR, gaining valuable experience, and then leaving for better paying jobs with the state. Our grant requires parent educators to have at least a bachelor's degree to qualify for the position. A person without a bachelor's degree can get an entry-level food service job paying $15 per hour. In a comparison, a parent educator starting with no experience is paid only a few dollars more per hour despite holding that degree. Parent educators are doing emotionally taxing work. However, we are unable to pair that responsibility with an attractive salary, so we lose workers frequently. The families are impacted most by high staff turnover. Parent educators have a caseload of 10 to 12 families who they meet with on a weekly basis. When a parent educator resigns, the families who are close to discharge can finish out their program with the original parent educator. However, the families who are only partway through the program or just beginning the intake process must be transferred to a new parent educator. These programs require self-reflection and honesty with oneself on the part of the parent educator, or on the part of the parent. Parent educators must therefore forge a bond with the families, which can take several sessions to develop, especially if a family is skeptical about the program. We do our best to transition families by doing a handoff meeting with the family, the original parent educator, and the new parent educator, but it is more difficult for another staff member to pick up the service once it is already in progress. The original parent educator has an already established rapport with the family, so the new parent educator must begin that process of rapport building all over again. The work we are doing is vital to the community we serve. Please help us maintain the best level of care for the families we support by providing the grants needed to continue services and offer competitive wage for staff to decrease turnover. Thank you.
Thank you so much for your testimony. Very much appreciated. Have a wonderful evening. Moving on to Cecil Smith.
Susan,
yes.
Susan, it's Lucy's turn. Now we're going to turn it over to Lucy now. And we have number 147 and 166 to catch up on.
Okay, I was just going to call on 166, but whichever you prefer.
147 should be first because they've been waiting a long time.
That's fine. Okay.
And then Lucy will be Representative Dathan will be taking over now.
Okay, excellent.
Thank you.
Yeah,
Representative Dathan, 147 first, please.
Number 147. I don't see. Did you see Senator Austin?
Representative Dathan, she's participating. Yes. She's participating by phone, so you will not see her. She's
okay.
in the attendees. So
okay,
we will give her permission to speak.
Okay.
And Rhonda, when you're ready, you can go.
Okay, can you hear me?
Yes, we can hear you. Thank you so much.
Okay, all right. Thank you for getting back to me. I appreciate it. And my name is Rhonda Boisfort, and I'm testifying this evening on House Bill number 5037 concerning residential care home funding. It's my pleasure to speak with you today concerning the funding for all residential care homes in Connecticut. For several years, we have shared our concerns with you about being underfunded and the inability to give our employees a much needed increase in their salaries. My family owns 2 homes. We have a 15-bed facility in Haddam, Connecticut, and an 18-bed facility in Watertown, Connecticut. Our residents are referred to us from families, hospitals, and behavioral health agencies. Our residents struggle to live in the community under high stressors, such as not being able to manage their meals, taking medication, missing important medical appointments, and living in unsanitary conditions. Our homes provide a clean surrounding, nutritious meals, laundry services, transportation to medical appointments, and communication with Social Security and DSS as needed to keep their entitlements current. All of this is provided on average for a mere $88 per day. Our challenges are many. Low wages impede us from hiring good staff and keeping them. We need increases to make repairs on our property. Loans are difficult to get as the residential care business does not show a profit. There are times that owners and administrators wait until the end of the month to cash their check. We have paid our bills with our own personal money and taken out cash on our credit cards to keep our business afloat. High inflation, just like all businesses, has become out of control. When an employee has asked for a ride to work because her gas tank was low and she didn't have enough money to get gas, I thought this should not be happening in the state of Connecticut. Everything that we do to keep our homes up and running has resulted in an increase. Food, gas, and all of our insurances and many needed home repairs are just a few to name. I know that our homes take care of the most vulnerable people in Connecticut. Our rates don't even come close to keeping up with our costs. This is my 12th year testifying for my staff and RCH homes. I went to some meetings last year with board members from the residential care community and DSS. And we were discussing Medicaid billing, and we were informed that this would be a positive step towards helping our financial situation. We discussed having monthly meetings with DSS, and I think we even agreed that we would have those. However, the meetings have not occurred for quite some time now. So that was kind of the light at the end of the tunnel for us, but it faded quickly. We thought that we would be well on our way into this Medicaid funding by now. So I appreciate you taking the time to let me vent and listen to me. And I'm asking you to please help residential care homes. Thank you.
Thank you so much, Rhonda, for your testimony and the important work that you're doing. And we appreciate you coming back every year. It's important to hear your voice. So thank you so much.
Okay.
Yes, have a good rest of your evening. Thank you, Rhonda. Number 166, Cecil Smith.
Yes, good afternoon.
Nice to see you. Good evening.
Yes, I'm Senator Olsen, Representative Walker, and members of the committee. Good evening again. My name is Cecil Smith. I am an employee of iCare and work at the 60 West Nursing Facility in Rocky Hill. I have been working there for almost 9 years. This facility is unlike any other nursing facility in that we only care for residents from the DOC, Department of Corrections, and CVH, Connecticut Valley Hospital. On a full staff, a typical assignment would consist of 6 residents. However, these days we have to care for 10 residents because of because we are always working short staff. A majority of these residents are required an assist of 2 and mental health and behavioral issues. We have to rush our care with limited supplies. When COVID entered our facility in 2020, we were devastated. It was rough. Residents were dying one after another, and staff were asking themselves, who will be next? We were scared to answer the call of duty, but because we had a duty to perform, we toughened it up to combat this disease. PPE was in limited supply. We forced to wear the same surgical mask for 14 days and jumpsuits, even though in these jumpsuits, temperature could reach an unbearable 90 degrees. At the end of our first wave, we lost a total of 10 residents and 1 CNA. That CNA was more than a co-worker. He was my good friend. May his soul rest in peace. In the last 2 years, working conditions were deteriorated a lot at this facility. CNA is constantly working short, and we are working long hours with limited compensation. I say compensation because the company will only give us pick-up shift bonus on weekends and not during the week. The agency staff to work come to work sometimes, but they come in late and do less work. I don't understand how they are really helpful. These working conditions cause a strain on our families, our finances, and our overall mental health. I am here today to let you know that this job is extremely difficult. Not many people in this world have the guts, the determination, and the patience to perform this job and care for our residents, especially at this particular facility. We are urgently asking for our help, for your help. The support you gave us last year was historical, and we appreciate it. But this industry has been massively underfunded for years, and we are reaching out our breaking point. We need more funding for more staff, better wages, and hazard pay for all nursing home workers. Thank you for your time. Have a good evening.
Thank you, Cecil, for your testimony and all your work that you do as a CNA. It's so important, and so many people really appreciate everything. Thank you so much for speaking to us this evening.
Thank you.
Thank you. Next, we have number 171, Joseph Short. Go ahead, Joseph.
Oh, I wasn't sure if I was on. I couldn't see myself.
Yep, you're on. We see you. Thank you so much for your patience.
No problem. Good evening, Senator Austin, Representative Abercrombie and Johnson, as well as all members of the Appropriations Committee. My name is Joseph Short, and I'm testifying on behalf of the Connecticut Independent Living Centers. Thank you for your committed support of this cost-effective program over the past many years that I've been there. But I need you to consider an increase in properly funding the Connecticut Independent Living Centers at $1.75 million so they can meet the growing needs of their diverse communities. About myself, I've been a quadriplegic for nearly 20 years due to a spinal cord injury. At the time of my injury, I had no idea what resources were available or what direction to turn for support. And thankfully, I received guidance from an independent living center. So I was able to learn how to drive with adaptive equipment, live on my own, go back to school, and eventually earn a master's degree in social work. With the support of Connecticut Independent Living Centers, I was able to regain my independence so that I can give back to the community, help other individuals with disabilities. Currently employed as an independent living advocate and youth transitional counselor at Independence Northwest, which is one of the 5 independent living centers here in Connecticut. They offer essential services for children, adults, elders, all types of disabilities. They're the first place to go to get accurate, unbiased information on all aspects of life related to living with disability. As an independent living advocate, I am able to pass on the knowledge that I've acquired to individuals who are in the position I was once in. Connecticut's 5 independent living centers were established back in 1987 with matching state and federal dollars at $200,000 a year. Yet here we are 35 years later. Their state funding has been decreased to $92,000. I've witnessed firsthand the reduction of services and programs offered to individuals with disabilities due to budget cuts that have never been fully restored. Because of budget cuts, the centers have had no choice but to reduce staffing, limit services, as well as drastically reduce service areas. Despite budget cuts in fiscal year 2021, Centers for Independent Living provided over 7,000 individuals with information referral services, transitioned 113 individuals out of costly nursing facilities, prevented the need for emergency health, transportation, and residential supports for over 400 individuals, and provided over. I'm sorry.
Sorry, just a second. If you're not speaking, if you could mute yourself. Go ahead, Joseph.
Okay. And provided over 800 individuals with independent living skills training, peer counseling, advocacy, youth, and educational services. I'm requesting a $1 million funding increase so Connecticut Independent Living Centers can make vital services available to individuals with disability in all areas of Connecticut. Thank you for your valuable time, late nights, consideration, and ongoing support of this cost-effective program.
Thank you very much, Joseph, especially for sharing your story with us. It's very important. I appreciate it. Next, we have number 172, Sandra Roberts.
Yes, hi, good evening.
Good evening.
Hi, thank you so much. I appreciate the Appropriations Committee listening to my statement tonight. I'm here to speak on behalf of the 5 Centers for Independent Living, and we are asking for $1 million increase to properly fund all 5 Centers for Independent Living. They'd like it to be increased to 1.75 million. I currently am employed part-time as an information and referral advocate at the Center for Disability Rights in West Haven. I've been employed there for the past 30 years, and I've also been a recipient of the services of the center. Unfortunately, the core funding has been eroding through the years and has not been enough to assist us in meeting the needs of consumers in our service area. In addition, staff wages are not at a current livable level. This is very concerning. As the part-time information referral advocate, we receive numerous phone calls for assistance for consumers looking for advocacy, peer counseling, and independent living skills training. We do our best to meet the needs of the consumers that are able to come by, but unfortunately, we do not have the staff coverage to sufficiently cover all their needs at all times. And of course, the past couple of years, the situation has been exasperated due to the COVID-19. So we are certainly asking for those funds to be increased so that we can meet the levels of service that our consumers are looking for. As a recipient of the services at the center, I am a woman with a severe physical disability, and without their resources and services, I could have been left in a nursing home after surgery I had 5 or 6 years ago. And it's due to their assistance that I was able to move out back to the community. By moving consumers from nursing homes or preventing them from going into nursing homes, we save the state an enormous amount of money. So I really hope that you will continue to fund the Centers for Independent Living, because our unique services really do a service to people with all disabilities and all ages. And in the long run, we save the state money. Thank you so much for listening to me this evening. Thank you.
Thank you so much, Sandra, and thank you for your advocacy for this important issue. Next, we have 173, Coco Selman.
Good evening. Thank you so much for having me, Senator Austin, Representative Abercrombie. It's a pleasure to see you, Representative Datham. Thank you for taking the time so late in the evening to hear from all of us. I'm the founder of Illume Home Care and co-owner of Allpoint Home Care, a Connecticut home health provider. Our two companies recently merged. I'm also the mother of Amelia, a 20-year-old young woman who requires around-the-clock complex in-home nursing care due to her very complex needs. I'd like to address HB 5037, an act adjusting the state budget for the biennium as it pertains to underfunding in home health services. Allpoint Home Care is a Connecticut licensed and Medicare accredited home health agency providing services to 80 or more towns. We provide nursing, physical therapy, OT, PT, speech, etc. Our patients are 90% funded by Medicaid, so we really focus on the very vulnerable. Our dependence on you today is critical. We specialize in-home complex care of technology-dependent medically fragile children and adults with tracheostomies, ventilators, G&J feeding tubes, and other intensive at-home medical interventions. We also specialize in pediatric home health services and pediatric behavioral health and pediatric diabetes care. So today I would like to talk to you most about the issue related to complex care. You were very generous. The ARPA funds gave us a temporary Band-Aid to really help with the complex care of pediatrics, but the adults were left out. And this is a significant concern. We're asking today that you increase the rates for adult complex care nursing to be the same as what it is for pediatrics. These individuals who come home from the hospital from places like CCMC, Yale Hospital for Special Care, are babies. They live safe at home for many years with the around-the-clock nursing services, keeping them out of the hospital, keeping them out of institutional care, which costs $9,000 a day, whereas in-home care costs about $1,000. What happens is at this point, as soon as they turn from age 18 to 19, suddenly their funding goes down by 20%, more than 20%. We're asking you to make that level the same, and we're asking you to please make those new rates that were implemented through the ARPA funds permanent. Those are currently temporary and we need them ongoing. Just as an example, who these people are that you're serving through this adjustment, Amelia was born 11 weeks early at just 1 pound 7 ounces. Her twin brother did not survive. Amelia fought to survive through multiple surgeries and a 100-day hospital stay before she could finally go home. As a result of her early birth, Amelia has cerebral palsy and chronic lung disease. She's wheelchair bound, nonverbal, needs oxygen with BiPAP to breathe, and receives respiratory suctioning and nebular laser treatments every 2 hours. She's completely dependent on the care of others to survive, but with the help of in-home nursing care, Amelia is thriving. She is 20 years old, and so her funding for people like her goes down once she turns 20. I hope you will consider raising the rates for in-home adult extended complex care to the same level and keep it permanent. Thank you very much. And I hope you all have a good night.
Thank you, Coco, for your testimony, and thank you for sharing Amelia's story.
Thank you.
Next, we have number 175, Richard Framagelli.
Hello, good evening, everybody.
I'm sorry if I got your name mispronounced.
Well, everybody does it. That's okay.
Thank
so
you.
It's Richard Framiglietti. My name is Richard Framiglietti, and I work at one of the 5 independent living centers in the state of Connecticut. And I'm here to speak in regards to House Bill 5037 for adjusting the state budget. Of course, I'm here today to ask the state of Connecticut to increase its funding to the state's independent living centers by $1 million so that we can continue the work that we do. I work for the Center for Disability Rights in West Haven, the independent living center that covers the New Haven area, counties up the shoreline. I I started out as a community advocate. I accepted a position for the first nursing facility transition project as a transition coordinator. And then I was a Money Follows a Person transition coordinator supervisor. Now I serve on the core side, and I'm a consumer advocate and programs manager. Today, I just want to speak about some of the extra stuff that the centers do. I received a call from a consumer in January. He was frustrated. He was very anxious. He was angry. His primary care physician had informed him she can no longer provide him with his psych meds and that he needed to find a mental health provider. So they left him with a list of providers to call. Through his frustration, he was told that they were at capacity and they couldn't accept him, or he had a very long wait. What made matters worse was he needed to do interviews over the phone or by video, which he was not set up to do or did not know how to do that. I was able to calm him down, and over a series of phone calls, and still today, well, actually, I should say yesterday, we finally have an appointment with the doctor who can prescribe his medication on March 10th. And only because of the center's interaction, where we were able to set up an email so that he can get that appointment for his telehealth conference. And that we hope after March 10th, he'll begin to get his medications. He was hung up on. People refused to help him because they didn't have the patience to deal with his frustration and his anxiety. I received another call from an individual who received a severe decline due to muscular dystrophy. He was walking with the cane, and all of a sudden, he was a Hoyer transfer. He needed to complete a 5-year look back in order to apply for a waiver. Long story short, he needed to get a Hoyer lift, an electric Hoyer lift, because his girlfriend could not lift him in and out of bed, which he could only get out of bed when she was home. He was able to, with our assistance, to locate through Facebook a $3,000 hospital-grade Hoyer lift, electric. He was able to convince this person to donate it. The problem was how we were going to get it to him. So we used our funding, and we paid movers to deliver that lift to his home, and now he can get in and out of bed while he's going through this look-back process. So please, that's just 2 examples of what the centers, for the independent living centers, what we can do. Increase our funding by $1 million. We've been reduced year by year. Some years we've been zeroed out and put back for less. You've heard our directors speak about the numbers. You heard about all the money we saved. Fund us. Thank you.
Thank you very much, Richard, and thank you for sharing your client stories. It's very important. Have a good evening.
You too.
Thanks. Number 176, Dr. Jan Poson.
Hello, Jan Ponson, and glad to be with you. I'm excited to turn into a pumpkin at midnight, and I really appreciate all of you and the effort today and the time you're taking to hear all of us. So good evening, Representative Dayton and Senator Austin, Representative Walker, and honorable members of the Appropriations Committee. So as I said, I'm Jan Ponson, a child psychiatrist and the Vice Chair of Clinical Affairs at the Yale Child Study Center. And thank you for the chance to speak. So the Child Study Center is a department of the Yale School of Medicine and conducts research, provides clinical care, and is an education and training center. And we're also the coordinating site of Southern Connecticut for Access Mental Health. Through this legislation, we can improve the continuum of behavioral health care for children from prevention to intervention, and we strongly support prevention. However, these efforts will not meet the current complex needs of many children. Children suffering from high acuity needs require intensive in-community and outpatient services, and these services are now overburdened and hard to access. This results in emergency department and hospital-based care, thus overburdening this system. In a vicious cycle, kids are stuck on inpatient units or emergency rooms trying to access what is still unavailable outpatient and intensive services. This unrelenting surge in children's mental health has revealed weaknesses across the continuum and the availability of services and in the need for more clinicians, a larger workforce. And the numbers are staggering. The Child Study Center has had a doubling of referrals for outpatient care. Because of the workforce shortage, we are strained and unable to meet the demand for these critical services. As of now, and for the first time in our 100-year history, the Child Study Center has a wait, and it's a 3-month wait for outpatient care and a 4-month wait for in-home care. To increase access to behavioral health care, the state must strengthen existing support for outpatient services and improve reimbursement for behavioral health clinicians. We recommend a multi-pronged plan that supports a continuum of behavioral health care approach. And we urge the General Assembly and the Enrollment Administration to expand support for, as I said, existing outpatient services, including outpatient, intensive outpatient, and in-home programs for children and adolescents. Increase efforts around prevention, which would include strengthening Access Mental Health to support pediatricians who are in the front line of this crisis, expanding behavioral health services in schools, and developing an Access Mental Health care model for staff to seek consultation for behaviors, and workforce development. The limiting obstacle for workforce development is the poor reimbursement for behavioral health services. Fee-for-service payments from commercial payers and Medicaid are simply inefficient to sustain quality behavioral health services, especially in outpatient settings. Reimbursement is low, salaries are low, and clinicians pursue other healthcare specialties. This inequity is a disincentive to entering the field. In conclusion, there's a continuum of care for children's behavioral health, and buttressing this continuum is critical. No part can function without the other. The Yale Child Study Center urges you to direct additional resources, including payment reform for in-community and outpatient services. And I'll leave it there, and thank you all very much.
Thank you, Doctor, for sharing that information about the behavioral health services. Appreciate your time this evening. Number 177, David Robin, or Robin David, I'm sorry if I've got that wrong.
That's okay. It happens. Good evening, Senator Austin, Representative Walker, and members of the committee. My name is Robin David. I live in Naugatuck, and I have been a PCA for 20 years. I like working with people, and I have learned so much from my consumers over the years. Caring for individuals with autism and or Alzheimer's disease has taught me so much more than I could even ever learn from a book. Over my 2 decades as a caregiver, I've cared for total care patients with quadriplegia, dementia, patients experiencing sundowners, and I've even cared for a Holocaust survivor. I currently care for 3 consumers, but I'm forced to cap my hours at around 25 hours per week so I can maintain my Husky eligibility. Limiting my hours means we're struggling for our basics. We've been faced with the danger of eviction twice in the past year, and my car is currently on repossession list. We currently don't have enough money to buy groceries and pay our monthly bills or utilities, and we are forced to rely on food banks like United Way and Unitech for food and rental assistance. We also don't have any paid sick days. I have severe osteoarthritis, which periodically debilitates me to the point that I can't do my job. Because we have no sick days, I've probably taken between 10 and 20 days off unpaid over the last 6 months. I've worked many more in pain because I couldn't get coverage. There have been times I've gone to work when I could barely walk or stand. What good are we to our consumers if we can't even care for ourselves? I am agitated and upset about our home care system that has left us as workers high and dry, while we have provided nothing less than the best of care for our consumers. Without an adequate wage of $20 an hour and health care insurance, my family and I are going to end up being evicted and homeless on the streets. And my husband's life-threatening medical condition, it could leave me without a husband and my children without a father. That's a scary day possibility, but one for us that is very real. Last week, I was proud to take a rest with 20 others to win a better future for myself and my fellow PCAs. Please hear us put forward the funding needed for us to get health insurance, paid sick days, and a livable wage. All we're asking is to be able to work to live instead of just live to work. Thank you for hearing us and have a great night.
Thank you, Robin. And take a deep breath. We appreciate your testimony this evening. It's really important. And thank you for the work that you do as a PCA. So many people depend on you. So thank you so much.
Thank you.
Next, we have 178. I don't see them in the waiting room. Madam Administrator, is Melissa Dima on the phone?
No, she is not.
Okay. We will keep her in mind while we move to 179, Karen Healy.
Can you hear me?
We can, Karen. Thank you so much.
Oh, thank you very much. Good evening, Senator Austin, Representative Walker, and distinguished members of the Appropriations Committee. My name is Karen Healy, and I'm a consumer. I am registered a voter in Hartford, and I'm a member of the Keep the Promise Coalition involved with Disability Connecticut, Rights of Connecticut. I spent most of my life institutionalized in Poughkeepsie, New York, and Connecticut Valley Hospital for self-injurious behavior, starting in 1989, and was discharged December of 2014 from CVH. I'm here to testify in regards of the proposed budget for adjustments of DSS. Before COVID, my dentist started working on an implant on my front tooth. I want to be able to smile again. Most of my work that I have had done is not covered by Husky C. I just had a permanent bridge put in, and it cost me $1,756 out of pocket. When all the work is done on my implant, it will cost me over $4,000 out of pocket. It recently cost me over $365 for a night guard out of pocket. Please fund expanding Husky's dental coverage so I can afford this work, which will allow me to smile again and prevent more expensive problems later on. In that light, I would like to thank Governor Lamont for increasing the Husky dental reimbursement rates, but I think there needs to be more of an increase in order to improve provider participation. There's still not a lot of dentists in Connecticut that take Husky C. This budget also does not address the income limits of Husky C, which forced me to be on a spend down to keep my insurance. I have a lot of medical needs would need Husky C to cover. The income limits make it difficult for me to keep my Husky C coverage. Even though I'm also in Medicare, Medicare does not cover a lot of what Husky C covers. Please put funding into the raising the income limits of Husky C so I don't have to worry about whether I can keep my coverage. I've finally been able to get myself in a good spot mentally, but it still hurts my self-esteem not to be able to smile because of my dental expense are so costly. I'd like to say thank you to the legislators for listening to my testimony and working on improved Husky C. Thank you very much.
Thank you so much, Karen, for sharing your story, and good luck with your dental work. I appreciate it. Next, we have number 180, Ann Turkington.
Hi, good evening. My name is Ann Turkington. I'm the Vice President of Behavioral Health for ECHN, which is Rockville Hospital and Manchester Hospital. And just to give you an overview, we have 80 psychiatric beds, of which currently 68 are staffed. We recently added 10 adolescent beds to try to help alleviate the children's behavioral health crisis in Connecticut. And we also stood up a dual diagnosis unit in November of this year to try and assist with the current substance use crisis. So we do treat behavioral health disorders and substance use disorders. We have 2 active emergency rooms at Manchester and Rockville Hospital, as well as the full continuum of care, including intensive outpatient, partial hospital, individual, group, and family treatment for children and adolescents all the way through older adults. So we have pretty extensive services. We also have a 36-seat fully accredited special education school within Manchester Hospital, where we treat special ed kids that have behavioral health disorders. So we are very committed to behavioral health in our service area, which includes 19 towns, but we treat people outside of our service area as well. We are very happy that this money is being dedicated to behavioral health. Within our hospitals, we have been on the front lines since the beginning of this pandemic, and we've suffered greatly from COVID outbreaks on units where we could no longer admit patients, difficult to discharge patients with a positive COVID diagnosis, which created backlogs that could last up to 2 weeks if you had a whole unit that had a COVID outbreak. We suffer from discharge delays, and this is especially evident for the PRTF level of care, the Resi Rehab level of care that we need for our adolescent patients that aren't able to go home. And we would definitely support increasing the beds at SolNet. There's always a waiting list, and it's very difficult to get kids into SolNet. But even a doctor frequently won't feel confident to discharge a patient unless they can go directly to partial hospital or intensive outpatient, and there are waiting lists across the board everywhere. We want to make sure that this is balanced and equitable, and we are hoping that we can get increased rates of reimbursement for outpatient services for hospitals and for our community providers like CHR. You have heard throughout the whole evening, and I've been listening since 2 o'clock, it is very difficult to keep and retain staff, to hire staff. There are just not enough human beings with behavioral health expertise to provide the kind of care that's needed at this time. So we're concerned about standing up for urgent care centers. We would urge the Appropriations Committee to consider piloting 1 or 2 to see if they're effective and gather data and use some of that money to support the services that already exist that don't have enough providers. The same thing for the crisis beds that are being proposed. We can do those services on our inpatient units with the added beds that Children's are putting up and the ones that we've put up, but we have to have throughput and be able to discharge to lower levels of care. So we're asking that you support that, and we also want to support the collaborative care model in primary care. We think that will be very beneficial to help people before things get super acute. And we have seen a large increase in acuity throughout this pandemic, especially in children and adolescents. So thank you very much for hearing me and for staying up so late. And I've been on since 2 o'clock, and God bless you all. It's been a long day. Thank you.
Thank you, Anne, for testifying and sticking with us all day. We really appreciate it. Next, 181, Erica Bromley.
Good evening, Representative Dathan, Senator Austin, and Representative Walker, and members of the committee. My name is Erica Bromley, and I'm the Juvenile Justice Consultant for the Connecticut Youth Services Association. I'm here today to discuss the governor's proposed budget. I would first like to thank the committee for its continued support of the YSB system. The proposed budget adds $2 million in the next fiscal year. The language stated in the proposed budget reads to provide funding to carry out a plan to be developed by the Department of Children and Families that shall include recommendations for youth service bureaus and juvenile review boards to expand coverage to all municipalities in the state, increase the adoption of evidence-based and quality assurance practices, receive staff training, and develop a data collection and reporting system. The YSB system is in need of support, no doubt, but at this juncture, more for the purposes of serving our growing number of youth who are in need. The proposed language suggests more system support opposed to direct services support. The good news is that there are currently initiatives in place that are addressing the system's components, such as a new data system, as well as a pilot for JRBs to strengthen that process. In addition, there's a landscape analysis currently underway, which will provide additional information about YSBs and JRBs that will help in strengthening the system and the outcomes for our youth and lead to more quality assurance. One of my roles is to support YSBs and JRBs across Connecticut with technical assistance. What I've been hearing as feedback from JRBs and YSBs throughout the state is that they are struggling to keep up with the magnitude of cases coming in and or the complexity of those cases coming in. This not only tells me they need more support, but that the cases are more difficult and require extra time. As we are painfully aware, the pandemic has impacted our young people in ways that we still may not know. The need to provide supports and services has only continued to grow for youth service bureaus. In addition, recent juvenile justice reforms have allowed the opportunity for more youth to stay in their community and receive services from their YSBs and JRBs opposed to entering the juvenile court system. While this is a direction we need to continue to move, the capacity of the YSB system is waning. As more reforms have been put into place and the need for more services grows, the resources have not increased for YSBs or for the services utilized by those clients in the community. YSBs are feeling the strain of a lack of staffing needed to adequately support cases coming into their YSBs and JRBs. As behaviors are removed from court jurisdiction, they are filtered to the community, specifically YSBs and JRBs. On top of already handling delinquency cases, status offenses were all removed from juvenile court jurisdiction and replaced with a pathway to the YSBs. In addition, there are current proposals within the JJPOC that would add more cases to the YSB system moving forward, and current pilot projects within the juvenile court system that are also sending more cases to the JRBs. With an increase in cases, there comes a need to increase capacity, which includes increased resources. The expectations of the state's juvenile justice reform efforts have largely fell on YSBs and JRBs, but without substantial support. Investment in these changes must follow, as we need to continue to reduce the amount of kids entering the system by providing them with adequate and appropriate community-based services. Funds for the YSBs, the JRBs, and the community-based diversion system must be a priority if the state wants to continue to prioritize diversion and community-based services for youth. Again, I thank you for your time at this late hour. I did have a much longer testimony that I submitted that has additional information if anybody is interested. Thank you very much.
Thank you, Erica. We have all of the testimony on our website, so we appreciate that. Next, we have 182. I don't see, that would be Faye Hargrove. She's a PCA. Is she on the phone somewhere? Madam Administrator, is she checked in?
No, she has not.
Okay, we'll move on to 183, which is Rich Luby.
Thank you. Evening, everyone. I'd like to thank each of you for taking the long hours here and allowing me to speak. My name is Rich Luby. I'm an individual with the abilities of cerebral palsy and obsessive compulsive disorder. I have many lived experiences that showcase the essential need for an increase in Connecticut state funding for all 5 of our independent living centers, ILCs. Thank you for your past support, and I ask that you increase funding for the ILCs by $1 million annually. I am an emergency preparedness program advocate at Independence Northwest, one of Connecticut's 5 independent living centers. We are non-residential. We serve people with all types of disabilities and of all ages. Our primary goal is to provide the necessary resources so that individuals can live their most independent lives within their own communities. My specific program was created in direct response to the current pandemic. Our mission is to ensure Connecticut residents with disabilities have a seat at the strategic planning table before, during, and after emergencies. In 2004, the governor appointed State Independent Living Council set a base level of funding for each ILC at $550K per year. In the past 17 years, the state has never achieved this recommendation. In fact, state funding has been reduced. In the last 35 years, cost of living increased 200%, resulting in deficits on top of the reductions, which forced ILCs to cut back on towns we serve, lay off staff, reduce salaries, and institute waiting lists. In comparison, New York ILCs are state funded at $335K each, and Massachusetts $645K each. Connecticut ILCs are at a much lower $92K for each. Underfunding our centers is the wrong allocation of financial resources, and doing so would more than likely cost the state far more money in years to come. In the simplest form, if you do not spend the money up front to ensure the individuals with disabilities are provided the resources to develop and build independence, then you are left with many capable members of society now dependent on other state resources, Medicaid, for example. Proposing to maintain ILC's current funding, or worse, cutting resources, keeps the disability community more reliant long-term on state-run programs. Fund us, invest in us, allow the centers to foster the importance of individual independence so that a once dependent community can provide a return on the state's investment. I urge you to increase the funding to our ILCs by $1 million or more. Once again, thank you so much for your time tonight, and thank you for the time for letting me speak.
Thank you so much for speaking and sharing your story with us.
Thank you.
We appreciate it. Number 184, Christine Foster.
Hi, good evening. Thank you so much for your time and consideration tonight. My name is Christine Foster, and I am the Director of Crisis Counseling at Safe Futures. We are a nonprofit organization that serves victims of domestic violence, sexual assault, trafficking in southeastern Connecticut. I'm here tonight because Safe Futures, along with the Connecticut Coalition Against Domestic Violence, is requesting $1,440,000 in annual state funding to cover the cost of a full-time child and family advocate for each of the state's 18 domestic violence service organizations. At Safe Futures, our child and family advocate provides vital services to families impacted by violence. These services include ongoing safety planning and counseling with children, parental education that includes information about child development, the effects of trauma on children and their behavior, the strategies that parents can use to help their children cope with stress and support their development of healthy relationship skills. We provide research-based interventions like Circle of Security parenting courses and Camp Hope, a camping and mentorship program based on hope research that aims to mitigate the negative risks associated with trauma. We provide McKinney-Vento services, which includes coordinating with school districts, McKinney-Vento liaisons, and enrollment staff to minimize the educational disruptions for students experiencing homelessness due to domestic violence. And that's only some of what we do. Safe Futures receives $11,500 in federal pass-through money, which funds only a quarter of the current salary for this position, forcing us to turn to private grants and fundraising, which simply does not provide enough to meet the complex needs of our community's children impacted by domestic violence. Last fiscal year, Safe Futures provided services to 890 children, 178 of whom lived in residential programs like emergency shelter or transitional living. Childhood trauma disrupts neurodevelopment and leads to the adoption of maladaptive health behaviors, which puts children at high risk for severe and potentially lifelong problems with their physical health, mental health, and interpersonal relationships. These children are more likely to develop depression, anxiety, substance use disorders, cancer, diabetes. They're more likely to become victims or perpetrators of domestic violence as adults. But domestic violence does not have to define their future. With evidence and strength-based services provided by child and family advocates, we can break the generational cycle of family violence and offer hope, healing, and a brighter future for children impacted by trauma and domestic violence. Thank you again so much for your time.
Thank you very much, Christine, and thank you for your work in this important area. Next, we have 185. I don't see him in the waiting room. Jose Riviera. Madam Administrator, is he on the phone?
No, he is not.
Okay, great. Thank you. Next, we're going to go to 186, Carl Schiesel.
Thank you, Representative Dathan, Senator Austin, Representative Walker, members of the committee. I'm Carl Schissel of the Connecticut Hospital Association. I want to begin by thanking you for making behavioral health a priority. Our written testimony details our specific concerns, but let me start by saying when spending on behavioral health, we'd like you to focus first on the waiting lists, and let's consider inpatient psychiatric care. Between February 1st and February 21st, the number of patients waiting for inpatient psychiatric beds in emergency departments statewide grew from 77 patients to 117. Yesterday, there were 118 stuck patients in our EDs across the state. Of 48 children, 22 were in Connecticut Children's, 9 in Yale New Haven Health System hospitals, 4 in New Vance Health hospitals, and the remaining 13 in other hospitals around the state. Of 70 adults, 36 were in Yale New Haven Health hospitals, 13 in Hartford Healthcare hospitals, 7 in Trinity Health of New England hospitals, and the remaining 14 in other hospitals around the state. The point is, it's a lifespan crisis and it's a statewide crisis. So funding for a new inpatient psych unit at Connecticut Children's is great, but the governor didn't propose to add additional inpatient psych beds anywhere else, and hospitals need more help. And here's one way that you may be able to help us. The governor is proposing to invest up to $25 million to develop 2 new levels of care: behavioral health urgent care centers for children and crisis stabilization units. Honestly, we have serious concerns about the sustainability of funding new models of care with one-shot federal revenue. So here's our idea. Instead of investing $20.5 million in 4 behavioral health urgent care centers, as proposed by DCF, maybe you could invest $10 million in a pilot program and put 1 or 2 of those centers in high demand areas, and then refrain at the moment from investing $4.5 million in the other new level of care, the crisis stabilization units, and invest those unused funds. That's the $10.5 million plus the $4.5 million, so that's $15 million to expanding inpatient psych bed capacity. And the way you can do it is by offering additional capital assistance to any hospital that's committed to dedicating additional space, equipment, and workforce to increasing the number of inpatient psych beds. Massachusetts offered hospitals a one-time supplemental payment of up to $150,000 for each new psychiatric bed and a temporary supplemental payment rate of $330 a day for new child and adolescent care provided. Perhaps Connecticut could make similar investments to resolve the current crisis. We also ask you to increase Medicaid rates for post-hospital services, those provided both by hospitals and our community partners. I'm talking about intensive outpatient programs, partial hospitalization programs, and other outpatient services, including home care. In summary, bolder financial incentives are needed to eliminate the waiting lists and get the people the care they need. And before I close, I also wanted to thank you for your support of gun violence prevention initiatives. We did some tremendous work together over the past few years, and we're looking forward to continuing to work together in that department as well. So thank you, everyone, and I'm happy to take any questions. Good evening.
Thank you very much, Carl, for your testimony this evening. We really appreciate it. Next, we have 187, Ann Wilson.
Good evening. Can you hear me?
Yes, we can. Thanks.
Thank you. Distinguished members of the Appropriations Committee, my name is Ann Wilson. I speak to you this evening as the daughter of elderly parents who benefit from home care services, as well as being the client services manager for Companions and Homemakers, which is one of the largest and also longest running non-medical home care agencies serving the entire state of Connecticut. And we have also provided the Medicaid services for clients here in Connecticut since 1990. I'm here this evening to talk with you about the financial crises we have faced over the past several years and that we continue to face, making it difficult for us to continue to sustain the services we provide, support our caregivers, and bring the much needed care to the elder members of our community. Agencies like mine provide non-medical care to not only hundreds, but thousands of Connecticut residents, and we employ thousands of caregivers. We provide services like companionship, homemaking, and personal care services. We provide these services 24 hours a day, 7 days a week, 365 days a year. We provide them during inclement weather, and we've done so throughout the COVID pandemic. The services that we provide are considered a gateway. They often help to identify, working with sister agencies and healthcare providers. Nutrition, we're in the home, we're sort of that first line of defense. So we're there to help identify nutritional deficits, changes in physical condition, cognitive decline, because we're getting to know these patients day in and day out as clients of ours in just serving their daily activities and daily functions. We serve the critical purpose of helping older adults also accept and acclimate to having such important services in their home that they may need over time, thus avoiding more costly institutional options. Some view our services, unfortunately, as non-essential, but on the contrary, what we do is absolutely essential. Without these services in place, many older adults would not be able to get out of bed. They could suffer the discomfort of incontinence. Some will be unable to prepare meals or go grocery shopping or get to doctor's appointments. Non-medical home care allow people to age in place with dignity. The non-medical industry is really at a painful crossroads at this time. Though 1.7% of the state funding was approved through the legislature at the last session, we on the non-medical side have yet to see a penny of that. We've gone without increases for years, while costs to deliver care, including recent increases in minimum wage, have driven a number of our agencies to stop providing these services altogether. The reimbursement rate for companion care in Connecticut right now stands at about $16.88 per hour, while minimum wage is $13 and will increase again this year to $14. In Arizona, by comparison, where minimum wage is $12.80 per hour, the Medicaid reimbursement rate is $22.84. A disparity like this through different states, it's hard to swallow. Our caregivers are making minimum wage, are not minimum wage workers, and they demand more. It's hard for many of those who have teenagers to see those teenagers making more than they are, to bag groceries while they're in the home caring for somebody and helping them to be able to get up and about, as well as take care of their own personal hygiene. And I don't need to reiterate the challenges that COVID has presented to all of us. Honestly, our industry is battered and it's bruised as a business, and it's fast becoming impossible for us to continue to provide these services. If these services disappear, the results would be catastrophic, not only for the elderly who rely upon them to function, but to the state, whose costs for institutional care would skyrocket. I'm asking that the promised 1.7% in reimbursement rates be put into effect immediately. I'm also asking that the promised ARPA funding that the non-medicals have yet to receive be put in place by March 31st, so we can remain viable, and so that the state also doesn't lose the 10% funding match that's supposed to be coming federally. I'm asking this on behalf of not just my agency, but all non-medical agency providers that continue to fight the good fight on behalf of older adults, our caregivers, and most importantly, my parents, my aunts and uncles, and yours as well, who need these essential services. Please find a way to support your elderly and the agencies who serve them in a meaningful and sustainable way. Thank you so much.
Thank you, Anne, for your testimony and the work that you do to serve Connecticut's older generations. We appreciate it. I'm going to turn over the chairship to Representative Nolan. We are at 188.
Well, good evening, everybody, and thank you for holding in there this long. And Mr. Woods, I see you're next, and I see you on screen, so you may proceed.
Thank you very much, Representative Nolan. Good evening, Co-Chair Senator Kathy Olston, Representative Tillman Walker, and Representative Gilchrist, and other members of this committee. My name is Andrew Woods, Executive Director of Hartford Communities That Care, but I'm also the statewide director of the Connecticut Hospital Violence Intervention Program Collaborative. Today, I'm honored to offer testimony to the Appropriations Committee in support of allocating funds in support of Public Act 2136, an act concerning the availability of community violence prevention services under Medicaid. Speaking for those who have spent decades countering community violence on the front lines, it is clear that investment in prevention has always been insufficient and uncoordinated. For this reason, on behalf of the Connecticut HVIP Collaborative, which implements multidisciplinary medical and community-based teams that do hospital-based violence intervention program work in Hartford, New Haven, and Bridgeport, I first want to thank the members of this committee, including House Speaker Matt Ritter, Representative Gilchrist, Josh Hall, Senator McCrory, and the entire General Assembly for the unanimous bipartisan efforts last year to enact concrete measures for preventing gun violence. We honor and respect the foresight reflected in Public Act 2136, which sets up a system for Medicaid reimbursement of services that trained and certified violence prevention professionals, we call VPPs, provide to residents exposed to social and environmental stressors that place them at higher risk of being victims of violent crime. As the director of the Connecticut HVIP Collaborative, I am pleased to report that we have trained folks in Bridgeport, New Haven, and Hartford, and we are working collaboratively with the State Department of Social Services to define this Medicaid benefit, scope of service, fee structure, and other processes for DSS to submit their Medicaid state plan amendment for approval. As the Appropriations Committee considers the governor's budget recommendations, we strongly recommend it include a budget allocation for the Department of Social Services to fully implement this new Medicaid benefit. At this time, I would like to commend your attention to the December 21 report of the Connecticut General Assembly's own Gun Violence Intervention and Prevention Advisory Committee, which was formed under Public Act 2135, thanks to the leadership of Senator Moore and many of you. As chairman of that advisory committee, I delivered our hopeful 566-page strategic blueprint for preventing gun violence in Connecticut, with the observation that our state is entering 2022 as a national leader in this field. Our recommendations are detailed in the first dozen pages of this report. It's in the executive summary and offers many necessary steps for implementing a statewide commitment to gun violence prevention, intervention, and recovery. In my view, a sustained investment in prevention will cost us far less in the long run. And so thank you for your time, and I will be glad to answer any questions.
Thank you, Mr. Woods, for that informative testimony. We appreciate you hanging in there with us. Miss Adam, you are next. I see you 189.
Hi, good evening, Senators Austin, Kushner, and Ciccarella, Representatives Nolan, Dathan, Johnson, Walker, Abercrombie, and Betts, and members of this committee. My name is Suzanne Adam, and I am the Executive Director of the Domestic Violence Crisis Center, DVCC. DVCC, along with CCADV, is requesting $1,440,000 in annual state funding to cover the cost of 18 full-time child and family advocates at each of the state's 18 domestic violence service organizations. This amount will provide $80,000 per site to fully fund one full-time position, with a salary of approximately $56,000, plus full-time benefits and funding to support a supervisory position. DVCC is counted as 2 sites. We have offices and safe houses in both Stamford and Norwalk, and this funding would allow us to hire 2 full-time child and family advocates. There is currently no state funding to support this critical position. to work with children exposed to domestic violence, something that unfortunately has only increased since COVID-19. DVCC receives $11,500 in federal pass-through money, which funds only a quarter of the current salary for this position. We are forced to seek funding for our child advocate through private grants and our own fundraising efforts. At DVCC, this one full-time child advocate splits her time between 4 locations, our 2 safe houses and our 2 offices. DVCC's Child and Family Advocate works with children and parents to develop age-appropriate and child-specific responses to trauma and violence. In fiscal year 2021, our advocate worked with 197 clients, 116 children, and 87 parents. The isolation of the pandemic, coupled with the trauma of living with domestic violence, has resulted in serious mental health issues for many of our children. As a result of DVCC's counseling, 80% of the children are now able to identify healthy coping skills. 80% of the parents reported seeing positive changes in their child's coping skills. And 100% of those children now have an age-appropriate understanding of domestic violence dynamics. They understand that violence is never okay and that the abuse is not their fault. Experiencing domestic violence in the home can be traumatic for children, but something that does not have to define their lives. With proper clinical support provided by child and family advocates, it is something that can be overcome to create positive generational change. Our request of $1.4 million is less than 0.01% of the overall state budget. For such a small investment, we can have tremendous impact. We urge you to invest in strengthening outcomes for the most vulnerable, children experiencing domestic violence. Thank you so much for your time.
Thank you, Ms. Adams. We appreciate you also hanging in there this evening. And the next, we're going to go on to Heather Latora.
So Representative Nolan, Heather Latora needs to accept the promotion from attendee to panelist in order for her to speak. So Heather, if you would like to speak, you need to allow yourself to be elevated to a panelist. You'll get a little message, Heather, and you need to accept. There you go.
All right. Are you there, Heather?
I'm here. I'm here. Sorry.
Okay. That's
Thank
all right.
you.
You made it. Go ahead.
I made it. Phew. I'm before tomorrow. Good evening, Madam Chair and the members of the committee. My name is Heather Latora, and I've been working at Marrakesh Incorporated for the past 36 years. Thank you for the opportunity to provide testimony on the state budget, and thank you for your consistent advocacy over the years. Marrakesh is a multi-service organization, and we support people with developmental disabilities, youth and adults with mental illness, people with acquired brain injuries, youth in the foster care system, and more. We run 23 group homes, of which a few are ICFs for people with intellectual disabilities. These are Medicaid-funded programs. I know it's almost time to wrap up, and I'm tempted to say ditto to what you've been listening to for the past several hours, but I feel I must articulate the serious issues we are facing, what we desperately need to stay in operation, and why. We have struggled through years of frozen and inadequate rates for service, room, and board. We're facing unprecedented staff shortages like everyone else, and as a result, there are many families and individuals on emergency lists for placement that have to wait. Making matters worse, we must operate these ICF programs at a deficit. What is needed is a new reimbursement system where rates are never frozen, but determined by level of need, inflation, and most importantly, competitive wages that are sufficient to sustain families. There are 170,000 Connecticut citizens working for private providers, 700 at Marrakesh alone. Outcomes, satisfaction, and performance should also be considerations for determining rates. Why is this needed? The homes for the people we support need routine maintenance and updating, no difference than your own. Our vehicles need to be maintained and repaired, and we need to pay for gas and oil. The cost of going bowling, visiting museums, buying food, traveling, all become more expensive over time. There are times when the people we support face crisis situations or medical issues that require extra assistance or more expertise to address. Rates cannot be frozen if we are to live up to our responsibilities of providing person-centered services. Frozen rates sound horrible. Frozen rates should be safe for non-essential items and services, not for people. Frozen rates are, to me, they indicate unimportance, and our services are essential and important, our staff and the people we support. Finally, our ICF homes were mandated to provide the same increases that the group home settlement demanded last year, yet our increase was 4.5%, not the 9% we needed for this. This fiscal year's loss so far, due to the fact that DSS did not financially honor the minimum wage increase in our ICF programs, is putting them in jeopardy. If by July it's not rectified going forward, they will be impossible to run as funded currently. We are looking for the 8% COLA in fiscal year 2023. And please understand how important that is for our extremely essential state contractors. Thank you for your time.
Thank you, Heather, for your time and hanging in there with us. And the next speaker is 192, Ms. Yusa.
Hello.
Hi.
Hi, Representative Nolan and committee members. Thank you so much for staying up late to listen to me. My name is Roshni Yusuf. On behalf of the 200 student activists at the Center of Youth Leadership at Bryan McMahon High School in Norwalk and the Mayor's Youth Leadership Council at Stanford High School, we support House Bill 5037, particularly the section of the bill that makes domestic violence, child and family advocates a 1.4 million line item in the annual budget of the Department of Social Services. Our members have worked on domestic violence and teen dating violence issues for years. Our volunteer time in safe houses in Stanford and Norwalk has allowed us to understand the trauma experienced by children and the work done by child advocates as they help children cope. Our work continues to this day. Just last week, we hosted a podcast with staff from the Domestic Violence Crisis Center, and in January, we led a press conference to launch Dating Violence Awareness Month. During the press conference, we noted several aspects of domestic violence. It is considered the strongest risk factor of transmitting violent behavior from one generation to the next. According to the Child Witness to Violence Project, domestic violence psychologically robs young children of both parents. Young children who observe their mothers being abused grow up with the role model of intimate relationships in which one person uses intimidation and violence over the other person to get their way. And they experience academic and social emotional turmoil, which impacts their ability to thrive. Then you have people my age who experience dating violence and are often forced to leave their childhood prematurely to shoulder the parental responsibilities that our mothers, due to ongoing abuse, cannot. Into this emotional void steps a child and family advocate. Day in and day out, the advocates work with children and families that live on the outskirts of hope, and whose ability to restore that hope has been severely tested by the indignities they have experienced. The emotional void is the workspace of the advocates. According to the Connecticut Coalition Against Domestic Violence, over a recent 4-year period, the 18 domestic violence agencies served an annual average of 4,300 children. But the state of Connecticut does not provide funding for any of the advocates that work with children and families from Hartford to Greenwich. Secure annual funding from the state will allow each advocate to support parents as they help their children manage their emotions associated with domestic violence and work with children toward an understanding of why they have been put through so much turmoil and been robbed of so much. Thank you.
Very well spoken, Ms. Youssef.
Thank you.
Thank you very much for hanging in there with us, and we're just proud to know that you're speaking on behalf of all those other students. And we have a hand raised from Rep. Sims. So Rep. Sims, you have your hand up. Go right ahead.
Thank you, Representative Nolan and Rashani. I just want to say hello and thank you for staying in there all night just to testify. We truly appreciate your advocacy, and we certainly look forward to hearing more from you and your group of folks from Norwalk. So thank you very much again for being here tonight.
Thank you so much. It was my pleasure.
Thank you, Representative Nolan.
Thank you. Any other questions?
So Representative Nolan, we're going to bring
Yes.
Madam Administrator on to tell us about what we have tomorrow.
I think we got, is there 2 more left?
No, there's nobody left.
Oh,
We're all done. We are done.
Okay.
We are done. Madam Administrator,
Madam
what do we have going
Administrator.
on tomorrow?
Tomorrow at 10 o'clock, we hear from 3 of the agencies under the Health Subcommittee. We're going to hear from the Department of Public Health, the Department of Developmental Services, and the Department of Mental Health and Addiction Services. That's at 10. And then at 2 o'clock starts our public hearing, and we have over 200 people registered.
Are we over 300 yet?
No, we're in the 230s, I believe.
Okay. All right. So that's a little bit more than we had tonight, about 40 more than we had tonight. So everybody get some rest, and look forward to seeing you all. And thanks for everybody stepping up and working with us to cover the chair. Works out really well. And Madam Administrator, thanks for you and your staff. So everybody, let's get a good night's sleep, and we're done before 11:30.
Good night, everyone.
Thank you.